A very good morning to all of you, all the participants. Welcome to the second day of two-day National Seminar on Mental Health of Youth during Pandemic, Adjusting and Coping with the New Normal, sponsored by ICSSR and organized by Department of Psychology, Usmania University. So welcome all to the second day sessions. As participants are joining in, we will start the session very shortly in just 5 or 10 minutes. Okay, thank you.
Good morning to everyone. I think yesterday all the sessions I have enjoyed and try to get some inputs from all the resource persons, esteemed resource persons. And today we'll be starting the second day. Today also we have esteemed speakers from different corners of the country. And we'll be ending in the afternoon around 3:30 to 4:30 with the valedictory session. So we'll be starting the program within a couple of minutes. We are just waiting for the other participants to join. So just stay tuned and we'll be starting the program within five minutes. And in case if you have any friends of yours to join, if you know them, just give them a call stating that the program would be starting. Already our resource person has been waiting here. So I think it's not the right thing to keep the resource person away. So quickly, please join. If anyone would like to join, we'll be starting the program within a couple of minutes. Deepti, I think we can start the program. Hello.
Yes, ma'am. Yes, ma'am. Yeah. So yeah, good morning again. So we will be starting our session now. Madam is already here, a resource person. So I request Muskan. Are you around, Muskan?
Yes, ma'am.
So Muskan to introduce our speaker for the session.
A very good morning to everyone present here. My name is Muskan Amreen Sheikh, and I'm a postgraduate student here at Osmania University. And I have been given the great honor to introduce one of our esteemed speakers for this particular session, Dr. Rekha Vagani, ma'am. Currently, Dr. Vagani is working as an assistant professor, research coordinator, and counseling center in charge at Amity Institute of Behavioral and Allied Sciences at Amity University, Mumbai. She has completed her PhD thesis from University of Delhi and MA in clinical psychology from Dev Sanskriti Viswavidyalaya, Haridwar, Uttarakhand. She was a UGC Junior Research Fellow during her PhD program at University of Delhi. Before joining Amity University, Maharashtra, she taught UG and PG courses at Banastali University and Daulat Ram College. She has published and presented many papers in national and international conferences. Her research areas are spirituality, suicide prevention, and positive psychology. She is also providing training on self awareness at various institutions and communities. She is also an active member of Gayatri Parivar, where she takes many non-profit work like providing psychosocial support to people in need, and leading various awareness campaigns. As an active social worker, she has delivered expert talks at various community levels / non-academic organizations on health, stress management, parenting skills, child psychology, etc. at various places of Mumbai. She has recently developed an online open education course under Open Education for Better World under UNESCO. She also ran a center for 3 years before joining teaching profession for children and parents, a program called Child Excellence Program. Thank you so much for being here, ma'am, and we're looking forward to learning a lot from you.
Thank you, Muskan. The intro was so long, I thought it is for someone else because as a mindfulness trainer, I am in present. So let's come together and join our hands in this initiative, which is taken by Osmania University. It is really a very, very good topic because most of us have forgotten that we have to think about the after effects of COVID-19 and how it can be really thought of and managed by all of us. So I have prepared a very small presentation. The purpose of presentation is that we can just understand some of the ideas. And we can also, the presentation is based on the current research context, which is the some of the researches which is recently published and indicating something which we can definitely discuss and understand. So just give me a minute. So yeah, so I hope everyone can see this presentation.
Yes, ma'am.
Okay, thank you so much. So I have chosen this topic not randomly, but because I was thinking in this regard from last 4 to 5 years, and I am in Amity from last 7 years, and we have a huge number of students in our department in psychology also, as well as at university level also we have a huge number. And being a psychologist and being a counselor, there I means I've been approached by many students, even by faculty members, and that actually shaped my understanding towards how we can really create a safe environment, how mental health can be promoted, and can be mental illnesses, how it can be prevented, and how the well-being can be enhanced. So these are some of the things I was always thinking, and it was also motivated by my research topic because my research was mostly in positive spirituality and health psychology, where I believed more of in promotion and prevention than thinking about how we can diagnose and something like that. Definitely diagnosis itself has a very important role to play, but the other dimension or the other perspective also has to be developed. So, in my teaching experience and in my interaction and in my counseling profession, these things actually created some kind of, you can say, gap that the kind of problem which are coming up, the way student need help. Some of the students, they wanted only 1 hour with the counseling and counselors, and they were always like, yes ma'am, the ones this session has helped us, and like that. So then this actually helped me to come up with a plan. And then we introduced 3 year from last 3 years we are running a program. So we introduced a program, buddy program, in our university. There are another 2 programs which are already running, that is mentor mentee, which is I think running in most of the universities in India, and also counseling center, which is actually actively there in our university. But other than that, we introduced some other program, that is buddy program. And before presenting what is buddy program, how from last 3 years, how we have standardized that, and how it is really helping all of us in Amity, I think by presenting the finding of that program will definitely help all of us to understand that how, without sources and utilizing the sources which is already available, how we can really promote mental health of the students, specifically in HEIs, in higher education institutions. So before going or before presenting this buddy program, I would like to present some of the recent researches or recent data which is published by WHO, by UNESCO, and also in some of the journals. Our Indian researchers, and some of the researches have been published from NIMHANS also. So these researches, if we see, they suggest that the COVID-19 has actually disrupted a lot and interrupted all students' academics specifically. And it was so sudden that it was very difficult for a country like us to cope up, because suddenly we have to go on online form, and then there were some they were struggling in skill building, that how the internship will take place, how we will match up with the offline internship which our seniors have done, and like that. So there were many issues which come up. Along with that, there were many fatalities also which was happening in students family, in our family. That also was another mental, you can say, emotional burden which students were going through. And then many things together have increased already. If we see the data of Indian mental health for students, we can see the number is really high, and the common mental health disorder, which are depression and anxiety, which are really increasing day by day and reported in young people. After COVID, the surge is actually, it has increased a lot. And there's a recent study published in JMIR by Indian scholars. They screened 324 students, and they found that out of that, 223 students, they showed high fear of COVID-19, and they showed moderate to severe depression and mild to severe anxiety. Another scoping review where Pandya and Lodha, which is published in Elsevier, they really did a very good scoping review where they collected all the published studies which was published during COVID-19 and almost after the COVID-19, where they showed that how young people between 15 to 24 has been affected adversely because of this COVID-19. Now, in that article only, and some of the other article, when I've gone through, I found that academics of the college students, that was one of the reason which most of the students, they have faced issues. And the one of the problem was the routine, which was suddenly changed, because we come from a conventional educational system where we have to get up in morning, we have to go into college at 9 a.m., come up, and we end our college at 4. And there is a passive learning in terms of that we know that we are not supposed to think about the lectures. The lecture will take place, there is a specific schedule and syllabus which is given to us, so there's a routine for each and every student. Now that routine got disrupted because of this COVID-19. Internships was another challenge which I seen with my student, that they were really struggling, and initially there was actually a dysphoria that it will not be possible only, but later on they coped up with some or other thing. Skill building was another issue, that most of the students, they came, they interacted with most of with teachers, and they actually reported that, ma'am, our seniors actually, they got better exposure, and their skill was, they built better skill because they were doing their practicum in the lab. They were coming to the department. We didn't come to the department because of this COVID-19, so we don't know only how to do practicum and this and that. So many of the apprehensions they have shared with us related to skill building. Then there's some universities, actually there was a delay in completion of the degree, that also somewhere increased their apprehension that what will happen with their future job, how they will take admission. And there were many health complications also which they they were exposed. Other than that, mental of the college students, when mental health of the college students, when we see, so most of the students, they reported more negative thoughts during COVID-19 and after COVID-19 also. They reported that even the COVID-19 is over, the negative thought, the frequency of negative thoughts have increased, and there were more negative emotions like frustration, like anxiety, betrayal, and worry, which continued even after the COVID-19 phase is over. And they reported a disturbed cognitive functioning. Even recently, last week, we were discussing with the student, and some of the students said, "Ma'am, nowadays things have changed in my mind. I cannot concentrate the way I used to concentrate before COVID," and something like that. So many of the students, they feel it, and not even student. I myself as a teacher and many of my colleagues actually, they reported the same thing, that things have changed in their mind and things are not the same. Now, I'm not saying that only negative points are there, but then we are actually coming to a new normal. Now, we cannot say that the things which we have, the way we were there before COVID-19, we are same. No, things have really, really changed. Like one of the things, the change which we can see is that we are interacting now in Zoom. So even COVID-19 is over. Ma'am has called me and said that there is a session in so and so, and like that. And now we are interacting in Zoom because now we all are comfortable with Zoom and with meetings, and we are doing our household things and also simultaneously taking all those things. So there are some changes which have taken place and which are positive, but simultaneously we have accommodated these things with in our old routine. So that is a summary which I wanted to give before I thought that before presenting the buddy program. Now coming to what are the initiative which is taken by Indian government or HEIs and NGOs. So there were many initiatives which were taken, and those initiatives are really positive because now most of the people and the students, even the parents, they are aware that there are toll-free numbers, and some of the students who had confidentiality issue that no, I cannot go into counseling center. So in our university, we have a counseling center. So many of the students say, "Ma'am, can it be online?" Before COVID, it was not possible. We used to say कि नहीं, online नहीं हो सकता है, because that was not so comfortable for all of us. But now we have also shifted to online mode, that counseling session even after 5. So if there are some students who have given their preference for online mode, we have said that okay, now your time is 5 to 7. Those who want to take session through online mode, they can definitely approach us. So then we kept a different schedule. Now it is possible only after COVID-19. So this is another positive change which took place, and that is because of the many other things which happened and which was done by many NGOs, by government agencies. So there were many toll-free helpline numbers which were issued by many ministries. I have named some of the ministries, like Kiran helpline was issued that time. There was many advisory issued by UGC, by UNESCO. Some of the books which were distributed on WhatsApp, we saw all these books. There were many webinars and lecture, like this lecture series is also one of the part of that. So these kind of webinars were very common that time. There are chat boards which are now actually, we have recently come across with new chat boards. So now the chat boards are very common for all of us to, like if we go on the any website, there will be a chat board where we can chat that what is the problem, how, and there will be some kind of even screening which the chat with the that will be embedded into the program. So like these are some of the things which happened after COVID-19 and during COVID-19. So the thing is that now we need to analyze that, okay, these initiatives were there. Now what happened after that? So there was a small article in Hindu where they actually published that how many people have really approached these helplines. So one of the example is by Kiran helpline, where they noticed that they got 13,000 calls, around 13,000 calls within 3 to 4 months of span. And then most of the calls were made by males, and and actually half of them were female. And majority of callers were in the age group of 15 to 40 years. And that is very alarming for all of us. It means even after the COVID-19 is over, we cannot say that things are over. There are many things which are there in our mind, and the mental health really, really got affected. Now, the thing is that we need to understand that how, after looking at this data, what could be the strategies which can be taken up. Now, what we are missing right now in the current scenario, what we have and what we can do. So based on my personal analysis and based on many reviews and many reports which I have read, these are some of the things which we can really uh, consider. One is that even if we say that UGC have given a guideline that we all have to have a counseling center, but there are very less counseling center in our country, and it's not available across the country uniform in a uniform manner. Let's say like the counseling center is there in that university, not necessarily it will be there in the another university, or if it is there, maybe it will not be standardized, maybe counselors will not be there, maybe the demand and the need will not be like at the par. So these are some of the issues which we can see. Another is that there is a still stigma in student, and despite I am coming from a private university where students are coming from a family where people say कि no, they are coming from high socioeconomic status, तो वहाँ पे stigma नहीं है, जबकि ऐसा बिल्कुल नहीं है. I have seen people coming from all the different status are having similar kind of a stigma still for the mental health. And after and specifically in psychology, students also have seen stigma. So they have some issues, and sometimes they say कि हाँ मैम ऐसा मेरी friend को था, and then sometimes they say कि are you talking about yourself, and say yeah ma'am, like that. So there is a still stigma going on in students and in parents. Sometimes students are ready, parents are not ready. It's very difficult for a student to tell the parents. Some of the students, they tell me, ma'am, I cannot inform my parent that I need a counselor or I need to talk to a psychiatrist. So these are some of the thing which is still there in our society, and that is actually promoting mental illness, not preventing. Then there is a less sensitization of mental health issues and its connection with academic performance. So let's say a student suddenly get depression. It suddenly means there is a surge in the symptoms, and then because of that the academic performance get affected. Now it's difficult for a student also and for a parent also to understand how it is happening. So there is a less sensitization. It is not a student's fault, it can be a mental health issue, and then such kind of connections understanding is still not there. I'm not saying it's completely zero, but yes, it is still, it has to be there. So there are some of the online program. So there is a recent paper published on Indian mental health apps, which is there on our phones. And then in that app, when the researcher analyzed, they found that most of the apps are not standardized only. So these apps are made by some random people, and they're not standardized in terms of that there's no scrutiny that if I am reporting ideation, let's say high ideation, then there's no standardization that what has to be done next, how I have to be referred further, what kind of help I'll be needing, like that. So there is a lack of standardized, even if online programs are there. Then there is the screening and assessment which is taking place. That is, the ratio is actually inappropriate in terms of that the youth at risk is more in number than the kind of screening which is taking place. So that also can be increased. And there's a low coverage of mental health and preventive services in the community. So like in MAT, let's say we have a counseling center program. So then it's very difficult for any university or any this thing to increase the coverage of that, because there are less, you can say, frameworks available. However, WHO has given many good framework for how it can be really increased and how we can tie up with each other so that we can increase the coverages. And there are many resources which we have and we are not able to utilize it. So this is the current scenario. Despite there is a surge in mental health services, obviously after COVID-19, there are many helplines available. There are, even the parents and students, they know that yes, there are counseling centers available, psychiatrists is there. There are some of the agencies which really helps us, and there are many websites also. Even if we type on Google, it easily pop up in on our page. So despite that, these are some of the things which we still need to work. Now, what could be the possible pathways if we really want to cover this up as an higher education institution? So one is that parent and teacher, I think, are the great resource who can be trained as a gatekeepers, because they are the one who is going to be going to interact with the student and with their children. So being a psychologist, what I have perceived that since I'm a psychologist also, I'm a teacher also, so it's easy for me to, because I have that kind of framework that yes, this student must be having a problem, because suddenly the student is absent for, let's say, for some days, and after, when the student is coming to the class, coming with a very low energy, not showing interest in the class, and previously the student was not like that. So rather than judging that, I may call that student and says, what is wrong with you, what happened, are you having like that. So then most of the time the student says, yes ma'am, I was not keeping well, or maybe this is bothering me, or maybe this project is bothering me, or I'm not adjusting here, this and that. So that is the right time to channelize that students towards the counseling center or the buddy program or the other support services where student can really get help. But in other courses where I've seen that courses like engineering, other courses where teachers are also not trained, there the teacher really have an intention to help. They sometimes they observe and they say कि मुझे नहीं समझ आ रहा है कि हो क्या रहा है मैम आप बताओ. And then sometimes we tell the teachers, they say, हाँ you are right, that I thought it like that, but thank you so much, like that. So then I thought कि it's really important for us to really train most of the teachers who are there in higher education institutions, because it's very easy for us to interact with the student and in the classroom, and we can easily see some of the shift in their behavior, some of the change in their behavior, and it can really help some of the students who are really at risk. Then there are digital platform which is available by UNESCO. UNESCO has launched a program recently that is Open Education for Better World, and they are trying to trying to take more projects on mental health, where people in their regional languages can create some of the program for the parent, for the student, and for the other stakeholders, where they can sensitize about mental health. They can provide some kind of gatekeeping program or some kind of screening and assessment, some of the other, like how so that how they can be empowered. So there are many digital platforms where such institutions or such uh, people are coming, and they are creating such program which are easily available. One of the such program is developed by me also under that platform, that is on suicide prevention. There are many open resources training which is easily available, but most of us are not even aware that these are the resources which are freely available. And as a, if I am doing a PTM, let's say I am doing a parent teacher meeting in university setup, or I am sending an email to most of the parent, or maybe there is some kind of interaction taking place between the parent and the teacher, there such kind of links if sent in the email with along with the other information, I think it can be very good initiative, because these open resources training have lots of like there are small program, 1 hour program, 2 hour program. They really give us understanding about students' mental health, parents' mental health, some of the other thing which is really useful for them. There is a peer support and buddy program which I have adapted from other universities, and we have adapted it in context of India, and we are successfully running it from last 3 years, which the kind of the findings I'm going to present in this particular lecture. So such kind of program can be introduced, because sometimes not all students really want help from the counselors or one-to-one counseling. This one-to-one counseling is very time taking, and it's not easy for a counselor or a two counselor to actually interact with the student. And there are students who really need help in some other thing which is important, which is related to mental and academic equally. So in those particular areas, peer support system and buddy program can be very useful and effective programs. Other than that, there are many psychologists, and there are master students who are in their senior stage. Let's say they are in the 4th semester, and they show their interest that, ma'am, we really want to learn about counseling, how to talk, how to communicate. We really want to improve our communication skill. We really want to understand how to do the screening. So these are some of the things which they really need to be trained, because ultimately after master they are going to join some careers, and if they are trained right now in some of these things, through in the training program can be converted into some kind of mental health program or some kind of campaign where other students who are at risk can be identified, as well as these students can be trained, and some of the initial training can be given to these master students who can really deal with some cases which are at very initial stage, or maybe they just need some kind of support or some kind of understanding, or maybe at awareness level only they need some help. So that can be also done. There are now there's a possibility after COVID-19, because we are so much now aware about, acquainted with the apps, with the Zoom, with the other meeting, like e-counseling centers can also be set up. And some of the students who have already done masters, who really want to do internship for 6 months, sometimes the student take a break for 3 to 4 months because they are searching for PhDs, where they are trying to see some other options, and they are free. And the students come and approach us, "Hey, ma'am, we do not know what we need to do now." And if we have some kind of strategies like that, there can be e-counseling center setups where they can really provide their voluntary services over there. And some of the students who really needing those help can be channelized, can be regulated. And some of our notice boards, which is there in our university setup, can definitely be utilized for advertising some of the free mental health apps, some of the new updations on the courses, some of the toll numbers, some of the counseling center detail. Like on our notice board, we always some of the TISS ka jo bhi, those hotline number and that helpline number is always there. We have also in soft copy only initially when our student come, we circulate some of the information related to some of the free toll numbers, because we do not have any free toll number. That's why. So we utilize some of the toll number which is there in the Maharashtra, and which is there in the regional language. Now, after this background, I would like to present two program which we have already done in our university setup. And maybe the program which we have done, maybe it can help you, or maybe if you are already doing it, maybe you can definitely give me some feedback on that. Or if you are not doing it, then you can start such kind of initiative in your university or in your college setup. Definitely it can be done in school setting as well. So two prototype I'm going to present. One is buddy program. The name is buddy program in our university. Second is suicide prevention, which we developed a web-based intervention program and we named it as Hapatite. So I'm not going to present Hapatite today because it is very long and lengthy. So I'm going to present only buddy program, details of buddy program. However, I'll present some of the summary of what we are doing in the web-based intervention program and how it really helped our students. So coming to the buddy program. So buddy program was developed 3 years back in our university. We some of the teachers, we conceptualized this, and then we also standardized this program. So the primary goal of this program was to aid university students in various domains. So many of the students in our university, they come up with different places of India, and then they do not know the geography of the university. They do not know many things, and it creates so much confusion and chaos in their mind. So we thought that let's start this program. Another purpose of is to create a positive atmosphere for the students. So if a student is coming and they opt for a buddy program, so they will be given a buddy. So that buddy will help that student to understand many things about the university, so that the student should feel ki the student is welcomed, and whatever initial question a student have in mind, that can be easily answered by the buddy. Then so that we can make their transition very smooth, because there are many research which is published already and which says that if the transition of the student is not smooth in the university, it can lead to many mental health issues later in the adult life. Also, we wanted to reduce apprehension and worries. So initially, actually, when I became teacher there in our university setup, so what happened, many students used to approach me and say कि मैम पता नहीं कैसा syllabus है, मेरे को ये credit का नहीं समझ आ रहा, how to calculate this credit, what is 3 credit means, how to take this club, and why to choose this minor track, which minor track is good, like that. They had so many questions, and it was very difficult for a teacher to answer to all students. So that was also one of our idea too, because they are asking questions, but they are actually showing more of their, yeah. Okay, so they were asking question, but actually it was more of their apprehensions and worries which they are actually going to they were showing us. So we thought that there should be some kind of a program where student can really open up themselves about the all sort of questions which they have in their mind, all sorts of apprehension which they have in their mind, and they can share with somebody, and there should be somebody who can listen to them and also should be capable of answering those questions. And also in that regard only, there are many students there are many students who come with some at risk already, means when they are coming from 12 to they are coming in UG program, they're already having some kind of issues, and then they do not know that they are having this issue. Like we screened some of the students who had high suicidal ideations, and then they said ki ma'am, we never knew that we can take help from counseling center, or we can approach even a psychiatrist, so we really need medication like that. That way we also trained our master student to screen them. However, they do not screen them completely. They screen them at initial level. There are some screening tool given to them. Later, a counselor also screen them for the same. And then we also train them to provide some kind of referral to our students. So a student, let's say, is having high ideations, and then how that student has to be referred to a counseling center, how a counselor will come to know that the student is coming from buddy program and then already screened on so and so, like that. So in the secondary goal of this program was to enlist all our senior psychology students and to provide them some hands-on experience, and also to create them sensitivity about the issue which is actually there in current scenario, and to train them to take one-on-one counseling session. But this was not the counseling session, a standard counseling session, rather a buddy program counseling session where they were supposed to talk to them, they were supposed to spend some time with them, like that. And then also providing an opportunity to these students so that they can get exposure of some such issues, like what are the current issues which is prevalent. So this program is 3-year old in our university. Now this will be the 4th year in 2023. This is completely student-centric program. So our encroachment in this program, or our this is very, very less, because we initially when we visualized it, we created a standard handbook for that. We created a standard training handbook for that, screening tools, all the pamphlets, all the advertising tools, and how we will some of the Google links, how it will be advertised to the young students. Every material was prepared, and over the 3 years also we have added some more other material based on the feedback of the student. However, it is completely run by our senior students. So we choose some of the master student. We first advertise for buddy program coordinators, and we ask them to write a big essay on why they want to become a buddy program coordinator, why they think that they have such skills, and what are the skills which they can utilize, how they can contribute, and many other points we give them. Based on that, we get application and we screen these students. And then around 4 to 6 buddy program coordinators we keep based on the number of the student that time in our session who have taken admission. After that, these buddy program coordinators are trained by our senior buddy program coordinators who have already served as a coordinator. So they train them on how to maintain the, like, documentation is one of the important thing which we have introduced, that they have to document everything, like how many students have enrolled, how many mentors are there, how many mentees are there, how many sessions have taken place. So they keep all these documents. Other than documentation, they also train them in many other things, that how timely meetings have to be taken for the mentors, how timely the advertisement have to be given for the mentees and for the new those who really want to access this kind of a service. So this kind of training is provided by our senior student to the new buddy program coordinator. So this is the way it is a very student centric program. Then this is a voluntary based program. There is no money which is given to them. Obviously, this is a completely non-funded program. However, we provide them certificate of acknowledgement, and for buddy program there's a different certificate like that. So we have divided, and there are some skill set which is written on certificate, so they can showcase their skill building during their master program when they are going to fetch a job. So that also kind of a system we have created. Then we include master senior student only, those who are in 3rd semester. And so this is a master senior student led program. This is a standardized program. It's not that it is a random program. We have created everything, as I told you, everything thing is in place. There is a Google folder which we have shared with them. There's a handbook, and the handbook has different modules. Training has different modules. So there's a we have standardized this program, and also every year we are analyzing the data also, that what is the outcome, and there is a feedback which is taken both from mentor and mentees. So that we are doing, there's a timely supervision. So we as a teacher also take meetings of buddy program coordinator, as well as buddy program coordinator take meeting of mentors, and mentor ensure that they are meeting with the mentees, and the session is terminated not randomly, but we also train them that how to terminate the session, like that. So there are many things which is introduced to them. So the name of buddy program is taken from the European countries, because in European countries it is very common. However, the program there is different, because there people from different culture, when they go, for their smooth transition, actually buddy program was introduced. However, here we have introduced this buddy program in context of the psychology department. And then now this year we have extended this services to other university schools also, like for engineering also, for architecture also. So buddy, we call a buddy who is an experienced student of the university, who has good understanding of the environment and its surrounding, and they should be willing to give their time. So we take also the commitment that yes, I am ready to give my 1 to 2 hour every week for this program, like that. So these are some of the things which should be there in the buddy. And then we call it buddy so that the name itself is actually a very safe and a very welcoming. So that's why. Now this is a flow chart. So we have created a standard format for how the program will be introduced and how this will be initiated. So every year the same format is followed by our student, and then we as a teacher, we supervise it on every step, most of the steps. And we obviously now WhatsApp is there, so we keep asking some of the questions with them. They also update on their own that what now at what stage this program is going on. So first we promote our post for the buddy coordinators, as I told you, and by the faculty supervisors. And then after that, we actually the old buddy coordinators, they hand over their whole thing which they have done, and also they provide the feedback. They give some kind of a training, and they spend some time with the buddy new buddy coordinator, so that they can get acquainted with the program, with our program. And after that, we also invite our ex-buddy coordinators for to train even our mentors also. So we so that our buddy coordinators, those who have already passed out, they should feel very confident, and they should feel that yes, they have really contributed in that program, and they also become confident in presenting, in giving training and preparing the training material, these things. So we also ask them that you be ready, you are going to be the trainer next time, like that. And we also provide certificate for the training. After that, again we going back to the next side of that. So after that, once our buddy coordinators are ready, then they advertise for the buddy mentors. And only senior master student can become the buddy mentors in our university. So we advertise, and there are some kind of criteria. The same is that they should give commitment at least 2 hours in a week, like that. So after that, if they have given us consent that they are ready to become a buddy program mentor, then we ask them to undergo a 3 days training to become a buddy program mentor, where we provide them training about about the intake forms, about screening, about communication skill, and about some of the basic thing. And somewhere they become even a gatekeeper also. So the whole module is defined there for them, and they go through this kind of a training. And obviously we also meet them to answer their queries, and to if they have any kind of confusion related to how the program will be how program will take place, how they are going to start, something like that. After that, once our mentors are ready, then we advertise the for the first year student, those who want a buddy from us. So then the buddies are assigned to each student. So one student who is needing that, so a buddy will be assigned to the student. In that process only, we also ask our mentors that how many buddies they would like to accommodate. So like some of the mentors, they say I'm okay with 2, I'm okay with 3, but we do not give more than 3. But if some mentors say no ma'am, initially I would like to go with 1 only, so then it's completely voluntary basis, and it's completely preference basis. So then after that, they get somebody, and we connect them through email only. After that, it is buddy mentor's responsibility to take care of the buddy. And then how the session is going, if during the session if there is any problem, then it is reported to the buddy coordinator, and the buddy coordinator, they take note of all the problem in that week, and then they report it to the supervisor. Sometimes this happens that buddy coordinator, if buddy mentor is in like they see something which they can't handle, then we always tell them to refer immediately this to a counseling center. If the problem is bigger than that, then immediately they report to us through phone or through email or through any means through that they can reach to us as soon as possible. And then we also provide referral, and we also involve parents in that if that is needed. So these kind of things are there in our buddy program system. Now this is a 3-year data. So in 2020 we had 29 mentors, and we had 119 mentees. Then in 2021 you can see the mentors number is increasing, 31, and the number of mentees were 69. I think it is because of the COVID-19 that that students mentees were less. Then in 2022 the mentors were 68 and the number of mentees were 99. So this is the ratio you can see. And then we have not yet analyzed the why the number is less or more, but we can see that the number of mentors are increasing because day by day the feedback which is given by mentors to the ex-mentors to the new mentors is that they have learned a lot through this program, and their skill was really built because of this program. So this is the data. Then the outcome, when we analyze, actually it is a whole paper which we have already presented. I've just taken some of the parts of that paper here. So the primary outcome was that most of the student, we collected some qualitative data from the mentees and the student who access these services. Some of the student who access this service, they later become mentors. That is also one of the reason that we are getting more mentors, because once they access the service, they feel that the service was really good and it really helped. So they become very sensitive for the student, for the new students and for the first year student, and they say, "Ki, ma'am, I really want to volunteer in this program." So the smooth transition they have reported. The second is safe environment, because they say that now since they get a buddy, so they feel good. So some of the students initially they used to tell कि मैम अभी तक एक friend भी नहीं बना है हमारा. So after when we have launched buddy program, such kind of complaints are less, because they say ki initially they get a buddy, and then buddy also help them to understand ki how to make friends, like that. So that also help them. So it's not only limited to mental health, but it is also related to social skills and other areas. Then skill building of master's trainees, as I already told you, that this is seen, and this is also the feedback is also given by most of our mentors. Secondary outcome was that prevention of mental health issues. Definitely, the students have reported that the apprehension was less, anxiety was less, worry was less, and they felt very good after getting the buddy. And most of the apprehensions were resolved by, or it actually apprehensions reduced because of the interaction with the buddy. And obviously this lead to the promotion of well-being, as reported in most of the qualitative interviews. And that definitely reduce the cost of the healthcare system, because ultimately if a student is having any issue, then they have to approach a definitely healthcare system, and you know that the healthcare system itself is not very built when it comes to mental health and utilization of sources. So I think this program is one of the best example of how we can utilize some of the resources which is there in our university, which is available, and easily how we can channelize such resources. So so with this, I would like to say that let's join hand for a better future of Indian youth. So this is only one idea which we have implemented. The other idea was the hepatite program. So in hepatite program, one of our PhD student, who was my scholar only, so we were discussing, and before that only, actually I completed a suicide prevention program under OE for BW. And then I realized that this kind of a program is very much needed. And then we together thought that let's develop such program for our students. And we developed a website based on positive psychological constructs. And that the website name was given Hepatite. So they come from happiness and appetite. And then we created this specifically for the students who are experiencing any kind of suicidal ideations, regardless of whether they have been diagnosed or not diagnosed. And then the whole program was standardized and validated. And after that, the website was developed with the help of some computer science professionals, and also some student volunteered in developing that website. And successfully, that website has helped 400 students. 400 students have already accessed that website, completed that program, and they reported reduced ideation after that attending that website. However, we have not yet taken the feedback or taken the follow-up after 2-3 months, because we did not really get time, and we did not even find out that how to approach, because most of the students, they have passed out from the university, because this website took around 2 years to finalize the content and development and all these things. And since the website was completely a voluntary based help by some of the computer science students and psychology student and my PhD scholar. So this was also a kind of a non-funded project. So with this, I would like to say that it's not very difficult for all of us to come up with such creative ideas and to implement such of the things in university setup. So with this, I would like to end my presentation, and I would like to say that hope this presentation must have helped you to understand. And if you have any feedback related to this program, or if you are doing any such program, definitely share on this platform. That will really help me also to understand. So thank you so much. With this, I would like to end my this. If anybody has any question, definitely I would like to take up.
Thank you, ma'am. Thank you very much. I request the participants, if you have any questions, put in the chat box. We can take questions.
Yeah, there is one question, Deepti. You can go through that.
Yes, ma'am. Ma'am, do you have plan to keep your buddy program limited to your university, or are you looking to expand it online to other states so that MS students from other parts of the country can be part of it as well?
Actually, I really would love if you can join in this program, because we have standardized it, but still I feel that there are many mistakes in that program. And most of the teachers will agree that whenever they develop any program, they are never satisfied. So the thing is that I really want that if we all can come together and can use that, because that all that the material is already developed. If you can definitely use that material, or you can also develop some of the things which I may have not noticed, and then it can be definitely utilized.
Thank you, ma'am. S. Srilata is asking, can you guide us about resources on the buddy program for school children?
Yes, that's a very good question, Shilataji. Thank you so much, because I also said initially when I started my presentation that this program is also useful for school children, because school children, when you see grade 8th, 9th, 10th, 11th, 12th, they are very mature students and they are cognitively developed also. They are in a state where they can help, the senior can help junior. And if they are trained well, they can definitely help in a much better way. Some of the communication skill, they can learn that how to communicate, how to listen, how not to react, to respond. If such kind of things also been done with the student, this can definitely create a safe environment in any school for sure.
Any more questions?
And ma'am, I'm dropping my email ID. So if
Yes,
anyone would like to make a team, or would like to utilize that resource also, and would like to be part of the team to help this program for other university, it will be really a great honor for me, so that we can take it to the other universities also.
Yeah, I think definitely it would be very useful if you can share your email. I think in future, if you're planning any such programs, definitely we would like to collaborate along with the students. You are doing a very wonderful program. I think that is really needed for the students in order to motivate them, in order to see like where early identification can be done if they have any psychological issues that they are suffering. When they are enrolling for the course itself, when we are able to ask them to be the part of the program, I think by the end of this course, they will also pick up certain skills. They can mold themselves in their personality. I think that's a wonderful program. Really, you are doing good. A very good program.
Thank you so much, ma'am. Thank you.
Now I request Bhumika to propose vote of thanks.
Thank you, ma'am. Good morning, everyone. I'm Bhumika Batra, first-year student of Masters in Psychology from University of Osmania. It is my honor to propose a vote of thanks on behalf of everybody present here to our respected speaker, Dr. Rekha Wagani. Ma'am, thank you so much for this wonderful and enriching session you took today. I see a lot of adolescents thriving around me, but this seminar has made me aware how they are susceptible to develop healthy habits leading to, unhealthy habits leading to poor mental and physical health in adulthood. We are really grateful that you threw light on corrective and preventive steps that can be taken to help these adolescents improve their standard of life. Your suicide prevention program and buddy program, that really connected with me because it reminded me that one of the goals of psychology is to understand and spread sensitivity to human behavior so that corrective actions can be taken. Your valuable time with us have not only enriched our knowledge, but have also provided us with a tool to guide our adolescents in the right direction. So before closing my vote of thanks, a loud shout out to College of Arts and Social Sciences, Osmania University, Hyderabad, and all the volunteers for organizing and inviting such valued speakers and making this Knowledge Fest possible. With this, I would like to hand over the mic to our next speaker so that we can continue with our seminar. Thank you so much.
Thank you so much, Bhumika. Thank you.
Thank you, ma'am. Thank you so much. Our next speaker is joining in. So we'll just wait for a few minutes. So we'll start the next session in just in a few minutes. Harshita would be introducing a speaker. Yes, once ma'am joins. Thank you.
Some of the people's mic is on. Kindly mute yourself.
Just a small announcement. Meanwhile, if any participants are willing to give feedback in the valedictory session, just for 2-3 lines, not a prolonged feedback, just a 2-3 lines of feedback, probably you can just mention your names in the chat box so that we'll take your names and we'll call out during the valedictory session and you can give your feedback. But just keep it brief, just 2-3 points, not beyond that. So anyone interested to give the feedback in the afternoon valedictory session, please give your names in the chat box. It applies to OU students and also outside the OU student, outside the Osmania University. Hello, ma'am.
Good morning. Namaste,
Nice to see
everyone.
you.
Hi, Swati.
Hi, ma'am. కొంచెం ఇది చాలా డార్క్ గా కనిపిస్తున్నారు, లైటింగ్ పడట్లేదు.
Okay. I'll shift from here. Is this okay?
Wonderful. Without video also, definitely you can we can get carried away by what you say, but still.
Ma'am, shall we begin?
Yes.
Yeah,
Good morning. Good morning, ma'am. I request Harshita to introduce a speaker for the second session. Harshita.
Thank you, Deepima. Good morning, one and all. I'm Harshita Krishnaveti, psychology PhD scholar at Osmania University. It is my pleasure to welcome you all to the second day of our two-day seminar on mental health of youth during the pandemic, adapting and coping with the new normal. We are honored to have as our guest speaker Dr. G. Padmaja, Associate Professor and Head of the Center for Health Psychology and Deputy Dean of Student Welfare at the University of Hyderabad. I'm happy to say that Padmaja ma'am is an alumnus of Osmania University and has completed her MA, MPhil and PhD in psychology. With over 2 decades of teaching experience, she has made significant contributions to several innovative teaching programs such as UGC, CEC lessons, e-learning content for EMRC, and SWAYAM courses. She has also co-investigated several research projects funded by ICSSR, IOE, and the University of Hyderabad. Since 2019, she has been supervising PhD scholars in the area of health psychology. Dr. Padmaja has co-edited a book titled Trauma and Pain, Biopsychosocial Perspectives, and has published over 38 research articles in various well-known national and international journals. She has also received several Best Paper awards. And Dr. Padmaja is a member of the Board of Studies at Osmania University and for clinical psychology at Sri Ramachandra Medical College and Research Institute. She's also a founding member of the Association of Health Psychologists. Dr. Padmaja is an active academic writer and has significantly contributed several textbook chapters, course materials, and academic assignments. We are truly delighted to have you with us today, ma'am, and looking forward to your session. I now invite Padmaja ma'am to take over the session.
Yeah, thank you for that kind introduction. Osmania University is like home. I have graduated, I have done my post-graduation, all my higher education has been in Osmania University, and as a Hyderabadi, I'm always proud to be associated with Osmania University. And majority of all these young faculty in your department, we have worked together, and also I have taught some of them as well. So, well, a long stint. You said 2 decades. I think it's much more than that. Nevertheless, Osmania University itself, I had more than a decade my teaching experience over there. So it's always a pleasure. It's always a pleasure to be to come back to Osmania University on invitation from your esteemed faculty. They have made me proud. Some of them are, as I have already mentioned, my students, and I'm a proud teacher of. I was a teacher of them, and I'm proud to be so. Well, today Swati asked me to talk about empathy as a skill. Swati, may I ask you, the audience, is it the students, or may I know the nature of the audience over here?
Most of them are psychology, from the psychology background.
Mm-hmm.
Few of them are practitioners, like they are working as psychologists or counselors. Very few people are non-professionals.
Okay, fine. If that is the case, I'm going to share my screen and talk about some of the counseling skills today. Are you able to see my screen? I am able to see my PowerPoint. Am I audible enough?
Not really. It has come up. I think you just started, no? Probably it may
Yes.
take some. It's not.
Participant has enabled closed captioning. That is what is the message that I'm seeing on the screen. Your screen sharing is paused.
Samyukta, can you just check it?
A participant has enabled closed captioning. Your screen sharing is paused. These two are the messages.
Ma'am, you can reshare it once again.
Mm-hmm.
Use it and reshare it once again.
Ma'am, you can try it now.
Same message. Your screen sharing is paused.
Ma'am, try it again, please, now.
No, same. Swati, shall I send it to you by mail? Will you open it from your
Yeah,
side?
ma'am, please do send it. We'll do that, ma'am. Sorry for the inconvenience.
Yeah, the participant, whoever has clicked that button, can you just close that, the transcript one? Sometimes, like if you're logging in from the smartphone, unknowingly we might be touching that. So just every one of you, can you, if you're logging in from the smartphone, please close that button.
Yeah, Swati, I have sent it to you.
Okay.
It would be more convenient if I operate it. Nevertheless, let me try once again.
We'll just look
Yeah.
into that, ma'am. Meanwhile, like we'll just start sharing.
No, it's the same message. When I'm trying to share my screen, same message I'm getting.
Ma'am, did you send it to mail or?
Yeah, I sent it to your mail, Dr. P. Swati. ఇందాక CV పంపించాను కదా.
ఇప్పుడే వచ్చింది. Ma'am, you please stop sharing, ma'am.
Okay. So I think you people have to remind me when I have to close. Hope that's okay with you.
Okay, ma'am. We'll remind you. Are you able to see the screen?
Yeah, the screen is
Yes, ma'am, we are able to. Yeah.
full screen, Jayamma.
Yes.
Yeah, thank you. So, looks like most of you are either students or practitioners. So let's start technically. Here and there, being an academician, and I think I have to talk from an academic point of view. Then I will go into the counseling psychologist mode, and then probably we will talk more and more about the skills. So my presentation today will be talking about what is mental health and well-being, and then what is this not so very new normal, what is new normal, and adjusting to the new normal. And then we will go into the skills proper, where I will be emphasizing upon empathy along with the others. Given the duration, I will try to give a few case studies, but I'm not too sure about it since we have started a little late. So owing to this technical hitch, I think I may have to complete on time, because I have to facilitate the others, being able to accommodate the others. So here I am to talk to you about empathy as one of the main skills in counseling. But before that, let's go to what is mental health. We all know that mental health is a state of well-being in which individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community on his own or her own. Next, Amma. Swati, next. Automatically, I'm clicking over here. So got used to it. Swati, can we go to the next?
Yes, ma'am. No, it's not moving. Yeah.
Yeah, it looks like there is a little bit of technical problem or maybe signal problem. So no, 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 we are going much, much farther. We have to go back, please. We have to go back, please. Back.
It's not moving somehow. It's 1 minute. It's getting stuck. I don't know.
Shall I try once again, just in case? No. So is it okay if I talk without a PowerPoint?
Are you able to see, ma'am?
Kandistundamma. And we can even go ahead even without a PowerPoint. It's only we can focus more on discussion.
PPT so that we can get there.
Okay, no problem. Yeah, thank you, Swati. So when we talk about mental health, we talk about well-being, and we all know how mental being is integral part. And then we talk about the types of well-being. Here, Keyes and of course latest theorists also have talked about several types of well-being, wherein they have talked about emotional well-being, which involves happiness, interest in life, and the satisfaction with life. And then psychological well-being, which involves liking most parts of one's own personality, being good at managing the responsibilities of daily life, having good relationship, the interpersonal relationships with others. From our side, what is the relationship that we can maintain, and being satisfied with one's own life once again. And then social well-being involves positive functioning in relation to the others, a contribution in terms of social contribution, social integration, social actualization, believing that society is becoming a better place for all people, and social coherence, believing that the way society works makes sense to them. Well, all these are integral parts of mental health according to Keyes and others. So in order to, can we go to the next one, Swati? So in order to attain mental health, we mainly focus upon certain aspects of our personality as well as the social. This is okay, Swatama. Psychological well-being, as I said, consists of the positive relationships with the others, and not only that, but also personal mastery, a sense of autonomy, a feeling of purpose and meaning in life, and the personal growth as well as development. And this psychological well-being is attained by achieving a state of balance affected both by challenging and rewarding life events. So contrary to what people believe, it's not just the rewarding events and the reinforcements of life which determine what we are. There are challenges. That's always why we talk about, I'm sure quite a few speakers who have spoken prior to me or who would speak after me might have talked to you about the strengths, weaknesses, opportunities, and threats. And when we talk about this SWOT, the strengths, weaknesses, opportunities, and threats, we always say, we psychologists always, all of us do talk about threats being perceived as challenges. So challenges strengthen us. Challenges don't pull us down. Challenges don't necessarily push us into loose soil. Challenges, on the other hand, show us how we can firmly be grounded in reality. So, well-being can be attained when things happening to us are looked at not just as threats, but looking at them as challenges and forming goals in order to win over these challenges, in order to deal with the challenges of life. Can we go to the next one? So pandemic has been one such challenge. When pandemic came into this world, or was thrown into this world, or came into, this is a big question. Whether it came or it was thrown is a different question. Anyway, let's not go into those debates. But when it actually came, there were a lot of psychological issues that all we psychologists have talked about. During that time, we had to counsel people over phone, over online, through chats, through messages, through several possible communication media on different channels. I think almost every psychologist over here, along with me, who is a qualified psychologist, who is a professional psychologist, has the experience of being able to stand with someone or the other who has been undergoing certain mental health problems during pandemic time. So slowly we are moving out of pandemic. We have moved out. During the phase of moving out, there were different set of problems. After having moved out, have we? Is a big existential question. Nevertheless, we are hoping and praying that we did move out with a greater confidence now. Even if there is something, we can still stand firm, is a confidence that we have gained over these 2.5 years. So for some, during the pandemic time, there was this FOMO, fear of missing out on everything, all aspects of life, socialization, achievements, attainments, being able to even a routine has no more been a routine. Even a normal routine, which was boring earlier, was really craved for. So a lot of things that we discussed during pandemic time. Now that was what was experienced during pandemic time. But now that we are out of pandemic, or we are supposedly, apparently out of pandemic, now it is people say, many theorists now talk about FONO, fear of normal. Well, just as going in has been a problem, going into it has been a problem. It's like a Padma Vyuha that we Indians talk about. We don't know how to come out. Is it like that? So coming back to normalcy is not really that easy to many people. As a counseling psychologist, as a health psychologist, and as a deputy dean who is taking care of counseling unit in University of Hyderabad, I myself have seen several cases, a sharp rise in the number of cases from the student fraternity after the offline courses have started. During online courses, we had several issues, but after the offline classes have started as well, we faced much more number of people coming to us and approaching us for counseling. It was like a re-entry of the trauma. It was like a trauma for so many years, from 2020 March till recently. And even when we came out in last February, supposedly out of the trauma, still we carried the effects of that trauma. So it was like, coming back was more like re-entry of the trauma. I think from last April on, I think during that period of April, May, around that time where March, April, May, during which we all started our offline classes slowly and everything has been brought back to normal. It was during this time that we have seen majority of the cases. Some of the examples that of the fears that people have carried were continued fear of infection as offices, schools, and public locations have been reopened. Even today, though we don't want to carry our mask, there is some fear in us. Whenever someone sneezes, someone coughs, even if it is a seasonal cough and cold, we are scared. Array, my God, I didn't get my mask is the feeling that we carry with. And at the same time, we are against we feel masks are no more necessary. It's a paradox that we are living in. Should we or shouldn't we? How to resume our socialization with those outside our household? There are it may be interesting to the psychologists who are listening to me, and it may be interesting to the youngsters. I think after the pandemic, a lot of relationship issues have cropped up, even among those who are pretty close. I'm not just talking about the boy-girl relationship. I'm talking about several other relationships. During pandemic time, all this supposed to be family reunions and all. Initially, that was really like, getting a family time and getting a we time and all has been thoroughly highlighted. But after that, we started seeing that more and more conflicts have been reported. More and more abuse, more and more domestic violence, more and more relationship issues, even within the families, more arguments, more conflicts, more dislikes, more distress. It's like, familiarity breeds contempt. The more people were closer, the more they were getting farther. That was something which was surprising. But again, our human psychology, a lot of displacements, a lot of projections, a lot of defenses, a lot of unvented feelings being given a chance to be vented out. All these probably might have come. But after the re-socialization concept of physically being able to meet up with people and then being able to interact with people, that was when a lot of problems have been reported in terms of re-socialization. It's like, the friendships have there was an awkwardness in some people, there was an embarrassment, there was a distance, there was a psychological distance, there was a social distance. Social distance caused psychological distance, or social togetherness caused psychological distance? A big question mark to us psychologists for studying. So resuming socialization outside the home has in itself become a problem, and several conflicts were related to that. And yes, as you might anticipate, as you might really expect, there were a lot of breakups. Post-pandemic, there were a lot of breakups as well. And especially for those who have been meeting up with each other after long time, it was like, it was surprising to see that the equations have changed. So is it that distance has really created a distance? If that is the case, why closeness has created a distance? So I think all these are topics for us, subject matter for us psychologists to study. So it was like both distance has created distance, but not having distance and being closer also created psychological distance. Both the ways, the pandemic has brought out new forms of problems, new kinds of problems, new aspects of problems, multidimensionality of human relationships, and the problems related to this multidimensionality of human relationships. Can we move ahead, Swatama? And then the new normal. Once we step back into this larger world, it was like, the birds have been released from the cages. But was it so? In the process, aren't we committing a lot of mistakes? Aren't we seeing that pre-trauma, post-trauma, during trauma, and after trauma, everywhere we are committing a lot of mistakes. We are creating challenges and we are repenting for whatever mistakes that we have committed. So it was like, new normal was really not that easy. Adapting to the new normal was not really very normal for many people. Recognizing that pandemic is in itself a traumatic event that we collectively experienced, and recognizing that pandemic event is collectively experienced, is something which many people have failed to recognize. They were not ready to understand that we are not alone in this. It was like, isolating one's own self, thinking that I alone am facing the problem. Not many people were able to understand that post-pandemic stress and fear of normalcy are natural. Remember, I talked about the names which we have given earlier in the previous slide. And people did not even acknowledge that it was okay to feel stressed. Any change, for that matter, as psychologists, we all know, as students of psychology, we all know, any change brings with it some kind of turmoil. Change is not easily accepted. There is always a resistance to change, but change is inevitable. While change is inevitable, resistance to change is also an integral part of it. And facing change as a challenge or a risk or a threat, what is it that you look at it as? Are you looking at it as a challenge or a risk or a threat? This is where the whole difference was. So many people were not even understanding that it was okay to feel stressed, and stress is quite normal. And it was also necessary to take care of our mental health, whereas people always have been pointing a finger at somebody else, or mostly to self, about whatever psychological changes and social changes have been happening around this time. May we go to the next one? So one interesting study which was conducted during this time, during pandemic time, revealed that 40.9% of respondents reported at least one adverse mental or behavioral health condition. This was during pandemic, please, including symptoms of anxiety disorders or depressive disorders, which mounted up to 30.9% out of the 40.9, and symptoms of the trauma and stress related disorder, which is TSRD, trauma and stressor related disorder, related to pandemic, which was 26.3%, and having started or increased substance use to cope with stress or emotions related to COVID-19 was in about 13.3%. So all said and done, the so-called deviations that we talk about in our textbooks and in our theory classes have been visible. Now, having returned to the normal, supposed to be returning to the normal, this return to the normal might mean addressing all these challenges which have hitherto been faced during pandemic time, which have already been intensified, or which might have arose during pandemic time. So which means what? There are certain percentage of people, of course, according to the study, in the sample which the study has picked up in a particular peak period of pandemic time. So probably in that particular sample, if the percentage is like this, understand universally how it could have been. We as Indians belonging to collectivistic culture and all, no doubt we might use our social support system as a great buffer. But at the same time, even we are not free of the stressors. We are not free of the mental health problems which I have mentioned in this study. Next, Nana. So several problems have been reported during pandemic, after pandemic: emotional, behavioral, academic, and interpersonal. Probably we will take some time to discuss each of these. So if you can just minimize this PowerPoint, Swatamma, for a few minutes, can I interact with the audience, with the participants?
Is it okay like this?
Either you can minimize it, or we can, I would like to see them, because my whole screen is.
Okay.
You can even close it and reopen it at a later time, once we finish our interaction. Is it okay? Or if you can minimize it.
Okay, no problem. I minimize it.
Whatever is convenient to you.
Yeah. I have minimized it, ma'am.
I'm not able to see any audience yet. If it is visible on your screen, it will be visible for us.
Actually, I didn't. I just.
Anna, close it otherwise. Swatamma.
1 minute. I'll just close it. I'll reshare.
Yeah. So typically, like a classroom, if I go on talking, you may be bored. Early morning, what boring lecture she is giving, you may think. So I would like to talk to the participants. I have given you certain categories of problems. You are all, most of you are students of psychology or practitioners or whatsoever. So can you please tell me what are the problems that you might have either witnessed, experienced, or might have heard from the others reporting to you or sharing with you or discussing with you, or somebody discussing among themselves and you have been a part of that discussion. So can you tell me what are the problems after the new normal, after the normalcy is supposed to have been regained? I would request you all to please unmute yourselves one by one and talk. Over to you. Swatama, am I audible?
Yeah,
Yes,
you're
ma'am, you are.
So, ma'am, recently, in the recent times, there was a common problem that I've come across.
May I know who is
My
talking?
friends.
May I know who is
Ma'am,
talking?
this is Sindhu, ma'am.
Yeah, Sindhu, tell me.
Yeah, I've come across the problem that has been shared by most of my friends and I myself, that there is a problem in maintaining the consistency. If we are taking up an activity or task or something, a little goal for a few days, we can't. It has become quite difficult for us to maintain it consistently, and we could see that we are falling apart, that routine has been disturbed by the pandemic. So that was a major challenge I faced and experienced and shared by others also.
Good. Yeah. May I request the others also to talk, at least a few of you?
Good morning, ma'am. I am Gayatri from Psychology Department.
Yeah,
One of the problem I feel is during the pandemic, children were mostly kept at home, and I feel sometimes development process has been affected a little bit because of if the interaction is very good with other people, they will be very active. Now I have a kid. Now he feels always he wants to go out because of the pandemic. The 2 years period we were locked in home almost because of the fear. So the my child always wants to go out. He always wants to go to park. He wants to go to DMart. He wants to shop everything. He wants to be outside most of the time. And another problem is like we have been addicted to do work from home. uh, Now if my husband, or I mean not only him, his colleagues also, if they want to go to office, they feel like we don't want to go to office. It's very comfortable to work from home because they have been a bit productive also in home because they have comfortable timings and all. But I think somewhere it is being a problem actually. That's it for myself, ma'am.
Okay. Yeah. Anyone else?
Good morning, ma'am. My name is Chakri. I'm an MSc Psychology student from B.R. Ambedkar Open University, ma'am.
Yeah, Chakri.
Ma'am, I came across regarding the academic problem, ma'am. Been hearing some of my friends saying that they have been forgetting even the basics, whatever they have learned till now in the classroom, and it is becoming difficult for them again to again teaching them from the starting. They have we came across that. I mean in our common topics we talk like that.
Are you talking from a student point of view, teacher point of view, parent point of view?
Parent point of view, ma'am.
Okay. Yeah.
Thank you, ma'am.
Yeah. Anyone else? Parental conflicts affecting children, leading to self-injurious behavior. Okay.
Ma'am, good morning, ma'am. I'm Srilata, ma'am. I work as a school counselor in Glendale Academy. So usually recent times, the parents are usually when they come across and meet me, they usually say the complaint of screen time, which is actually increased a lot with a lot of things like online classes and etc., which they could not, the children are not in a state to control because they give excuses of the screen time because of the classes, academics, and they lost the relationship and attachment between the relationships is what the parents usually come across and say, thus, can you please explain the child? So this is what recent I could see in recent most trends in adolescent children. And there's a problem where, yes, ma'am?
Can you please tell me what you meant by losing attachment in relationship? You used a term, losing attachment in relationship.
Yes, ma'am.
May I know?
And the children, it's like children also don't have trust, like, because we all know whatever they see in this reels and whatever they come across, the series is whatever they are watching through it, they see the world which is created by the media. So they actually look them to also be like that. In series and media visibility, there is no conditions.
Real-time conditions. Okay, fine. So they are far from reality. That's what you mean.
Me?
You mean to say that they are far from reality?
Yes, ma'am.
Okay, fine. Others? Anyone else? I have noticed my coping mechanism to be isolation after the pandemic. Okay. Yeah. Why not? Yeah. That can be.
Someone said loss of family members. Coming out of that is a big challenge.
Yeah.
I think Sudha, she has mentioned that.
So yeah, I guess all of you are right. In my brief presentation today, I really do not know how much I will be able to cover among the several. This appears to be a large array. Whatever we have come across, not only from an individual point of view, but from the societal and family point of view. So maybe let's see if time permits me, after my prepared presentation, I will try to address some of these in terms of the counseling psychologist point of view. But before that, Swati, can we go back to our presentation? Is it okay? So sure. I have taken a couple of examples from here and there.
For the cooking.
To be on the safe side, I have.
So are you able to see the slide?
Yes.
Yeah.
Amma, you are making it full slide.
Shall we move on to the next slide, or you want to?
We can move on to the next slide. We can move on to the next slide. So some of these difficulties, according to several studies and also my interactions with several people on different forums, I have whatever I have come across and what I have read based upon certain studies, I have tried to put them over here. And also some of these are exclusive to the new normal. But these started not now. They started during pandemic time. Like, for example, during pandemic time, isolation was a problem and exclusion was a problem. But frankly speaking, today, as one of you has rightly pointed out, the way of coping has become isolation. For some people, that is more convenient, actually. It's like, you go into a shell, and they tend to become, after the pandemic, we are seeing that people are reporting that they have become more and more introverted. This lack of concentration is something which already one of the parents and one of the teachers has been pointing out as well. And then after can you please mute yourself, please? All your please unmuted. I think, or the host can mute everybody else. So lack of self-confidence is one more. Area where we keep hearing, especially from students, that their self-confidence levels have come down, and post-pandemic, when they came back, it took some time for them to readjust, saying that their confidence levels. Swatama, this is disturbing a lot. Somebody has unmuted themselves and.
Amrita, can you just look into that?
Yes, ma'am.
I think the host can mute others. Yeah. So a lot of fears and insecurities A lot of fears and insecurities related to life. I have almost lost 2 years of my valuable education, 2 years of my valuable career. See, there are two ways of looking at it. There are two extremes on the continuum. On one side, like somebody has been pointing out, being able to work from home and showing success, that including, I mean, the most successful profession, I think, who used online mode, and which was almost impossible to ever think of, was the teachers. School teachers, I'm not even talking about college teachers who can and university level teachers, where it is very common for us to use PowerPoints and all, and online meetings and all. But school teachers, even with the limited sources that they have, with the small instrument which is cell phone which they have created wonders. School teachers have created real wonders. They have been so very successful. They have shown what innovation is. They have shown what I think one of the leaders in innovation during this entire pandemic time has been the school teachers. Kudos to them. Frankly, they need all appreciations. Even from a remote area, with the small cell phone that they had, they've been able to show what success is. And they saw to it that the educational system has never been hampered. So, however, starting from there, during the pandemic time, the fears and insecurities that we have lost our valuable time, we are unable to, and there were many students who have been asking me and several others, several other teachers like me, or several seniors in the society around, what with us? Now, how are we going to compete in this world post-pandemic? We are not like others. Are we going to be branded as Corona batch? Are we going to be behind others in terms of, so this is where the teachers, the organizations, the institutions, everywhere, including the health sector, once again, which was thought of as impossible. Everything which was considered to be impossible was made possible. However, before that and during that and after that, the fears and insecurities have continued. Inhibitions to share whatever they have. Maybe it is limited to me. Adjustment difficulties that I have talked extensively. Performance anxiety, post-pandemic, this is one of the greatest that we teachers have noticed. Comparisons, jealousies, they're lucky. They have all the network, they have all the paraphernalia, they have all infrastructure, they have all availabilities, luxuries. What about us? What about her? She has a MacBook, and then she can do well. I mean, I'm not just talking about those who are not, for whom network is not available, even from among those who are, for whom network was available, even in the urban areas and all. And even within the same area, even within the same institution, within the same compound, there were comparisons, jealousies everywhere. And even today, everyone thinking you are better than me. She is better than me. He is better than me. And learned helplessness. What can we do? We are helpless. Is it so? Have we not shown our strength? Have we not shown that we can be empowered? And then, of course, the depressive mood, inferiority, difficulty in self-expression, anxiety related to relations with opposite sex. Like I said, there were a lot of breakups post-pandemic. Next, Nana. Swatama. Academic difficulties include, even after the new normal, lack of motivation or interest, negative attitudes towards institution, towards courses, a fear of failure, inability to fulfill the course responsibilities. It's like, I mean, during pandemic, when these problems were talked about, we all were quite empathetic. We all could understand, because all of us were in that same situation. But post-pandemic also, we are continuing to hear the same. And then when it comes to interpersonal difficulties, conflicts with opposite sex, inability to establish friendships even within the same gender, inability to balance peer relationships. Like, for example, after coming back from pandemic, it was like everyone was in a hurry to come back to normal. And in the process, one has become more authoritarian, more authoritative compared to the others, and so on and so forth. Then there was selfishness, there was this greed, which each one looked at. And this is where empathy loomed large. There was a lack of empathy. Should we talk only about mental health professionals as having a need to have empathy? Not necessary. All human relationships somewhere need some amount of empathy. Please go to the next one. So this is where counseling has been helpful to people, especially at school level and at college levels and at different levels. Counseling did help many people. We all know what is counseling. It's an interactive relationship, and we need collaboration between two people and usage of certain skills and techniques. And some of them I'll be talking about today. I'm sure all of you are very well versed with the skills and techniques, but I would be talking about a few of them today. And then, of course, wherever necessary, whenever necessary, the positive reinforcement and emotional support. Need for emotional support and being able to provide some emotional support as well as positive reinforcement. Yes, confrontation is also a part of counseling, but confrontation alone is not counseling. That is the problem which I often hear when while confrontation is taught as one of the skills, there are many people who think challenging alone, confrontation alone becomes greater. Someone wrote something. I don't know if I can talk about it immediately at this point in time. Let us complete whatever presentation I have. Hope I'll be able to give some time for discussion. Okay, so emotional support was required and positive reinforcement was required. Sometimes challenging was required, but challenging alone is not sufficient. So we all know what are the basic skills of counseling. We need first basically active listening and processing. Between somewhere here, you know, when you know how to listen, when you know how to attend, that is where I think this component of empathy enters into the entire counseling process. Thereafter, it is there everywhere, during the processing, during the responding, and of course finally the entire counseling process. Everywhere I think this empathy factor is required. Yeah. Sorry. So I would like to draw your attention to certain differences between what people popularly think is anxiety and not anxiety, is a deviation and is not a deviation. Like, for example, when you say, I hope that this threat does not happen, but if it does, it would be unfortunate, you are showing concern over there. You know, when you come back from your pandemic, you come back to your institution, and then you are not very sure. Performance anxiety is there, is what people talk about. No, so is it a concern or is it an anxiety? I hope that this threat does not happen. I hope I don't really have a setback in my academics. If it does, it is unfortunate. So have to take care of it right from now is a concern. This threat must not happen, and it would be awful if it did. Suppose I have some problem in understanding what is being taught, then my life is worthless. I'm hopeless. Is anxiety. So we should understand as counselors the difference between these. While we are empathizing, we should be able to draw this distinction clearly between what is normal and a little bit of moving a little bit further from the normal, but at the same time, a heavy deviation from the normal. Next, please. So disappointment. Feeling disappointed about one's own action, but at the same time, you're not against yourself. Yes, I may be disappointed with what I'm not able to do at this point in time, but that has to become a stepping stone for me for success. Whereas on the other hand, when the small mistake is done or when something which you expected has not happened, instead of disappointment, if you bring shame or embarrassment and recognize that he or she has acted stupidly and condemns self for acting in a way. So this is where self has come into the picture. So as counselors, I think we have to see this distinction. Is it that they are just disappointed, or are they subjecting themselves to too much of this feeling of shame and embarrassment where they are blaming their self? Next, Nana. So some fundamentals of counseling is we have to be cognizant of certain truths, reality. Let's not believe that we are problem solvers or miracle curers, and we should help the student by coming up with their own solutions. And sometimes you have to trust your intuition and provide a sense of direction, but do not do some hand holding. You cannot make them walk. You should only reinforce them, like I told you in one of the earlier slides, and encourage and don't encourage dependency, encourage them towards self-empowerment. This is what we have to do. So in all these, I think we have to be open-minded and create a safe place to talk about their feelings. And we should be empathetic enough in order that we understand what they mean when they say something, both at a thought level as well as a feeling level. And in addition to that, experiencing and behavior level, everywhere I think our empathy comes into the picture, and try to help them in strengthening their coping skills. Whenever there are expectations between you and your student, or between you and your counselee or your client, so there has to be a mutual agreement upon these expectations. Whenever they go into unrealistic expectations, we should also understand why they are going into that, why they are crossing the threshold of reality, and why they are moving into unrealistic expectations. And then we should be able to help them create boundaries for themselves and come back into the reality, right? And then, of course, whenever necessary, they have to give some feedback to us, and we have to protect their feelings. Do use your sense of humor so that, you know, they understand that this is something which they can safely share with you, and at the same time they are not causing any harm to themselves or anybody else by sharing with you, and you are quite normal in accepting it. Incorporate self-disclosure wherever necessary, and people should understand that you not only empathize, but you also undergo certain similar emotions or feelings, and you do understand what is happening. Hence, they feel more comfortable with you. Next, Nana. So certain core conditions thus become, I have put empathy first out of these, along with genuineness and unconditional positive regard. As students of psychology, I don't have to explain to you again what these mean. Suffice it to say that empathy is understanding what your client or student feels and not just what you would feel. Very often people try to understand in the name of empathy also. Many people fail as counselors. Not everyone who does theoretically counseling and training in counseling becomes a successful counselor. Why is it that out of so many products of several departments across the country and across the globe, why is it that only not everyone is being considered as a successful counselor? Why is it that some of us are considered successful counselors, some of us are not very approachable according to the clients? Why is it so? That is because very often people try to understand someone else not from the other's framework, but my own framework. This is where, then where is empathy? If that is the case, where is empathy? And very often people also try to rub their own values, ideas, ideals over to somebody else. It's like, you know, I understand you as me, not as you. If I very often, if I have to cite some of the examples, very often people talk like, yeah, you know that you shouldn't do it, and in spite of that, you did it. Don't you think it is something which you created for yourself? So this is where the other person feels offended. Yes, it may be true, it may be reality, but that does not mean you offend the other person. So empathy is being able to stand in somebody's shoes and understanding them from their own perspective, from their own framework, without our subjectivity interfering with it, without our own emotionality being affected. That objectivity, which we always talk about, has to be an integral part of this empathy as well. Can we go to the next, Nana? Swatama. So how do we respond with empathy? There are a lot of things that we have to take care of when we talk about empathy. Listening and understanding as if you were that student, as if you were that client, and also communicating that understanding, which means what? We have to reflect the content, basic level. You have to reflect the feeling as well. You have to reflect the meaning, which means the content associated with the feeling and experiencing and converting itself into action. So probably we have to integrate it, and we have to move towards an advanced level and actually reflect the meaning of whatever the communication has been. And at the end of it, your summarization of the content helps a lot. Next, Nana. So your summary has to be loaded with empathy. Your summary should not be in the name of objectivity. People just try to rub their own conceptual understanding. No, that's not what is important over here. Your empathetic understanding is what is important when you summarize. So that also indicates a reflection of your empathy. In this process, we always use these probes and questions, which are direct, indirect, And when it is when you are direct to the point, it is a direct question. And sometimes it may be a question but with no question mark towards the end. It's like, it's also more or less like a sharing sometimes. However, I guess you might have done something at that point in time is not actually a question, but also indicates that there is something that you are expecting from them. So such indirect questions. Can we move to the next one? And advanced empathy is where you attend to the feelings and thoughts which are not expressed by your student or your client. And when you attend to the feelings and thoughts which are not expressed, I'll try to show it with the help of an example shortly. When you try to attend to the feelings and thoughts which are not expressed by them, then it helps them understand a bigger picture. It's like, there are parts of the framework which have been missing. Now these parts are supplied. Swatama, can I just take a moment? 1 minute. 1 minute, I'm taking a break.
Okay, no problem. No problem.
Yeah, sorry for that. Since these are the advantages as well as disadvantages of work from home. When you are at home, you have to attend to more things and to open the door. So when I was talking about advanced empathy. So when you talk about the feelings and thoughts which have not been expressed and which you are able to understand, the implied meanings, at the same time reflect it through your summarization, then that enables the student or your client to see the bigger picture. It's like, they present a picture with bits and pieces left here and there. So when you try to put them together, they see where the gaps are. They see what can be done by their own self. It helps them to open up areas for counseling where your client is either unaware or has only hinted at. So that hint is enough for us to understand where there is a gap. And they will also own their own feelings and behaviors, because you're not reflecting something which they have not told. You have reflected something which is an integral part of whatever has already been told, probably in a more clear cut, articulate manner. So can we go to the next, Fatima? I have an example, so I think that should help them. So, of course, along with this, there will be self-disclosure, which may be helpful. Self-disclosure from the counselor, which may be helpful. We'll go to the next. I think the time is getting closer. For,
till 12:10 you can take, because just now Mahati has called. I said after 10 minutes she can join.
All right, no problem. So anyway, I'll try to wind it up as quickly as possible. So in this, as a part of all these, our self-disclosure, our advanced empathy, all these can be helpful to them. And when you confront, please understand, like I have already mentioned, confrontation does not mean your entire counseling is going to be dependent upon your confrontation. Very often people use confrontation as a method, integral throughout the counseling. Well, that's not required. Confrontation has to be used as a tool where necessary, when necessary, and it's a form of advanced empathy which helps your client or your student to look at thoughts and behaviors which might be quite self-defeating or harmful. Like, for example, when a person has given a statement, and within no time, probably in a few minutes from then, there is a contradictory statement, and within no time again, probably within a few minutes, there is another statement which neither supports that nor this. So as a counselor, you can always say, a while ago when you were talking about your mother, you said the best person who can ever understand you is your mother. But again, when you were talking about her relationship with the family members, you said there is nobody in this entire world, including your mother, who will ever understand what is going on within you. And again, just now, a little while ago, when you were talking about your father, you said your mother only looks at things from your father's perspective and nobody else. So can we bring these three statements that you have made together, and can we talk further about it? I see that there there is a discrepancy in these three statements that you have made. Can we talk further about it? Is a confrontation, but it is not a verbal assault. You are not saying, what are you talking? A while ago, you said she's the greatest person, as though she's the greatest person. Within no time, you changed it, and three different statements you have given. Which one of these is correct in your case? There are people who talk like this. There are people who talk like this as counselors. And let me tell you, this is not counseling. Verbal assault is not counseling. Yes, challenging happens. I've given you the examples for both. It needs to be done with a high level of empathy. There must be something within the person which must be going on. Hence, there may be these differential statements. So it is with reference to this incongruence or discrepancy on the part of your client that you're going to talk about, that you're going to use the confrontation. Next, Nana. Swatama, next. Yeah. Also immediacy. We don't talk about what happened 1 year ago, or when you came to me the first time on 2020 December 14th. This is what you have said. Again in 2021, when you came to me after a long gap in September, this is what happened. No, they won't even remember. People don't even remember. We have to be in the here and now at this point in time. And my empathy, even if there is a resistance, even if there is a reluctance, even if there is a huge pause between client's first appearance with you and later, still your empathy has to be with him and understand it as now. At this point in time, why did he or she come to you? What must be going on? So it relates to your view of the relationship. Next, Anna. Swatama, next.
I changed it. Interpretation.
Oh, sorry. So, yes, and on the other hand, it's not just enough if you have a if you use these skills. Your interpretation should also be skillful, integrating your reflection of content, feeling, and then of course the meaning, and finally the entire process of interaction between you and your client. So your observations have to be careful. Your understanding has to be keen enough and appropriate, so that there is an insight. Remember Rogerian insight that we are talking about. I'm not just talking about Freudian insight. I'm talking about Rogerian insights over here, right? So the insights which the student or the client gains is what is important to you. And very often we get carried away because it gives us a more authoritarian position, but we have to be cognizant of that. We have to be careful enough. So your entire counseling session, the trust within which is embedded in the counseling session is it is related to this, your interpretation. Otherwise, we will be failures, even in spite of repeated sessions with them, if we cannot interpret properly. So some of the examples I have given over here are attending, paraphrasing, reflecting, and summarizing. So can we quickly go through the example which I have given? Swatama, can we move ahead? We all know what is attending, expressing awareness and interest. Of course, we all know. Yeah, here is an example. So here is a girl who during this, let us say, during this pandemic time has been held up somewhere. And after that, she has returned home. She has started resuming her education at home. This is the case of a girl who has started resuming education from her hometown. And then meanwhile being away from the home for such a long time and being held up in a particular place, away from home, very far away from home, for example in some other country, and then coming back home and getting used to the normalcy of the home which she has lost touch with, has created a lot of problems. So basic level attending, the girl is telling, this is, I'm for safety's sake, I have taken a very photographs and a fictitious case study of somebody else. I'm not putting exactly an Indian context over here. You can still look at it from an Indian context. I'm so tired, but I cannot sleep. So what do? Oh, I watch TV. And then she's saying TV, but there are so many other things which emerge later. When I wake up, it's too late already. Too late for my field work. I fail keeping the appointments. I have to go into the field for my work. So all through, whenever she is talking, look at the counselor showing both in terms of body language as well as in terms of his verbal responses, with responses such as, please continue, I see. All these are the responses. So basic level attending, trying to understand what she is trying to say and observing both verbal, non-verbal communication. Next, Nana. So paraphrasing is done then from whatever has been told by the client. She says, my mom irritates me. She picks on me for no reason at all. We don't like each other. So prior to going away from India for a period of 2 years, 2.5 years, out of which she was supposed to have been away only for 1 year. But unfortunately, owing to the pandemic situation and the strict guidelines over there, she was unable to come back for more than 2 years. There was a bit of education over there, and after that she did some part-time jobs and all. Nevertheless, at the end of it, when she came back to her own country and to her home, there was a lot of distance which is created. So at length she explains, my mom irritates me, all those. Then now, based upon the understanding that he has developed, the counselor says, so you're having problems getting along with your mother, and now you're concerned about your relationship with your mother. They have to stay together. They have to stay under the same roof. So he sees that very clearly. Out of so many problems that she has talked about, this is the most important problem now. She says, yes. Then the reflection of feeling. Look at this statement from the girl. When I get, I'm not reporting verbatim everything. I'm only picking up certain parts of it. So in order to explain these skills which I have talked about. When I get home in the evening, my house is a mess. No one is back home, and I'm expected to set things by the time everyone is back. They expect so much from me. And when I talk back, they only see the rebelliousness. So he says, you're not satisfied with the way house chores are organized. That irritates you. She never said anything that I'm irritated, that I shout at people, I fight with people, nothing. But look at his understanding. That irritates you. So a reflection of feeling. And look at her response. Yes. When you properly empathize and reflect upon whatever has been communicated to you, the response would also be appropriate. Next, Nana. So summarizing once again. So after the entire session of 1 hour, this is what he said. We discussed your relationship with your family. You said there were conflicts related to your finances, that you give more importance to your friends and about the distribution of work at home. The conflicts are becoming more frequent and more intense, so much that you feel like leaving your home and stay with your friends. Your parents are against it, as they believe that there is a plan from you to move into a live-in relationship with your boyfriend. They don't permit you to move out, and you show them that though you're with them, you're away from them. Now look at the entire sequence and what he has understood in terms of not only the thoughts and feelings, but also a reflection of an advanced empathy used and a reflection of the entire experiencing behavior, thoughts, and feelings of the client. And at the end of it, he completed the entire picture. Look at the last sentence, for example. You want to show them that though you are with them, you are away from them. And look at her response. Yes, that's it. So the gap which is created has been very clearly understood by the counselor. And of course, the later sessions will talk more about it. Nana, Swati, we'll go ahead now. So, well, how do we deal with it? I think I have to very quickly wind up now, having been given more time than necessary. So create, when clients come to you, one example that we can help them with is create a worry ladder. There may be several worries that they may be talking about, several disappointments or distressful factors. Don't brand everything as anxiety and depression. You know that these two are clinical terms. Unless you are very, very sure with the help of assessment that they are under anxiety or depression, don't just jump into labeling them. Instead, help them by creating facilitating them towards the creation of a worry ladder. Make sure that there is a hierarchy and help them deal with each of these worrisome situations. Next, Nana. And very often, especially if it is young students, if it is a youngsters group, then peer counseling. Peer counseling helps a lot. This is what we have seen, especially after the reopening. When students had come back and they had several problems, very often the peer counseling has been greatly helpful. This peer support and making them integral part as trusted friends. We call them trusted friends groups. In our university, we have created this group. So these trusted friends have always been helpful. And self-help groups, when some of them are undergoing same problem. Just now, a little while ago, I have seen one of the students writing to one more student, though I couldn't read what the previous student has written completely in the chat box. I didn't open the chat box as I was talking. The second student wrote to him, I am also facing the same problem. Which means what? You are trying to form a group where you share similar problems. And as students of psychology, we can discuss them, we can help each other, we can form groups, and we can take the support of the experts, and then probably we can try to come out of it on our own. And in the process, we may also become role models to the others. We may also be skilled helpers to the others. So I think I have to conclude here. Swatama, are there more slides? Yeah, I think that's it, enough. So if I'm permitted to handle any questions, I'm fine. Otherwise, I can stop. Swatama?
Yeah, I think
I can now open the chat box.
Right.
As you said, so many difficulties, academic related. I couldn't able to submit my PhD thesis. Somebody else also said, yeah, same problem. Yeah.
Yeah.
That's again universal.
Right.
Any questions?
And social media addiction.
So as students of psychology, we all know there are certain techniques. Like, for example, we help others also, isn't it? In any addiction, gadget addiction, or there are people who have gone into abuse, substance abuse, cigarettes or alcohol or drugs or whatever. There are several cases which are reported during this time. And when it comes to young children, interestingly, there is no age gap, age difference for this. But several people have been reporting about this gadget addiction, especially smartphones and internet. And somebody was talking about the web series. So many children who have been addicted to web series and not being able to distinguish between the reality and fantasy. So I think this is where one technique that immediately comes to your mind as a psychologist is stimulus control and response prevention technique. I hope you all as psychology students are aware of this technique. One small example: technology addiction, stimulus control and response prevention. At this point in time, my phone is with me. I have been getting several phone calls. If I open it, I'll be able to see. However, I have turned it off into a vibration mode and I'm not looking at the screen at all, which means what? I'm trying to control that stimulus. The moment I start looking at it, my attention gets distracted to the phone. Simple. I mean, a simple real-time example. Same is the case. After coming home, how many of us are allocating quality time for the family members, or for our, like, for example, time for our PhD work or our assignments or our studies? So probably we always talk about this me time, we time, isn't it? So me time is for me both to take care of myself as well as take care of my achievements or goals that I have, and sometimes for self-grooming and self-contemplation and exploration and inner view. All these come under me time. What about we time? We time can be with friends. A part of we time can be with friends. A part of we time can be with family members. If you are with the family, if you are in hostels, probably your socialization time. And a part of this can be along with others watching some movies or whatever. However, we time alone is not the time which is required. So probably distributing your time between me time and we time, not overemphasizing upon we time, not overemphasizing upon me time. And me time does not just mean getting addicted to this. So even within the me time, you distribute your time, divide it into certain slots, and probably you can, like a child, even you can give some time for yourself to relax. If you think is watching a violent movie relaxation, is that a relaxation? Well, some people may define it as so. Yeah, when I watch a violent movie, I mean, so much of my ventilation happens over there. So no problem. Everyone to their own. Everyone has their own identification, projection, whatever that they want to talk, displacement, everything that they want to talk about. Everyone has their own way of looking at things. You cannot question. You cannot question, because our bread and butter is individual differences. No two individuals think alike. So yes, if you think watching movie is very important in the meantime, how much time are you going to allot for that? If that is the case, what about your other activities? So distribution and time slotting. I think time budgeting, time management, if somebody is going to talk about that, I think that helps. I'm done, Swadama.
Thank you, ma'am. Thanks a lot. Always like it's pleasure to listen to you. We always feel like every time whenever you talk, we are learning certain good things and new things. Especially this FOMO and PONO, these abbreviations are really good. I think we have to really, there is a fear to adjust to the normal situations also, as you have mentioned. I think probably for the counseling skills itself, we require 2 to 3 days program, complete workshop mode. Otherwise, we cannot complete it. But within the limited time, I think the basic levels of empathy and other things which the students can remember, or not only as students of counseling, but I think even as a human being, we need to develop that empathy and establish and maintain that in our relationships. Thanks a lot, ma'am. Thank you.
Thank you all for the patient listening.
Thank you, ma'am. Thank you very much. Now I request Sajal to propose vote of thanks. Sajal?
Yes, ma'am.
Yes, please switch on your camera also, Sajal, while speaking.
Yes, ma'am.
Yes.
Yes, ma'am.
Yes, please.
Yeah, ma'am. Yeah, myself, Sajal. I'm from final year students from PG second and encouraging on the right way to apply empathy skill. Found that empathy as a main skill in counseling, but not only in counseling, empathy helps to understand how others feeling, so we can respond appropriately to the situation. And it is important for the all human beings how they are understanding and accepting themselves, and also important without putting any conditions on it. And it is also important how we interpret ourselves. And we came to know that an active listening, genuineness, and unconditional positive regard is also important. We really appreciate that. And I have a small token of our appreciation here for you, Dr. G. Padmaja ma'am.
Okay, Sajal. I think there is some technical issue. Thank you.
Please accept it with our sincere thanks. Thank you, ma'am.
Thank you, ma'am, once again.
Thank you all for the patient listening. Thank you,
ma'am. Thank
you. Can I leave, Swati?
Yes, ma'am. Yes, yes.
Thank you.
With our sincere thanks. Thank you, ma'am.
Thank you.
Our next speaker is also here. Ma'am, shall we begin or?
Yeah, please continue.
Yes.
Continue.
I request Shravani to introduce our next speaker for the session. Shravani, over to you. Shravani? You're able to hear me, Shravani?
Yes. Good afternoon, everyone. Yes, ma'am. Can you hear me?
Yes, Shravani.
It's breaking, ma'am. I don't know if it's from my... Oh. Good afternoon, everyone. My name is Shravani, and I'm a PhD scholar in psychology from Osmania University. It is an esteemed honor for me to introduce our next speaker, Dr. Mahati Chittam. Ma'am is an associate professor of health and medical psychology in the Department of Liberal Arts at IIT Hyderabad. She has done her master's in psychology from Oxford University and has a doctorate in health psychology from the UFT, along with adherence and health behavior. She has explored these topics through a variety of lenses, such as family and individual factors, socio-political frameworks, and culture. The Sri Padmavati Venkateshwara Foundation grant for 3D imaging vein guidance system and the ICSSR special call grant for homework in the time of COVID-19 are few of the awards presented to ma'am in recent times. Ma'am has over 35 publications in journals and 7 publications in book chapters. She is also a committee member for the Institution Committee on Stem Cell Research at the University of Hyderabad. She is presently a consultant at Apollo Sugar Private Limited and Cancer Clinics. She is the founder member of Hyderabad Psycho-Oncology Working Group, HPWG India, and also the founder member of Association of Health Psychologists India. One of Dr. Mahati Madam's goals is to ensure every patient receives supportive care through psycho-oncology and to develop a branch of psycho-oncology research. I would now request Dr. Mahati Chitta ma'am to enlighten us on self-care for young adults in the post-COVID time. Thank you, ma'am.
Thank you for that introduction, Shravani. Thank you for inviting me to the talk, Dr. Swati.
Yes, ma'am. You can definitely continue. You can start the session.
Yeah, great. So I will try and share my slides. Just let me know if this is something that you're able to see now. Yeah.
Yeah.
Are you able to see this?
Yes.
Yeah. Okay, great. All right. So as has already been described, I'll be talking today about self-care for young adults during these post-COVID times. Already, Shravani has done a great job of telling you a bit about my background in terms of education and the work that I do at IIT Hyderabad. I would like to just quickly introduce you to our research group so that you have context about what is it that we do and, why would I be talking about the things I do as we progress in this talk. If at any point the slides are not changing or you feel that, my voice is not coming through properly, please unmute yourself and let me know. And then I can correct the internet or whatever the slides are, because unfortunately I was not able to use my laptop, so I'm having to use my tablet. So, I've not done that before too many times. Right, so we are called the Health Associated Cooperative and Supportive Group, HACOS. What we aim to do as a group is already in the title. We aim to be cooperative and supportive. There are a whole lot of areas of work that we do. You can see that it primarily circles around chronic diseases, psycho-oncology, diabetes, CKD, neurological conditions, endocrinology. But outside of that, we also do work in behavioral health and specifically looking at diet, exercise, and safe sex. So it's broadly called this relationship science work. And more recently, I've been working in the medtech space to understand how medicine and technology intersect with one another. Now, in terms of what the talk is today, right, I'm trying to make this as closely aligned to what a large number of the audience, comprise, so young adults. So I will be talking a little bit about, what research says about what young adults had been through during the pandemic and now post-pandemic. I'll also then be talking about one theory that explains some of why young adults felt the way they did. And one very obvious and neglected aspect of being a young adult that prevented them from feeling mentally and socially more wholesome. And then we're going to talk a little bit about what does the research say in terms of how can individuals respond to this, which is also interspersed with some of what I have been doing with young adults at IIT Hyderabad and outside as well. Okay, so the questions that I will ask, because I've noticed, having logged in a little earlier, that we have a lot of people in the audience. So I would just ask you to reflect on the questions if I pose any. And then, you can always ask me questions later on. I know that we've gone over time by 15-20 minutes, but believe me, that time will get covered, and hopefully we'll have a little bit of time in case you wanted to ask any questions or share reflections. Now, the question that you need to ask yourself as a young adult, but also as an older adult, is, are you a driven person? Are you motivated? Are you competitive, ambitious, determined, and have high levels of energy? And I can assure you that when I ask anybody this question, but especially people within the age groups of 18 to 35, I hear almost everybody claim to be at least one of this, if not 2-3 of these aspects, right? So you would probably identify yourself as being driven or ambitious or determined or being energetic and so on. But when you say, oh yeah, I'm driven, right? What does that mean? How does that you being driven translate into your everyday world and practices, right? So for me, for example, when I had started this exercise of asking someone, sorry, this is the thing with online, right? My kids are at home right now. So hang on. Yes. Okay. Right. So when I ask myself, right, I almost always have identified myself as being someone highly motivated. But when I think about it from an everyday aspect, like how do I express being a motivated person? It comes with certain trappings, right? So in this case, it would mean that, in terms of all the qualities on your left-hand side, it would mean that you would have embodied one or all these aspects, right? So in order for me to feel like a motivated person, I had always maintained high standards for myself, right? So even it doesn't have to be about work, even in my personal life, right? So if I want to get fit, my standard for getting fit is so different to what other people probably would have had. Those who would have identified themselves as, not particularly motivated, right? So you would have worked hard to excel at everything or be top of the class, have high standards, and be perfect. Now, when you think about that from an everyday perspective, that's very demanding, right? So for example, now I'm trying to get fit, because I'm done having 2 babies and I can now get on with becoming, fit again. And because of the high standards I have, the number of and because I used to play sports, the number of activities that I engage in, the amount of nutritional, research and work that I'm doing, and the number of aspects that I'm trying to manage in my life in order to improve my level of fitness is a lot, right? So, and how do I do that in an everyday basis, right? So I would go to the gym, but I also do some cardio, and my cardio is almost always squash or playing the frisbee or climbing and things like that. Similarly with my diet, right? So I do all my nutrition planning for the week and on a Sunday. And so, the amount of investment it takes essentially is very high. So when you ask yourself, who are you, or are you these qualities? Ask yourself also, what is it that I am doing every day in order to live up to that description, and see whether that's something you really want in your life, right? So what is, and the reason I started off with that is that it allows you to have context to what happened during and after the pandemic, right? So what does your life look like as a young adult ever since the pandemic hit us in 2020? Now, research is telling us that compared to any other age group, right, young adults are reporting higher levels of anxiety, more stress, and depressive symptoms. This is research that's emerging from India, from China, from Slovenia, from Bulgaria, Germany, and so on. So across the globe, a common phenomena that we're encountering is that young adults are reporting higher levels of distress symptoms, right? And this is in comparison to people who are less than 18 years old and more than 36 years of age. Right? So that's very, very problematic, because if we have so many young adults reporting these kind of symptoms, we're talking about anywhere between 6% to 68% of young adults reporting these kind of symptoms. That's phenomenal, right? And in India, it's 56%, right? So many young people are experiencing distress symptoms, but it also shows that globally, and Vikram Patel was one of the guys who did the research on this, they've said that between 6 to 8% young adults have committed suicide because they had these depressive or distress symptoms, okay? So it is very problematic, and it is persistent, that it's not only since 2020, although the research I've cited is all from 2020. Even now, research is showing that people still have the late effects of distress, okay? Now that is that's really trying to know, because this is our major workforce later on. These are people who form the bulk of where the world goes very soon, right? So what the other aspect of research has shown is that when we ask a young adult, what do you think of 2020 or even 2021, almost all of them describe it as the quote unquote wasted years, okay? So this is again problematic, because when you look back, and we all have a tendency to look back, right, at some point in our lives, and to code something that has happened as something that was wasted has deep and painful repercussions. So imagine if, I looked back at having my kids, right? And I said, oh man, those 2 years of career break that I've had in my career, man, those were wasted years. How does it even sound to describe my 1 year maternity leaves to be, wasted years? It sounds so jarring, right? So imagine you calling, or other young adults calling, those 2 years of their lives as being wasted. It has very deep consequences. The other thing that research has shown is that young adults were increasingly using media than older adults. And that's not something that I need to even describe heavily, because you all know that Instagram and other apps really took a lot of mind space for a lot of young people, and even for older people, but more for younger people. There was more WhatsApp using, more reels as a phenomena has taken up a lot of our space. The meme culture that was just building up is now like part of our lives, and we can't wait for the next thing to become a meme, right? So all of these are symptoms of excessive media consumption, so much so that now there's more research coming in from the APA, and a bigger call for social media addiction to be described as an addiction. Right? Now, the other thing that we've seen is that more time was spent during 2020, especially worrying about COVID-19, consuming a lot of COVID-19 related news among younger people. And in India, there was research that emerged from Allahabad, and they had found, or Prayagraj now, where they found that there were more young people obsessing and worrying over the Delta wave than younger people, like much younger people or much older people. Yes, the Delta affected people in that age group a lot more, but it also showed how many people were worrying and getting extremely affected by something like that. Now, what was, again, when I was doing the reading on this for our other study that, Shravani was talking about, the homework study, where we were interviewing a lot of young working women and their counterparts, stay-at-home mothers. When we were interviewing both of them, what we were seeing is that they were reporting higher, levels of distress than what we had anticipated. And so it seems to be holding true even for young adults, where more women then men were reporting poorer mental health symptoms. So they were feeling more bogged down by the pandemic, and since then as well. Now, how come? How is this possible that, you know, there are so many young people becoming so affected by the pandemic that it's still holding true? Like, how is it that young adults are still dealing with the effects of the pandemic even now? And one theory that really nicely explains this is Carstenson's theory on socio-emotional selectivity theory, okay? So what she argues is that emotions change as we grow older. Okay, somebody muted. I'm assuming that was by mistake because there's nothing else coming through. Okay, all right. So what she argues is that as we age, our emotions and our emotional needs also, or rather our need for emotional connectivity changes. Now, how she divides this is into people who are called young adults and those who are called older adults, so 18 to 35 and 36 and to 60, okay? And she says that young adults as a group, right, they tend to have different goals and relationship needs because of the way they perceive or understand time. Now, those who are young adults, right, less than 35 years in this group, will agree when I tell you that you think that time is expansive, right? You think that time is unlimited. And I remember being a 20-year-old and thinking that I'll live forever. And, you know, I could just imagine life being this unending, long, beautiful, I could not think of a full stop, you know, to life and to time. And this is really important. There's nothing wrong with it. And it's pivotal because only if you can perceive time to be expansive, will you be able to have knowledge-seeking approaches to life, okay? This is why, you know, often the way that you see the world designed, a lot of the studying happens at this time, right? So you do your undergrad and your postgrad in this, you know, critical time frame, and usually people who do their PhDs soon after tend to finish their PhDs on time as well. So time is expansive. So that allows a young adult to pursue knowledge, but also pursue long-term purposes and projects. So this long-term can be, you know, getting your H-1B visa, you know, relocating to another country, getting, hitched and getting married. It can be about having children. All of these are very long-term commitments or projects that as a young adult, you're willing to take that because you think time is expensive, that there's a lot of time. So I can invest in first finishing off my PhD, then applying for jobs abroad or in India, then establishing myself, and then having, you know, a partner, and then having the babies. These are things that you can pursue because you think time is not necessarily unlimited, but there's a lot of space to think about time. But these kind of pursuits, knowledge and long-term projects, are emotionally and cognitively demanding, okay? Which is why in the ages of 18 to 35, if you think about it, major milestones are usually achieved across cultures. You finish your undergraduate, you finish your postgraduate, you finish your whatever other studies, you get yourself your first job or at least a couple of jobs, you relocate, you get married, you have children, you buy your first house. So many huge things happen in that age group. Okay, and that kind of demand or tax that you put on yourself is immense, right? Because each of these aspects or life goals are demanding both on your mind, but also on your heart. On the other side, on the other end of the story, are our older adults, okay? Now, older adults perceive time to be limited. So during the pandemic, I transitioned out of being a young adult and I'm currently an older adult. And I can tell you from my own experience that I really do look at time as limited, you know, and I know that there's only finite amount of years and hours left in my life. And I'm seriously thinking about, you know, what is it that I want to do with it? Now, older adults, we focus more on emotion-related goals, okay? So there is more stress about enjoying this moment and enjoying the positive within this moment, right? So I went from 2020 being extremely anxious and having immense COVID anxiety and really thinking about, oh my God, what has happened to my life, and is this all that I can do? And, really resenting that I couldn't do as much research as I wanted to, that I couldn't, buy the car I wanted to, or do the things I travel the way I wanted to, and so on. And I was really anxious at that time. But I can see that I've transitioned into being able to say, that this moment, everything else might be horrible and everything sucks, but this moment right here, right now, there's so much of positive that I can cull out of it. So a lot of older adults, I've observed, and also Carlson says, is that that there's a lot of positive that they look for within their everyday moments. They also pursue activities that make them feel good. Not necessarily, that doesn't mean that they don't pursue activities that are challenging, but they are able to say, it's okay, I can let go of relocating to another city or country, and enjoy what is on my plate here, right now, okay? So they are able to kind of, negotiate or compromise on some aspects in order to focus more on the feeling good part of it. And when I say good, I don't mean in terms of just immediate gratification. I mean to say more in terms of feeling deeply satisfied. Short-term projects and purposes are something also that really encompass emotion-related goals of older adults. And by this, we mean to say that they are focused more on looking at what is it that can be afforded to me in this week, rather than thinking about what they want to do 10 years from now, right? And again, that's very different to what a 20-year-old will think about, because a 20-year-old will have an idea, a basic idea about where they will be, in X amount of time. Like they will know that they will want this job, or they will know that they would like to, imagine relocating abroad and so on. Now, the other thing about older adults is that they are very selective about their social circle. So there's a lot of research in social psychology that also talks about how our social convoy as we age starts shrinking. And the older we get, the more we prefer smaller, intimate groups that are better suited to our wavelength. So what this basically means is that even before the pandemic, older adults were putting more effort in emotion regulation. So they were working more on how do I buoy myself and how do I take care of myself from an emotion point of view, as opposed to the younger adults who were more focused on achieving, larger, more lofty ideas like knowledge and other bigger goals, which are more cognitively and emotionally taxing. Now, the other thing I wanted to talk about before we start talking about where do we go from here is the impact of the pandemic, right? In light of the socio-emotional selectivity theory. So what does this mean? Like how can we connect the SST with what happened during the and after the pandemic? So first, what we need to understand is that some of the most common goals of young adults, one of the most common one is to gain new skills or knowledge. And the most obvious thing that young adults do is go to college, right? So what do you do when you're done with your 12th grade? You go to college, you go to a university, you think about what am I studying for my undergrad, what am I studying for my master's level, right? That's the first most common goal that any 18-year-old will experience. After that, another thing that is common to young adults is that they will want to succeed at work. And now this can be growing in your career, changing your jobs, getting more bigger bonuses and so on, but you will want to climb that ladder at this time. Then you will want to maximize your social connection. right? So another thing that young adults want is not, and when I say social connection, right, and maximization of it, it's along three major domains. One is that young adults will want lots of friends. When I look at the social media handles of my nieces and even my cousins who are younger than me, I'm like, yeah, where did you get so many friends from? Like, what is this number? 1,000, 1,500, 500. And I, with great difficulty, have reached 150. In my Instagram account, right? So the number of social connection that young adults have is a lot, and that's very natural and normal that they would want to increase the number of people that they're connected to, because it's also a great opportunity to network, to know about another way of living life, to network with people, to make a call for something, and so on. Similarly, the second domain of social connection and maximization of it is the quality of the relationships. What I also see is that, like a rubber band, young adults are able to stretch themselves in their social world. They are able to have deep, meaningful, fun, light, memorable conversations and relationships with multiple people within their social network. So the quality standard of the relationships are also deep. It doesn't only mean that they have 1,000 friends, but in those 1,000 friends, they'll have at least 100 really good ones, as opposed to my 150 friends, of which 2 I'll probably, which are like, quality social connections. And then novelty. So when you're a young adult, you seek more and more new social connections. You get excited to meet new people. One of the reasons why, we do a lot of research on Tinder and other dating apps. And one of the most common reasons that young adults tell us that they want to be on these dating apps is not to date, to meet new people. So it's kind of funny that there's still no app out there that has successfully helped people just be friends. And, there is always that extra, added aspect of dating. But what I wanted to say is that a lot of young people want new experiences, and that means new people to meet as well. So like social media has blown up, right? With all these young people who are solo travelers, who will travel to all these places and put up all these videos, right? So maximizing social connection, succeeding at work, and gaining new skills are common goals to any young adults. But during the pandemic, young adults did not have skills for finding contentment, looking for short-term goals or joys, and being satisfied with their limited social connectivity or social connection. So if these are the common goals of young adults, and that was stripped away from them during the pandemic, they really struggled, because the skills that you acquire for knowledge, work, and social connection are very different skills compared to finding contentment and short-term goals and so on. So what happened for young adults was, it was like a sudden, jarring event, and everything just kind of collapsed. And young adults really struggled with that. They struggle, and that's why social media addiction, right? So they leaned heavily on social media in order to find some kind of satisfactory social connection. Similarly, they found it really hard. I remember interviewing a bunch of psychologists for the 3PVF grant. And I had 2 intakes, right? So I had an intake in, I think, late 2020, and I had another intake here in 2022 last year. And both the students that finally got recruited and all the people whom I had interviewed had spoken about how they had done internships, but they were all online. So where is your novelty in the social connection, right? Where is the opportunity to succeed because you haven't learned skills of interacting with people and actually watching a counseling session, for example, right? So a lot of young adults were not able to make long-term goals because of this. And they were not equipped with the skills to make short-term goals either, right? So if you think about it, the way society is also designed is for young adults to make long-term goals, right? If a young adult who is going through the COVID pandemic is the final year BA psychology, and I say, what do you want to do next? But you know that doing a master's is the most sensible long-term plan for 2 years. But you also know that doing a master's during the pandemic, where my internships are still going to be online, am I really going to get an education out of this? Is something that young adults really struggled with. Okay, so that is how the socio-emotional selectivity theory explains what the pandemic did in terms of coping or mental health outcomes for young adults. Okay, now if you look at the one other aspect that I wanted to talk about, and this is something that's born out of some research that was developed by sociologists in the US, but largely, it's something that was developed by sociologists, but I've kind of like run with it and been observing it and doing a little bit of, studies, with young adults. And what I've seen is that one of the major drawback for young adults was that there was a loss of the rites of passage. Now, what I mean by that is, birthday bumps, for example, is a rites of passage. It looks painful to be lifted and banged on the floor for your birthday. But it is also a memory, a painful, but a memory that you're creating with your friends, something that you can, laugh about later. That's called rites of passage. And young adults experience many important rituals during their time being a young adult, right? So one is that they move to their college or their hostels, or they select where they're going to be registering for their education. They graduate, they interview for their first job, they move houses or flats or countries and all that. So they engage in really important rituals. And rituals are very, very critical because they are the flag of rites of passage for you. You have to go through that horrible exam experience to know what it takes to clear an exam. I still remember cramming all of psychology in my brain the night before the psychology exam, and then writing and pages and pages and pages of writing, having a handkerchief and wiping my hands of the sweat and that hot March, April, May sun, blasting, no ACs, fans, barely working because we didn't have generators back then. And, writing pages, because when we were all undergraduate students, we had to write books itself in response to an answer. We'd respond to all the options, just in case we'll get extra marks for, answering all 7 questions and not just 4. These are rites of passage. These are things that we all had to go through because they signaled growth. Only when we go through that painful time do we really grow. It's also an opportunity. Rituals represent opportunities for family bonding, like my mother staying awake with me at night while I'm studying, giving me hot milk at night, dropping me to the college, picking me up from college. All of these things are small family bonding experiences that, when I interviewed for IIT Hyderabad, my dad came with me to IIT Hyderabad and sat with me, for those 2 days while we were going through the interview rounds. So these are all opportunities of family bonding, and they allow me to come of age. Right? Similarly, the sense of belonging to a community. It's only when we all do, what we used to call when we were kids, right? We call it combined studies. So only when we did combined studies and we went to the college together and we had all these teeny notes and we all had that pouch of pens and papers and whatever, right? All of that kind of creates a sense of community. Similarly, when you start your new job and physically meeting someone and getting to know your physical space has a totally different experience than doing things online. Then the other thing that rituals represent is opportunities to make meaning and purpose in your life. It's only when you're sitting there thinking, oh, wow, I finally got my final marks and this is what I've done. You kind of look at it as a way, how do I make sense of my life? How do I get motivated and catapulted into feeling more purpose in my life, right? So these opportunities of rituals was robbed from young adults, and it's only now that they're able to get back to that normal way of turning up to college without a mask and being able to attend graduation and so on, right? So I've now given you all the serious aspects of being a young adult during and after the pandemic. But where do we go from here, right? So that was the last part of what I wanted to talk about. Now, you need to understand that while you are trying to now reclaim your life, understand that there are 4 very different aspects to your well-being. And you need to work on one thing at a time and understand that when one wall breaks, all walls become weak. And similarly, when one wall strengthens, all walls start getting stronger too. Okay. In this, I will be talking only about one skill today, and then I'll wrap up. So another 5 or about 10 minutes, and then I'm done, right? I'm going to be talking about the skill of self-compassion. This is something that I do a lot of research in, but it's also something I practice on an everyday basis. Now, what is self-compassion? It is simply put, you treating yourself as if you're your own good friend, okay? So if you fail an exam, what would you say to yourself? Oh my God, I'm so stupid. What will my mother say? Oh no, my God, how did I do this to myself? Why do I do these things? You know, we talk like that. But if it was your friend talking to you, they'd say, it's okay, yaar, we'll figure it out. There's always, you can clear your backlog later. Let's think about how we're going to break this news to your parents. That is how a good friend would have talked to you, right? So self-compassion is asking yourself, what would my friend have said to me, right? And it involves three, aspects or three skills that we need to build simultaneously in order to express and experience self-compassion. One is mindfulness. So you engage in intentional living. So you're bringing attention to your experiences. The other one is called self-kindness, or a version of self-compassion in a way. But self-kindness or self-forgiveness actually is where you're accepting the experience with kindness, care, and concern. So whatever the experience might be. And common humanity, understanding that you're not alone in what you're experiencing. Everyone experiences suffering, okay? Now, I'll just very quickly go over mindfulness, and then I'll talk a little bit about how do you tease apart self-compassion from self-esteem. And then one last skill about positive rumination, and we're done. Now, mindfulness is about you deliberately saving the ordinary. It's the most easy way for you to engage in mindfulness. So one simple aspect of deliberately savoring the ordinary is using your 5 senses. Every now and then, if you can just cancel out everything else and just focus on what can you do to engage your senses, that's more than enough. And mindfulness is also, how are you able to once in a while at least pause during the day and just kind of let the day, let your environment, let the air just sink into you, right? And what mindfulness can do when you start deliberately savoring your ordinary is that it can help promote you feel more calm. Okay. And the reason why I'm talking about self-compassion and mindfulness specifically is that if you've gone through the pandemic as a young adult or even as an older adult, you are still going to be experiencing the late effects of that distress. Okay, it's going nowhere. So you need to work on yourself even now so that you don't have to be consumed by these late effects, which will either be a part of who you are right now or are coming up at regular intervals. So for me, something that happened during COVID was, as I told you, right, I had COVID anxiety. So I started panicking. And even now, every now and then, when I'm in an aeroplane, I get really scared. So when, and I used to never get scared. I used to love when there was air turbulence. I used to think like this, like a free roller coaster ride. Oh my God, it's so fun. But now when there's turbulence or when the flight is like kind of like adjusting itself against the breeze, oh my God, I get so scared sometimes. And when that happens, I attempt at engaging in polyvagal or mindfulness practices, okay? And so by mindfulness, it's, as I told you, it's about doing something with intent, becoming present in the moment. You can't necessarily always be present in every moment that happens to you, but if you can invite yourself to regularly become present in the moment, over a period of time, you'll see that you become less bothered by the things that bother you, So one is managing your breath. All our emotions are first felt in our body before they're felt in our mind. Okay. So anxiety, when you start thinking about where am I embodying my anxiety, you're teaching yourself to figure it out in your body even before it reaches your mind. Okay. So breathing exercises that way help regulate your body's responses to anxiety or stress. Take 5 is a good example of it. Take 5, Cory Muscara, Coreymuscara, Cory Muscara, talks about the Take 5, where he says that, put your palm out and take your index finger of the other hand, and you place it at the bottom of your palm, and you just travel up, breathe in while you travel up one finger, and breathe out while you travel down one finger. And you go up and down all the 5 fingers in this way. And he says that this really helps slow your mind down and helps you kind of just come to this moment, just stop all the noise and just settle down. And I do the Take 5 regularly. My younger one has issues with anger every now and then. So she does the Take 5, and her, she's really calmed down since then. So that's a great breathing exercise to consider. Box breathing is another one that is very, very helpful. Box breathing is basically you take a breath in for 4 counts. You take a breath out for 4 counts. You take a breath in for 4 counts. You hold your breath for 4 counts. You let your breath out for 4 counts, and then you hold your breath again for 4 counts before you breathe again for 4 counts, hold for 4 counts, out for 4 counts, hold for 4 counts. So that's why it's like a box, right? This again will help you regulate your breathing. And the other one is simply just having longer out breaths than in breaths. So you breathe in through your nose, but you breathe out through your mouth, and you breathe out longer than you have taken to breathe in. Okay, so you can do mindfulness practices like breathing. You can also do grounding exercises, which I won't go on about because I know that Dr. Padmaja had come before me, and she must have already talked about different counseling techniques, of which grounding is one of them. But grounding is basically where you start engaging all your senses, right? The 5 senses, and then you see how you go with that. The last one is called tapping. Now, tapping is part of the polyvagal theory. Polyvagal theory is basically, and please, you can Google it if you want. There's a lot of stuff out there about it. But basically, it's about activating your vagus nerve, which is connected to your parasympathetic nervous system. And tapping is about finding where your nerve, vagus nerve is, and you just tap over there. So you give it sensory feedback. Okay, so mindfulness, these are the different kind of practices. If you'd like to know more about it, feel free to reach out to either one of your faculty in OU, or to even me over email. And I'm quite happy to share the literature and those techniques with you. The second last thing I wanted to quickly talk about was about self-compassion versus self-esteem. You need to change your inner voice, okay? So self-compassion, as you can start doing mindfulness practices, start also thinking about how am I talking to myself, okay? You need to learn to talk to yourself in a very kind way, to kind of have that level way of looking at yourself. Just like this line, it has to be straight, it has to be poised, and it has to be calm. And self-compassion helps you get there by constantly engaging in acts of kindness to yourself on an everyday basis. On the other hand, self-esteem, when you work on your self-esteem or your self-worth, you are looking at how are you feeling about yourself in relation to what you've accomplished. Okay. And now what that does is that you can sometimes feel down and sometimes you can feel up, right? You will go up and down, up and down, up and down when you focus on self-esteem rather than when you're trying to focus on becoming self-compassionate, right? When you are focusing on being self-compassionate, you will have a level response to any situation that comes your way. Now, what does that mean? An example, you got yourself a new job. A self-compassionate response will be, I worked really hard for this new job and I deserve it. But a self-esteem response will be, Hammaya, now I can proudly let my family and friends know that I got a new job, right? So you really need to change the way that you're talking to yourself, change the way that you describe events in your own mind and bring yourself to ask yourself, is this a kind response? Or am I doing this in terms of an accomplishment? Am I looking at it as an accomplishment? Right? So ask yourself that, and that will also help guide you through it. So mindfulness and changing your inner voice usually work hand in hand, and it's better when you do it combined because it really, you see better results. The last skill that I wanted to talk about is positive rumination. Now, I know as psychologists, we say rumination is a bad thing. It isn't, you know, and the issue is that you also need occasional negative rumination, but we don't call it negative any longer. We call it constructive rumination. So constructive rumination is to look at things that have gone wrong and ask yourself, how could I have done this differently? Positive rumination is where you take the positive from your experiences and pay more attention to it, right? So when I look back, right, it's really interesting because when I think back to the babies that I've had, I can only remember the good stuff. And it's because I've taught myself to pay more attention to the good stuff. And the good memories hold a bigger space in my mind than the not so great ones. And then describing or telling people about your positive experiences and emotions helps multiply it, okay? So you multiply sadness, but you can also multiply happiness and the positive. And then also positive rumination, when you start engaging it, helps you revisit your life's values, okay? So what is it that I value most is what you'll see when you positively ruminate. When you negatively ruminate, you're looking at the things that deplete you of your joy for life, okay? Right, so with that, I will stop talking and thank you for listening to this presentation. And as I said, if you had any questions about these skills, feel free to write me an email and I will give you more information. Thank you. So Dr. Swati, I'm done.
Thank you, ma'am. I request participants, you have any questions, please put it in the chat box. Or you can even unmute yourself and speak out.
Hi, ma'am.
Yes, Mary, please ask your question.
Actually, you told the last example you told when I get any work, how I should tell I feel happy. That I really experienced, ma'am. That one, instead of if we are struggling for a long time, we got job, we have felt happy. That time I don't feel like telling that I got this position. First, I tell my gratitude to God for giving me this job instead of boasting. That is the highlight of your session, ma'am. I liked it a lot. All the best, ma'am. God bless you.
Thank you, Mary.
Yeah. Anybody else would want to ask the questions?
Good afternoon. Am I audible?
Yes, Shabdam. Please ask your question.
Yes, thank you. It was a wonderful session. I just missed on what you, in your mindful techniques, you were talking about tapping. If you could just please help me understand this better. Thank you.
Sorry, there was a bit of a background noise. I couldn't quite hear you. What were you saying? Can you repeat the question?
If you could shed some light on tapping.
Oh, on tapping. Okay, all right. That one word got missed in the background noise. So tapping, okay, so since the video is on, I can show it. So tapping, see, we have a vagus nerve, okay? And it one place it runs through is over here. Okay, and then it kind of like splits and goes around here and goes down our neck and then travels the rest of our body, okay? It's a rather thick nerve that, you know, for some people it is very obvious, you can see it, and for some people not. So tapping usually is where you take these two fingers and you go tapping on your neck, you know, this part of your neck that comes out when you turn sideways, that part of your neck is what you tap. So you go tap, 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 tap. And then you also take your index finger, and this part of your index finger is a little more bumpy. All right, so you can put that on your upper lip and go tap, 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 tap. And then you take your two fingers and you go tap, tap along your cheekbones, and you go till your jawline, and then you go up again and you go like this. So what tapping science talks about is how you need to do this until you start feeling a tingling sensation. The sooner you feel the tingling sensation, the more activated or readily activated your vagus nerve is. The longer it takes, it means that you're really working on your sympathetic nervous system, and you really got to think about how to reduce that activation and improve your parasympathetic activation. So just yesterday, I was telling one of my squash buddies about this, and it took him 200 counts to start feeling some sense of tingliness in his body, right? So that means that's how much on sympathetic nervous system his entire body is running, right? So tapping is something that you should do ideally in the morning when you wake up, along with other lymphatic drainage stuff, that we do. So I've taken on my earrings because it's easier to see. But, usually, lymphatic drainage is an entire different science that I can talk about at a later time. But you wake up in the morning, and the first thing that you should be doing, while you're maybe brushing or when you're whatever, you can just keep tapping like this, and that will start activating it in the morning. Okay. And it's very important to keep your sympathetic nervous system on a low and your parasympathetic on a high when you wake up itself, so that it sort of sets the tone for the day.
Thank you so much. Thank you.
Thank you. Yeah. Any more questions to ask? So now I request Anisha to propose vote of thanks to Dr. Mahathi. Anisha?
Yeah, gentle reminders, learners, please stay back. Once vote of thanks is done, the next presenter is ready. So please continue with the sessions. Thank you, ma'am. Yeah.
Anisha. Sorry, I'm absolutely sorry. Shivanuja. I'm sorry for that mix up. Yeah, Shivanuja.
Yes.
Yes.
Thank you.
So sorry.
So this is Shivanuja. I'm a professional tennis player and currently pursuing masters in psychology at Osmania University. It gives me an immense pleasure to give a vote of thanks to our guest Mahathi Chittem. It's quite empowering and inspiring to listening to such women. So as someone who emphasizes on health and self-care, it was wonderful to have attended this session. And it's been an honor to have you here today, ma'am. And on behalf of our department and faculty and all the participants, I thank you for your valuable time and also for the insightful information you have shared us with today. Thank you, ma'am.
Thank you, really, Shivanuja. And I'm glad that it resonates with you, from a fellow racket sport player to the next one.
Yes. Thank you.
Dr. Deepti?
Yes, ma'am. Thank you so much, ma'am.
Yeah. All right. Thank you once again for inviting me. And I look forward to a collaboration as we go along.
Yeah. Thank you so much, ma'am. Thank you.
Bye.
Bye. I request all the participants to stay on. We will start the next session very shortly.
Good afternoon.
Good afternoon, ma'am.
Good afternoon. Am I audible?
Yes, yes, ma'am. Shall
Yes.
we begin, ma'am?
Yeah, just give me one moment. One moment.
Yes, sure. Sure, ma'am.
Meanwhile,
Samyukta,
you
can
ask
create
the
a-
introduction.
Okay. Yes, yes. I request Anisha. Are you around, Anisha?
Yes, ma'am.
Yes, yes. Samyukta, I can put on the slide, maybe.
Ma'am, I'll introduce her now, or should I wait?
Yes, go on, Anisha.
Okay, ma'am. A very good afternoon, everyone. I'm Anisha Raghunathan, a postgraduate student of psychology at Osmania University. I'm deeply delighted to take this opportunity to introduce Dr. Sabiha Alam
Please
Chowdhury.
switch on your camera, Anisha. Sorry to disturb you. Please switch on your camera.
Ma'am, it's not working, ma'am. Like,
Okay,
even if
okay,
I
okay. Go on.
Okay, ma'am. I'm deeply delighted to take this opportunity to introduce Dr. Sabiha Alam Chowdhury, who's currently an assistant professor of psychology at Mizoram University. She has presented and published various articles and papers covering diverse topics related to positive psychology, stress, and education. She has also supervised master's dissertation on the impact of stress on the job performance of employees. She has also actively organized, participated, and conducted several workshops at universities and institutions across the country, spreading awareness about mental health, stress management, and well-being. She was awarded Certificate of Merit for Academic Excellence in the year 2009 in the Women's College, Aligarh Muslim University. She has also received the Best Performance Award for extraordinary contribution in the field of school psychology in India in the 8th INSPA International Conference held at Andhra University, Visakhapatnam on the 11th of October 2018. She's a lifetime member of Psychologists Association of Northeast India and a member of the Executive Committee, also a lifetime member of Indian School Psychology Association or INSPA and state convener for Assam from 2019 to present. Once again, on behalf of everyone present here, I warmly welcome you, Dr. Sabiha ma'am, to enlighten us on the topic resilient skills and mental health in new normal. Thank you so much, ma'am.
Thank you very much for the introduction. It was indeed quite detailed and quite generous of you to speak so well about me. Am I audible? Is my voice audible?
Yes, ma'am.
Yeah. Okay, so I have a PPT, so I'll be able to share the screen over here, right?
Yes, ma'am. Yes, ma'am.
Yes. Okay.
This meeting is being recorded.
Okay. A very good afternoon to one and all present over here. First of all, before I start this topic of speaking on resilience, speaking on positive psychology, I believe all of us who is present over here are well acquainted and well versed about the importance of resilience in the current situation. In the current, I know that we are, now we have all joined back work. We are now, taking on responsibilities, prior to the pandemic. Now we are trying to be upfront and we are trying to, get into the normal. But all of us, including professionals from the field of psychology, as well as professionals who are not, from the discipline of psychology, there has been individuals, who were completely naive about the subject matter of psychology. But post-pandemic, people have started understanding the importance of the concept of the subject matter. Just a second, give me a moment. Yes, so sorry for the interruption. People have started understanding about the concept of positive psychology. People have started understanding about the importance of resilience. When we talk about resilience, it is a beautiful characteristic. It is a beautiful quality which is there in all of us. Resilience is that capacity to fight back in the face of adversity. We all know about it. We all are blessed with that strength. And the field of positive psychology is one such discipline which speaks very strongly about this particular aspect. So, I would like to give you a few illustrations in this context. During the pandemic, there have been a few instances, there has been a few, there has been a few circumstances where we might, we might have been confused in our lives. We might have been very anxious in our lives. I wouldn't say that only the ones who have been affected by the virus, only they were the ones who were faced with anxiety, an inexplicable anxiety, which nobody could say that when it is going to end. Even now, we are not completely out of it. We are not completely out of it. Even so many of us, we have lost our near and dear ones due to this COVID. We all know we all we all have stood with our family members. We all have stood in the face of that pandemic. We all have stood together. So we all are blessed with this wonderful characteristic of resilience. We all are we have shown it knowingly, unknowingly, whether we are thinking that we are applying resilience per se, or whether we are doing it without any knowledge about it, but we are applying, including from the students studying in the school who are attending their classes online, sitting within the four walls of their houses, not allowed to play outside with their friends, not allowed to go and talk to somebody outside. Okay, and all the time they are completely within the four walls of their house, just looking at their parents and family members, and that is what they could do for all the 24 hours, watching the television, watching the news channels. So we all know, from the children who are studying in the school to the elderly people who are amidst the geriatric section of the population, we all have shown examples of resilience during this pandemic time, during this COVID time. And we are still showing it, because that strength that we have discovered in ourselves during that period of time, we still carry it with us. We still carry a kind of a confidence in us that yes, we will be able to battle adversities now. Resilience is that beautiful quality, or that beautiful characteristic, which is there in all of us. It's there, and I wouldn't call myself a proponent. I wouldn't call myself an advocate of positive psychology. It is a particular discipline which has brought changes in my life, if I would want to say particularly. So being an individual, from the field of psychology, understanding a few aspects related to positive psychology, knowingly, unknowingly, I have been practicing a few things during the pandemic. And during this entire period, I have seen changes in myself. I have seen changes in my, capacity to deal with stress, in my capacity to deal with different kind of adversities. Still, it is a very long journey. Still, it is a long way that we all have to, we have to keep on strengthening ourselves. When we talk about resilience, which is an offshoot of positive psychology, I'm not saying that positive psychology is something which is against, the conventional psychological models that we have been following all this while. Positive psychology does not speak against it. It does not say that we should not, speak about abnormalities. We should not speak about problems or difficulties. It says that speak about problems, speak about adversities, speak about difficulties, but along with that, also speak about strengths. And that strength is the strength of character, which we all are blessed with. Okay. Is the slide visible? Is the slide moving?
No, ma'am, it's visible, but it's not moving. The slides are not moving.
It's not moving?
Yeah.
Okay. Can you see it now?
Yes, ma'am. Now it has moved.
Okay. So we all know about Martin Seligman. I will not go very much theoretical into these concepts because these things are very much available, readily available in different kind of books, different kind of e-resources, different kind of lectures that we attend, attend on YouTube or in our classrooms or different seminars, meetings. So I would like to give practical examples while illustrating my concepts. That is what I would like to believe, and that is what I would think that we would maximum, that is how we are going to benefit from it in the maximum way possible. So when we talk about positive psychology, many people confuse with it that they think that it's only about all the positive and good things. It's only about happiness. It's only about the good things. It's only about all the pleasant feelings that we are surrounded with. Yes, it talks about happiness. Yes, it talks about well-being. But when we talk about well-being, when we talk about the concept of flourishing, we talk about a state of being engaged. Here, I would like to emphasize on this particular thing, the state of being engaged. We all do our different kind of course in our day-to-day lives, isn't it? We go to our workplace, we do our household chores, or whether we are cooking, we are writing something, we are teaching our students, or whether we are studying for the examination. No matter whatever work we are doing, we all are engaged in our work. But many a times what happens is that when you take up a task in your hand and when you engage in that task, losing in such a way that you don't have a sense of anxiety while doing the task. You are so absorbed and you are so immersed in that particular activity that it gives you profound happiness. And when I speak about happiness over here, it means authentic happiness. I know here, not all of you are just students. I'm sure a number of faculty members, a number of professionals from the field of psychology are present over here who are very well versed with these topics. And I would definitely believe that, everyone would agree with me when I'm saying about these particular things about the concept of flourishing. We individuals, we can flourish, we can develop, and we can enjoy authentic happiness when we are engaged in a particular thing, from the entire side, how I would put it in proper words. It's actually individuals these people called Martin Seligman and Csikszentmihalyi. These two were very strong advocates in the field of positive psychology, and Martin Seligman is popularly known as the father of this discipline. So actually it was Csikszentmihalyi who had spoken about the concept of flourishing, and he was the one who had initially spoken about the state of being engaged and the state of being absorbed in a particular task. It's not just I am doing something and I am busy doing it. I'm completely absorbed and I'm completely busy. It's about enjoying it when we are doing it. It's about bringing out our well-being when we are doing it. Okay. So when we talk about this particular discipline, in the words of Martin Seligman, it is a scientific study of optimal human functioning that aims to discover and promote the factors that allow individuals and communities to thrive. So what I would like to say is that, it is that kind of an discipline. Positive psychology is that particular kind of a discipline which helps individuals to understand what is the best in them. It does not say that you neglect what are the pitfalls in us. We don't need to neglect our demerits. Positive psychology does not emphasize that. But what it emphasizes is that let us promote the factors, whether it's with our children, whether it's with our students, class students, whether it's with our family members, or whether it's with our peer group. Let us understand what is the best in all of us. It could be anything. It could be resilience that we are talking about. It could be your capability, your bravery, or your courage. It could be your ability to understand and appreciate beauty and intelligence. It could be anything. It could be any of these things which you believe are your top strengths. And this is a very highly scientific discipline. And positive psychology, you might think that there are so many similarities between the humanistic paradigm and positive psychology. Yes, there are many similarities between Abraham Maslow's and Carl Rogerian approach of humanistic approach and the positive psychology. But irrespective of those similarities, there are still differences. And the basic difference being positive psychology is a highly systematic and scientific discipline. People have been scientifically working on this particular aspect, and people have been rigorously working and traveling across the globe in order to understand scientifically the concepts of happiness, scientifically the concepts of well-being, to bring out flourishing, to bring out concepts of character strengths and signature strengths in individuals. So as I told you, when we talk about well-being is not just about being happy. If you ask me what is well-being, I wouldn't say, so my well-being is ensured. No, it is not that. When we are talking about well-being, it is a composition, it is a combination of all the factors which are surrounding us, you know. If I am not physically fine today, if I am not feeling well, my well-being is not ensured. I'm not in a state of well-being. If I'm psychologically not okay, if I'm in a state of stress, extreme state of stress, if I'm in a state of confusion, if I'm extremely unhappy, if I'm very, very sad, I am not in a state of well-being. Even social health factors, my relationship with my colleagues, my relationship with the people who are living in my surrounding, everything composes and everything is straightly, it is directing and bringing out and ushering my well-being. So it is basically how we feel about ourselves. It's not just about how you are looking externally, it's about how you're feeling from inside, how you're leading your life. So this is just in a diagrammatic way, like, you know, every aspect of well-being, like, you know, whether it's physical, psychological, economic, environmental, social, mental health during COVID-19 pandemic. So I know that the lockdown period is gone. I know we have all come back to our university, college setup. We have come back to our workplaces. We have started working back just like the earlier days before the pandemic. I know. But we all have battled this journey. We all have come across this journey. So we all have, encountered certain kind of stress. Not only the stress resulting from the pandemic, that is something which was inevitable. We all know about it. So many papers and so many seminars and talk shows have been organized throughout different platforms, where people have been rigorously engaged in orienting and spreading awareness about mental health during the pandemic period. We ourselves, all of us, I believe all of us, we all were very actively engaged during the pandemic period in attending and organizing seminars so that our students and the people who are connected or not connected to the field of psychology are well acquainted about the, about the concept of resilience, about the concept of gaining strength during these stressful times. So we all know how much we have battled, how much we have, we have encountered and we have tackled during that period of time. So during that period of time, the steps that we had taken at that point of time was our physical safety. You know, we were very much concerned about our physical safety. We were taking supplements, we were taking proper food, we were ensuring that whatever food we would bring from outside, we would sanitize our hands, we will sanitize the table, we will use disinfectants, or we would keep everything in a safe way. We used to boil food, we used to take boiled water, we used to take turmeric, we used to take different kind of things which would ensure our physical safety. Plus social distancing. Social distancing was something which was not only emphasized by the government measures, but we ourselves were undergoing quarantine. We ourselves were very careful about social distancing, and we followed all the guidelines that were to be practiced during the lockdown period. And because of all of these, we all have encountered the threat, the immense psychological threat that all of us, I just mentioned to you, how people starting from the age of school-going children to the elderly people, everyone of all age groups have encountered problems and the threats related to the pandemic. And we have all, survived that. We have all survived that. And recently, I published a book which was basically on the experiences of the frontline workers. the frontline workers who were dealing and tackling, and who, because of whom, we were safely staying within the four walls of our house, and we were considering ourselves to be safe because of those frontline workers. So recently I had, it's a book which got published by Routledge. And in that book, the kind of experiences the individuals had shared during that period of time, it's sometimes I would say that I used to get goosebumps when I read those experiences. We sometimes do not think, we think that it is a part of their job. They are doing it, whether it's doctors, whether it's nurses, whether it's the police officials. We think that it's part of their job, and they are doing it, and they have to do it. But the pain and the anxiety that they have been facing during that period of time, and the extreme tension and the extreme anxiety of going back to home, and the fear of bringing the virus back home, each and every emotion they had, I believe it was captured, if not completely, at least to a certain extent it was captured. And to be honest, if you get if you feel that you would like to read that book, you would get to know about a few experiences, how they had tackled a few anxieties of their own, even individuals who were not from mental health fields. Yes, we have a few encounters and narratives written by individuals who were from the field of psychology, but there were individuals who were not from the field of psychology, but they have indicated clearly some technical measures which we speak about in psychology. We teach our students certain CBT techniques that we talk to our students about, how they need to use those techniques, how they need to imbibe those techniques in order to deal with stress, in order to be resilient in life. So those frontline workers during those times, during those times were seen to use those techniques, and they have reported and recorded those things. So this is a proof that we all, irrespective of knowing it or not knowing it, we have that strength of fighting back with the stress. Okay. So during the pandemic, mental health may be compromised in young children due to anxiety and worry about not going to school, fear of catching the disease, whether it's information and misinformation, being confined to home, loss of regular routine and life, no face-to-face interaction with friends, feelings of isolation and confusion. So with young children, with younger school-going children, maybe we, for many of us, we were teachers during the pandemic period, we had to shift from the offline mode to the online mode. Suddenly one day it was declared that from tomorrow it is going to be locked down. And in my case, at that period of time, I was heading the department, and there were so many problems, there were so many difficulties, there were so many half-done work which was just left like that. And the anxiety and the problem and the difficulty that suddenly came onto me, maybe I wouldn't be able to describe it right now. Though it seems to be very minimal now, because now we have all become very techno-savvy. All of us, isn't it? We have become quite techno-savvy, because now I am not in my workplace, my vacation, it's my winter break, which is going on. I'm at home, but I am trying to ensure, I request the convener madam, that if it could be preponed, and she is being extremely kind enough to make the arrangement for me, because there are a few problems over here, because of power, power cut and some other internet related problems. And madam has been very kind that she preponed my session. But what has happened is that during this pandemic, we teachers, or we academicians, or we individuals who were who have been associated in the field of education, we have acquainted ourselves, we have become that much equipped in order to deal with those kind of anxieties, or in order to deal with those kind of problems or difficulties. But just like us, individuals of all age groups have faced different kind of challenges. We might be thinking that for young children, it's another vacation for them. They are just not going to school, so they might be enjoying it. Yes, for the initial few days, when they were being told that school nahi jana, you don't have to go to school, all of them, they were they must be very enthralled, and they might be very happy that they don't have to go to school, and then it's a kind of a holiday for them. But slowly and eventually, as the pandemic continued, and as the lockdown continued from 1 week to 2 weeks to 1 month, the anxiety that the younger group of children faced, like, we might have read in different articles, we might have seen in, seen in different kind of documentaries, the kind of anxiety that younger group of children, they faced during the lockdown period. The fear about not going to school, the fear about not going, this is the fear, in fact, my students who were studying in the master's level, even they had that fear. So imagine about individuals who are of the younger age level. So many things have been compromised for this, for this group of children, the fear of not meeting, that anxiety that will I meet my friends ever again in life? Will I ever have a classroom teaching ever? Or like this only I have to sit in front of the mobile phone or in front of the laptop listening to my teacher's lectures. And this is how my entire school time is going to pass by. So many misinformation, so many information, media is there, so many misinformation about the spread of the virus. No routine life. Confined to the home for 24/7. Not allowed to go even outside in the apartment park to go and play with the fellow friends. Not allowed to talk to anyone. Also witnessing some kind of domestic issues. We all know during the pandemic period, the extent and the intensity of domestic violence and abuse related cases, it all shooted up very high. We all know about that. We all know about the reports and we have read about it. So apart from that, younger children witnessing such kind of things at home, witnessing a loss of the regular life, that regular routine life. We all know how difficult we feel, no, isn't it? Whenever there is a disruption in our regular routine, we feel so difficult. Imagine about us. We were so very disrupted and we used to find it so difficult in order to keep our mental health sane and to keep our mental health in a proper state when the pandemic first attacked. Because our routine was disrupted, isn't it? Waking up sleeping very late at very late hours, waking up very late, not having a particular routine and a particular regime for eating food, not knowing when can we go to the market to buy the groceries, that anxiety and that stress, if we individuals being adults and being capable of dealing with stress in a much better condition as compared to the younger age group, imagine about what their state was, imagine about what their condition was when their regular routine was disrupted. So, mental health may be compromised in older children and adolescents also due to anxiety and worry about uncertain future. I still remember about a few of my class students when I was taking the classes. I still remember I was taking Sigmund Freud's theory and I was teaching them about defense mechanisms. And then suddenly when I was teaching them about one of the defense mechanism, one of the students suddenly said that, "Ma'am, can I ask you something?" I stopped my class and in between the online class, she said that, "Ma'am, sometimes I feel that I have no future. Sometimes I feel that there is nothing going to happen because most of the times, in these online classes, I turn off the camera, I turn off my audio, video, everything, and I sleep off because I don't get that zeal to study. I don't get that that kind of enthusiasm to sit and study and sit and focus and concentrate in my academics. I'm not getting anything, ma'am. So will I ever have a future? Will I ever be able to do something in life?" And I still remember the kind of, the kind of anxiety that was there in her voice and the kind of fear that was there in her voice. So this anxiety and uncertainty, by the time, during our time, when we were adolescents, by the time we were approaching that phase, we were quite sure about what we will do, which college we want to study in, what kind of preparation do we require in order to reach that level, in order to go to that level, that cutoff. We knew about it. But for this age group, for this particular group of children who were facing and who were attending online classes during that particular period of time, especially the ones who were about to pass out, imagine about them. What was their condition when they know that in the coming few months, it's actually the time for my placement? If it wouldn't have been the pandemic, I would have been placed somewhere. But now everything was uncertain. The fear of being left behind because everyone else is moving ahead, and that particular group and batch of students, the fear of being left behind. Even now I hear in different companies. The other day, one of my friends who works in an MNC over here told me about one of the employees in their organization. That particular employee, that particular individual has passed out. I'll not name the institute, has passed out from a very, very good institute. But what happens is that whenever that particular individual shows some flaw in her work, immediately she's been pointed out that, oh, she's the product of the lockdown period. She's the pass out of that pandemic period. So obviously these kind of things will be shown in her work, in her performance. So these kind of tagging, I know everyone do not do that. These kind of stigma, this kind of discrimination does not happen everywhere, but still it is existing. So that kind of fear of being left behind, that kind of fear of not being considered at par with everyone. So it's inexplicable. Again, apart from that, that fear, constant fear of being contaminated, because one or the other person in the household has to step out for some necessity, whether it's for their day-to-day chores, or whether it's for the grocery shopping, or whether it's for some immediate emergency, health-related emergency. That fear of constant fear of contamination. Too much of overload of information, because media is there, so much of overload of information. Staying within the four walls, not having any physical social contact with people. Now what is happening is that whenever there is any any holidays packed together, none of the holiday destinations you will find it all of the holiday destinations they are so jam-packed. What is happening is that now actually this is one of the topics that one of my research students have taken up. And what has happened is that now people after the pandemic, after being locked and being confined and not being allowed to travel for this time, people have been they are going completely crazy. They just want to go, they just want to travel, they want to travel to different places, because now what is happening? One group of people, they are saying in response that it is because they are traveling like this because they do not know what again next is going to happen. So before they before they die or before they are again locked down, so they want to travel as much as possible. Again, another group of people, they say that it is because they were being closed, confined for that long period of time. So now they just want to explode. They just want to everything. They just want to explode and they just want to explode. So that is what is happening. So some of the common signs of stress during the lockdown period: anger, irritability. All of us, we used to get angry, we used to get frustrated very easily. Some of the attention-seeking tantrums, we used to do some kind of attention-seeking behaviors, whether it's from our spouses, whether it's children from their parents, whether it's with our with our near and dear ones, some kind of attention-seeking behavior, because we used to feel that being confined within the four walls, not talking to anyone physically, not being able to go outside, we used to feel that maybe we are no longer wanted anymore. Not feeling like getting out of bed. I'm sure many of us might have encountered this. You have woken up in the morning, but you don't feel like getting out of bed. We either sleep very little or we sleep a lot. Okay. Then some kind of bedwetting behavior we're seeing in individuals. Few different kind of abuses, whether it's verbal or physical abuse. The intensity, as I told you, intensity was shooting up like anything. So repeated watching of pornography, repeated watching of different kind of unverified news, a lot of fatigue, a lot of boredom, a lot of feeling of loss and grief. Even though you are not attacked by the virus or your family member is not attacked by the virus, the moment you hear that so and so have died because of COVID, we still remember, isn't it, when India was not attacked to that extent. We remember that when Italy, the cases were shooting up so high that they didn't even have places to bury the dead bodies. So I'm sure all of us, we have encountered that extreme feeling, a different kind of grief, a different kind of a feeling of loss. Even though we have not lost something, but that extreme, impending fear that is not leaving us. Okay. So now we come to practicing PARMA. Just a second. Okay. Am I properly audible to everyone?
Yes, ma'am. Yes, ma'am. You're audible.
Okay. So now we come to PARMA. PARMA is actually a very famous model. When we talk about happiness, when we talk about well-being in the field of positive psychology, it's a very famous model. Okay. So where P stands for maintaining positive emotions. Maintaining positive emotions, these kind of maintaining positive emotions, it could be like, just a second. Yeah. So during the pandemic, during the lockdown, we all had practiced PARMA. PARMA is a technical term used in positive psychology, but knowingly, unknowingly, we all have practiced PARMA. So the first one, positive emotions. When we talk about positive emotions, it could be a wide variety of positive emotions. It could be it could be a state of engagement. It could be a state of flourish. It could be a state of extreme excitement extreme excitement when you happen to get a phone call from somebody very dear whom you didn't talk to for a while. It could be not knowing how to cook earlier, but looking at some kind of dishes and some YouTube channels. You are cooking something and you came out with something very exciting. That is a positive emotion you are experiencing. You're making something very good and you're serving your family members and the smile on their face. That is also a positive emotion that we are experiencing. So during the lockdown period, we all have encountered different wide variety of positive emotions, and we have done a lot of things in order to usher in that positive emotion. We have tried to play different kind of games. It could be board games. We created our different kind of games with our family members. Sometimes we played some kind of music game. Sometimes we played some kind of mind games or some kind of different kind of games. And we did different kind of things in order to keep ourselves engaged. We tried to there were many individuals who have not been able to get some time to pursue their long lost hobbies. So during the lockdown period, people got an opportunity to practice that. Many individuals, they watched cartoons together with family members, laughed together, they smiled together, they told jokes to each other. They would fix a time in the evening where all of them would have tea together and they would crack jokes in front of each other. So what were these? These were different small techniques and small aspects of actually being resilient in the times of adversity. We all did it. Whether knowing it technically or not knowing it technically, we all did it. And we have been able to deal with the extreme stress that the lockdown and the virus was bringing on us. Then comes engagement, the E of PARMA, engagement. So keeping yourself busy and absorbed. I told you already, when we talk about flourishing, the state of being engaged in some kind of work, whether it is engaging yourself in some household chores. Okay, you're cooking, you are cleaning, you are doing the dishes, you are making the bed, whatever you are doing, being engaged and deriving some kind of flow. When we say flow, whether we are writing, maybe today I am sitting down and I'm writing an article, or I'm writing a poem, or I'm writing a story. So I am engaged in such a way that I am enjoying my work. I'm thinking that my work is going to bring me some kind of benefit. And that benefit is not some kind of materialistic benefit. That benefit is a kind of a happiness which I will get after accomplishing that work. Whether it could be painting, whether it could be practicing some music, whether it is making doing a new handicraft, it could be anything. All of us, we did those kind of things. And all of us, again, knowingly, unknowingly, we involved ourselves in the second element of the PARMA model, that is engagement. And we all engaged ourselves in the state of flow by which we demonstrated our resilience. For positive relationships, keeping in touch, like when we talk about positive relationships during the lockdown, it's not just having a positive relationship or having meaningful relationship or healthy relationship only with the individuals you are living at that point of time. we, all of us, like, during the lockdown, we made a point that we tried to catch up with many of our old friends, some of our school friends who were very dear to us, but because of our busy schedule, we didn't get that much of time and opportunity to get back in contact with them. So this was one wonderful opportunity where we ushered in positive relationship with our long lost friends. Either through phone calls or through messages or through video calls, we connected with our siblings who live in a different state or in a different country, with our grandparents, or we also promoted care and concern for helpers in the building or residence. We also tried to do, many of us, isn't it? I did it. All of you, like, I'm sure all of you must have done some acts of kindness on your part, from your part, whatever was possible on your part. Even a small act, but all of us, we engaged in that. We made contributions to the poor. We made contributions to the vicinity, to the building, to the surroundings. We made some, like, if somebody has been in some problem, or somebody is completely, that particular household is in quarantine, we all have taken steps. When we went for our grocery shopping, we made some shopping for them and we gave it to them. All of us, we did different kind, we practiced kindness, and that was not something which would be published in a newspaper and would be shown in the next day news channel. It was, we didn't do for that, isn't it? We didn't do for that. We all did it for something in return. Yes, we did it for something in return, not expecting that when we will fall sick, they will do for us. No, but we did it because we wanted to engage in positive relationships. And that was giving us a different happiness, which was not just a temporary happiness, an authentic happiness. Yeah. Then comes meaningfulness. We all, like, during the lockdown period, we tried to do some or the other kind of activity by which we tried to bring in some level of self-awareness. It could be anything. It could be doing some meditation. It could be doing puja. It could be offering namaz. It could be reading the Bible. It could be anything. It could be even watering the plants that you have in your household. It could be just waking up in the morning, sitting in your balcony and just saying a few good words about yourself. Anything, any of these things, whichever you think is appropriate for you. All of us, we have done one or the other thing by which we try to connect with our inner selves. We have asked ourselves, who am I? What is my greater meaning in life? What is my greater purpose in life? We made a point to express our gratitude. We made a point to express our thankfulness to the people who have done good to us, either through a phone call or through, even there could be people who are no longer there amongst us, but we made a point to express our gratefulness through the medium of prayers or through the medium of some kind of meditation or some kind of self-time where you try to connect yourself with your inner being. You connect yourself with nature to understand the beauty of nature, to understand that we are all different. We are all different, but still ultimately in that lockdown, we were all in the same category. There was no rich and poor. There was no high and low. Nobody was spared by the virus. Even the richest of the richest got the virus, and even the poorer of the poorest got the virus. Accomplishment, the last element of the Parma model, which says that when we practice the previous elements of the Parma, the P, the E, the R, the M, we reach a state of accomplishment. We achieve something. And that achieving might not be in the form of something which you can look at it physically. It might not be in the form of gifts. It might not be in the form of money. It might not be in the form of some good clothes or materialistic benefits. It could be in the form of some kind of a new skill that you learned. Maybe because of all the elements of Parma, all of these elements are actually elements to show your resilience during those tough times. And all of you have done it. You still have it, and you have, you have those skills because of which now you are capable of dealing with difficulties even at a much better level. We don't realize it, but we are doing it. We have accomplished a different kind of a satisfaction which might not be explicable in words. Yeah. So when I talk about signature strengths, as I told you, we all have strengths within us. We all have strengths within us, whether somebody is considered to be very, very poor in academics because he or she has very low CGPA or somebody who has very high CGPA. Every individual, irrespective of their CGPA, irrespective of their social background and economic background, irrespective of their status in the society and their designation, every individual is blessed with strengths of character. And those are 24 in number. 24 character strengths, and we call them as strengths of character or character strengths. But in every individual, there are top few strengths. Out of those 24, like for example, bravery, there could be appreciation of beauty and excellence, there could be resilience, there could be different kind of character strengths. But out of all those 24 character strengths, I will be the best and the top in 5 of them. So that is my character strength profile for me. And for you, there will be another character strength profile, which makes you and me unique from each other. I'm a unique individual because of my combination of character strengths, and you are a unique person because of your combination of character strengths. And the top 5 are considered to be the signature strengths. And according to Martin Seligman, when we practice the signature strengths in our day-to-day life, that is the key to a good life. Because automatically, if I understand, suppose gratitude and bravery is my top 2 strengths, and I know that I am good in that, I know that I am, one of my top strengths is bravery. If I take up tasks which is like, showing signs of bravery, or if I take up tasks, suppose like another top 5 character strength of mine is appreciation of beauty and excellence. Suppose I take up tasks which manifest some kind of beauty or which is related to some such kind of art and craft related aspect. I know I'm going to excel in that. Why? Because that is one of my top strengths. And how do we know our strength? By different kind of mechanisms, by different kind of aspects, which the positive psychology paradigm has popularly spoken about. And one of the popular mechanism or the tool that is available, it is the VI inventory of strengths, value in action. It is a very popular tool which is used in positive psychology. And this is a tool where for different age groups, there are different sets of this inventory. And this particular tool is being used in order to gauge what are your top 5 strengths or what are your signature strengths. So when we talk about well-being, there are 2 main goals: to help identify signature character strengths and to increase the use. So only identification of character strengths is not sufficient. Making the maximum usage of these strengths is extremely imperative. And at an early age, the sooner it is identified, the better it is. That is why it is said, in so many schools nowadays, why these positive psychology programs are implemented. In so many schools nowadays, they try to imbibe certain kind of techniques where the children will learn about positive reinforcement, where the children will learn about expressing gratitude to each other, where the children will learn about, they will ask to write down their top 5 things, and they will ask to identify their, their plus points. So many things are being imbibed from the school level, because the sooner these strengths of character are identified, the better it becomes and easier it becomes for an individual to become or to attain the state of well-being. Okay, so when we talk about character strengths, it is a combination of one's cognitions, one's feelings, and one's actions. Okay, so character strengths are 24 in number. I'll directly go to the strengths of character. So these are the 24 character strengths, as I was talking about. It could be creativity, it could be curiosity, it could be bravery, it could be perseverance, integrity, enthusiasm, love, kindness, social intelligence, perspective, teamwork, like that. There are 24 character strengths, which are again divided under 6 virtues. So all of us, we have these 6 virtues, and the 6 virtues are courage, humanity, transcendence, temperance, justice, wisdom, and knowledge. So under these 6 virtues, there are 24 strengths of character divided in different sections. So we all, each and every one of us, I, Sabiha, I consist, I include, and I have all of these 24 of them and all of these 6 virtues. But it is not necessary that I will have these strengths in the equal intensity or in the equal strength, just like it is in your case. You might be very high on kindness, but I might be very high on bravery. I might be very high on curiosity, but you might be very high on social intelligence. So that is a character strength profile, which makes an individual different from another individual. So this is just a few implementation of positive psychology in Northeast India. So from where I belong to. So, okay, so these are a few activities and a few exercises. If I get an opportunity to talk to you for some other day, I will speak about these exercises in details. But I'll just speak about one exercise about out of all of these, okay? The 3 blessings or the 3 good things exercise, which you can do it very readily at your own disposal, at your own homes, at the comfort of your own homes, okay? So this is a kind of an exercise which we can do. All of us, like, you know, we like thinking a few things about the entire day before we retire to bed at night, isn't it? So this is a small exercise, a small activity. So what we do is that we take a small notepad, okay, retire to bed, a small notepad, and we write down 3 good things. 3 good things that we did in the entire day, okay? And we try to understand the happiness that is associated after doing those good things. What was the, what was the consequence, or what was the result after doing those 3 good things? These things appear to be very, very trivial. It appears to be very, very simple. And you might be thinking that how does this, how does this bring any difference in our ability to build up our resilience? So these are a few things, I would say that once you try, you will see the difference. I have tried it on myself since the past few years. I have been practicing it. I have been practicing the habit of keeping away my mobile phone before I retire to bed. And I keep that diary with me. And apart from the 3 good things, I do a few other things also. Okay. A few other practices. And to be honest, it really gives me, I won't say that I get a very peaceful sleep after that. I'm not saying that. It depends on the kind of tension and the anxiety you are encountered with. It varies from person to person. But this is one of the activity that I have been doing, the 3 good things exercise, and it really helps me in feeling contented, in feeling calm. So you can just try it at your home and you can just mark and see the difference. So before I end my presentation, I would just like to speak about a very famous model called the Geelong Grammar School. So actually, this is a very famous model called the Geelong Grammar School, which has for the first time implemented positive psychology program in Australia amongst the school children. And they have seen the impact of applying this Geelong Grammar School model program, okay, where the children have been an example of this Geelong Grammar School. When the students of this school were not being trained in the area of positive psychology, it was seen that the prevalence of stress, the prevalence of depression, and the prevalence of conflict among the children was very, very high. And the competition level that was existing amongst the students, that was not a positive and healthy competition amongst each other. But slowly, the Geelong Grammar School practice and the positive psychology implementation started getting and taking a position in this particular place. And there it was seen amongst the school children as well as the staff members of that particular school. It was seen that there was a drastic change. And one of the exercises that was being done with the school children was that where one particular student was being asked to point out 10 good points about another classmate, okay, and to identify what are his strengths of character. So this is just one of the activity which I told you about the Geelong Grammar School, and it is this is a project which has been very successful, and it has been running very successfully, and it has brought about far-reaching impact among the school children. Okay, so as I told you, teachers and administrators are trained on the skills of positive psychology, which includes resilience, character strengths, gratitude, positive communication, and optimism. So when coming to the teachers and administrators, it was not just confined to the school children, training the skills of positive psychology only to the school children. Nothing will happen if the teachers adopt a very, very negative approach, and the students in the classroom are always praising and being resilient about the different adversities. The teachers also have to imbibe in them certain strengths, certain optimism, and that has to be reflected in the way they communicate with the students in their classroom. Embedding positive education in the students. Students were guided and trained on courses which helped them discovering and using their signature strengths. So what happened is that the syllabus, the courses in their syllabus were fine-tuned in such a way that included certain kind of, how would I say, certain kind of elements which would make them tickle their mind, which would make them think and ponder that what am I good at and what can I do? What are the best things in me so that I can put it into optimum use? Okay. Another, I told you already about the VIA signature strength test. This is the website where you can take the test. You have to register yourself in this website with all your credentials, and you can take this test and you can identify what are your top 5 strengths so that you can work on it accordingly if you haven't done so far. Apart from that, family members also of the students were involved, where they were asked to make a kind of a family tree not of the family members of their weaknesses, but a family tree including the strengths of all the family members. Such a beautiful thing. Can you understand? We all can also do it at our homes, where we can sit down, think about the good points of our mother, our father, our husband, wife, children, and we can make a family tree out of those strengths. Such a wonderful thing to do. And we can, whenever we are facing some adversity within the family, we can look at that and we can think that, yes, this gives me strength in order to be calm in the times of adversity. So some other interventions that we used amongst the students, gratitude letters to parents, such a beautiful thing. Most of the times, like, you know, what happens in life, we fail to express our thankfulness to our parents because of the, like, you know, we all know the kind of immense, like, you know, there's some messages. I didn't get this message. Can you show 24 points once more? Okay, I'll take the messages later on. Let me just complete it. Yeah. So some of the gratitude letters to parents exercise. So many times, like, you know, we fail to thank our parents for the endless contributions that they have made in our lives, isn't it? And many times we fail to say them even a thank you. A simple thank you, we fail to say them. So the children of this particular school, under the positive psychology intervention program, they were asked to write some thank you letters, specifically mentioning those good things for which they are highly, highly obliged, highly, highly thankful and grateful for their parents. Again, the blessings journal, the same thing which I told you, the 3 good things. It's the blessing journal, maintaining a blessing journal, learn real-time resilience to deal with heat of the moment adversities, and asking children to deal with some kind of on-the-spot challenges. Maybe there is a conflict between 2 children, two class students, and without the teacher's intervention, how do they deal with that particular thing, and how do they use their resilience in order to tackle with that situation? So different kind of things, different kind of aspects. Yeah. Okay, embedding positive education in the curriculum. Apart from that, like, you know, whether it is in their syllabus, whether it is in their sports classes, whether it's in the pastoral counseling session, whether it is some kind of language-based training, strengths-based language was used by the teachers when they were educating the students in the class. A strengths-based approach, rather than lamenting on the weaknesses of the students, a strengths-based approach was being imbibed. Adaptation to the Indian context. Now you must be thinking that I am talking about a model which is adapted and applied and is successful in the West. What about our Indian context, where situation and circumstances are so very different? Yes, the Geelong Grammar School positive education model can also successfully used in the Indian context, in our university classroom setup, in our colleges classroom setup, in our school classroom setup, in our home, like, you know, tuitions, in our home, like, you know, when we are teaching our children at home. This particular model, this particular aspect can be very successfully imbibed even over here. Okay, so as per the cultural requirements of different places of the world, this model of positive education can be modified. So in different regions of our country, this model can be modified and implemented for a larger benefit. So we just need to take into account certain cultural considerations that are there in different places, in different areas, and accordingly, the same points we can apply it in our context also, without, like, again, when I'm saying that we can custom it a little bit, that depends on us how we will custom. According to my family, I will custom it a little bit. According to my classroom, according to my students in my classroom, I will custom it a little bit. So that way we can very successfully use these positive psychology interventions in our classroom with our students for their successful realization of their strengths of character. Okay, so with this, I come to the conclusion of my small topic, short topic, but I believe something which is very, very important for all of us. I believe, yes, the lockdown is gone, lockdown is over. The adversities and the anxiety related to the pandemic and related to the COVID situation, yes, it is relatively gone, but still, we still have some kind of anxiety still in our mind. We still have some kind of tensions. We still have some kind of confusion, which was laid down by the COVID period, which was laid down by the pandemic period. And we are still battling with it. We are still battling with the losses that we had encountered, the losses that the entire world had encountered during that pandemic period. And we are dealing with it. We are standing strong because we are blessed with resilience, because we are having our strengths of character, which gives us the resilience to fight back and to deal with the anxiety, which is unprecedented and which is inevitable. So with this, I would like to end my lecture. I really enjoyed speaking about this topic. Even though the COVID is lockdown is gone, but I believe, at least to a certain extent, maybe I might have been of a little help to all of you. I might have been I won't say I have given you information, because all of these information we all know, it is there everywhere. We can read it, we can understand it, but I would say it was just like a recap of the life that we lived during those times and the strength we showed during those times and even now. So with this, I would like to thank all of you for giving me this platform and giving me this opportunity to speak about a topic which is so close to my heart. Thank you, all of you.
Thank you, ma'am. Thanks a lot. Though, initially there was some uncertainty with regard to this technical aspect, but I think definitely we have covered in a very limited time the broader perspective of positive psychology, how we can use that in helping ourselves and also helping around the people, like the students or the professionals, whoever, how they can generate the skills in the youth with regard to the mindfulness, and also trying to strengthen one's own resilience, and how these attentive skills can really help us, by nurturing our own interest in gardening and other aspects. It's a order of the day, whatever you have spoke. The only thing is, everyone has to not just listen to it, but implement it. I think implementation is the most important aspect.
Absolutely.
Thanks a lot.
Yeah.
Ma'am, yeah. So I request Miss Vanaja, if there are no questions, anybody to ask questions?
Yes. I have also given my email ID over here. So if there is any query and any kind of discussions that you would like to do with me regarding this field, regarding this area, or you would want to work together, so I have given my email ID over here.
Okay, thank you so much, ma'am. Now I will request Miss Vanaja, sorry, 1 second, just give me a second, please.
Yeah, sure.
Sorry. Yeah, I request Shravani to propose vote of thanks.
Yes, ma'am. Good afternoon, everyone. On behalf of the Department of Psychology, it is an honor for me to extend my gratitude to Dr. Sabiha ma'am for sharing her valuable insights and inputs in today's seminar. Firstly, ma'am, thank you for taking time out from your busy schedule and gracing our seminar. Your presentation on positive psychology in the pursuit of well-being was very informative and educational. More importantly, from identifying stress,
Shravani, your voice is breaking and we cannot hear what you're saying.
Practicing gratitude in our life, ma'am. Thank you so much, ma'am.
Thank you, ma'am.
Thank you.
So much.
Thank you so much.
Yes, yes. Dear participant, after this, we are breaking for lunch. So please join back the session by 2:30. So you have a very short lunch break today, 15 minutes. Please join back by 2:30. Thank you.
Good afternoon, participants. I think lunch break of 15 minutes is over. I think you can really try to accommodate this short span for the lunch. Our next resource person has already joined. So quickly, if you can come back, we'll start the session. Those who are already enrolled.
Madam, are you able to see my PPT?
Sir, we are able to see the PPT, sir.
Okay, I'll just keep it like this.
Yeah. Samyukta will start the session. Others will definitely they'll join back. Around
Shall I start now or in 2-3 minutes?
Shall we wait, sir? If you're not in a hurry, we'll wait for a couple of minutes.
Yes, we'll
Okay,
meet. We'll
sir.
meet.
Okay.
Yes, yes.
Yeah, ma'am. Better we wait for 2 minutes and start.
Yes.
Sir, you could complete your meeting, sir.
Yes.
So hope like you were not in a hurry then because the
No.
session was changed.
Actually, it's on time. It's on time. Trust me, it's exactly on time.
Yeah, actually, one resource person from Mizoram University, she had a severe technical problem. So she was requesting whether she can complete the session as she is very uncertain about the network. So I requested you like for the afternoon instead of pre-lunch session.
Yes. It's good. It's perfect time. Yes, thank you.
Okay, sir. Thank you, sir. Thank you.
Just tell me when to start, but I'll start. Yeah.
Fine, sir. Fine.
Sure, sir. Sure. Good afternoon, everybody. Welcome back. I know we have to compromise on our lunch break. So now I invite Vinil, a second year student, to give an introduction of our expert, Dr. Raja Srivan Mamidi from NIN. Over to you, Vinil.
Hello.
Vinil, we are able to hear you. Be little loud.
Yes. Okay, ma'am. A very good afternoon to one and all.
I'm Vinil, a student of MA Psychology final year from Osmania University. It's my pleasure to introduce our honorable speaker, Raja Sriswan Mamidi Garu, a scientist grade D in Clinical Division, Marital and Child Health at ICMR NIN. Sir, I have more than a decade of experience in marital and child nutrition and published more than 25 articles in national and international journals. Sir have major contributions in the field of nutrition. Few of them are estimation of EAR-RAD for calcium and phosphorus in recent RDA report published by NIN in 2020. Sir also published a report on what India eats with 2 large-scale samples under rural and urban India and showed that protein deficiency is also a problem in India. Sir also contributed for the development of e-learning modules for nutrition and health under Poshan Abhiyan program for training of grassroots level workers that are widely used by various states of our nation. Sir and his team also developed SSFP, Supervised Supplementary Feeding Program module for grassroots level workers in management of SAM and MAM in communities, which is now scaled up to 11 districts of Telangana to achieve the goal of Poshan Abhiyan. Sir is also a member of various committees of national and international and also worked projects supporting international organizations like Save the Children, UNICEF and World Bank to achieve goals of Poshan Abhiyan program. Now I would request Dr. Sriswan Raju Mamidi Garu to address the session.
Sir, over to you.
Yeah, thank you. Sorry, I'm sorry. Thank you for the kind introduction by the organizers, and I'm really happy to take a webinar, national webinar for all the youth on the nutrition and physical well-being in new normal situations. I've been working in this area of nutrition for the past 10 years, and COVID has impacted in more than one way. So, and I have myself changed a bit, and people have been asking what to do in these times, what should be the diet. And therefore, my aim is to try to give an overview about the background of the pandemic we have, and about basic overview of the malnutrition we have, and the immunity we have, and how this malnutrition infection vicious cycle takes place, and what do we do to counter this in the new normal times. We need to have a balanced diet, which is also not only sustainable to our own health, but also to the environment. And then we'll conclude. The upending COVID pandemic has disrupted life as we have known since 2020. Life has not been the same, that we all agree on it. The indirect and direct effects of the pandemic are far-reaching and has impacted our lives in more ways than one. Evidence clearly suggests that it's not just overnutrition, but also undernutrition are likely to increase because of the pandemic. So we do already have a dual burden, which is only going to get exaggerated. You look at what has happened with COVID pandemic and the mortality rates just before our pandemic hit during the month of April in India. And this is a data by Arvind Subramaniam, who was trying to use the data from the municipal documents of all the mortality rates. These are the adjusted death rates. We would see that before the pandemic, our death rates were somewhere around 8 on average, 8 per 1,000. And slowly during the pandemic in February 19th, you can look at it's almost 10 in the end of baseline. And slowly over a period of time in the wave 1, our mortality rates have increased to 14 per 1,000 and then over to almost 16. So it's almost doubled in the wave 2. So this has been the impact of the pandemic on the mortality rates per 1,000 population. And this is just, it is still not over. I mean, you look at the recent data from China, which is still very huge. There's a huge problem on it, I think. Yeah. Now, why is important? Now, when you look at why is age important? So for youth, you should not be too worried, but people like me should be worried. And this is data that shows that. You look at the risk of infection, hospitalization, deaths by age due to COVID-19 pandemic. You could look at the cases compared to what happens if you are 0 to 4 year old, what happens if you are 5 to 17 year old, and so on. So this 18 to 29 year, the youth come under this category, and you can look, compared to your reference, children are less likely to have infections, less likely to have been admitted to hospitals, and less likely to have deaths. It is always less than 1 times. But as you age from 30 to 39, 40 to 49, and as you age, you can see that at the bottom down here, deaths, it's almost 85-year-old, almost has 600 times compared to a youth population. So I would generally say that no, this age group is not too much worrisome. Even 30 to 39 also has a risk of 4% increased death. So youth can also become, no, Vivekananda Swami was a youth till 40 years, so no, he's a youth leader. And I would always say 40 is also youth for us. And Bradman retired at 39, so he's physically still strong at 39 years. And you look at the malnutrition as a risk factor for COVID. As I've described earlier, that it's the elderly and people with chronic illness and comorbidities such as cardiovascular disease, cancer, diabetes, hypertension are especially at increased risk of severe illness and mortality. For the first time, we've seen that even the non-communicable diseases also play a major role in the disease outcome in those who have contracted the virus. So we never thought that NCDs as well as the communicable disease actually combine together to have a more impact in terms of mortality. And you can see the countries with high prevalence of overweight already had higher mortality rates compared to LMIC countries. For example, United States had much more deaths. European countries had much more deaths than the than India. And of course, low immunity can be therefore be due to poor nutrition, both overweight and underweight. And similarly, poor nutrition can also lead to increased risk of infection due to poor immunity. And this is a case in point why both are important, both undernutrition and overnutrition. This is a U-shaped curve, the link between body mass index and COVID-19. You could look at the body mass index of adults less than 18.5 here, and you can see that the odds ratio is about 4 times, which comes down, which is the norm from 24.9, which is a normal BMI, and again increases at 30. So this is what is called a U-shaped curve. And this is for critical illness. And similarly, this even for the fatal illness, it is the same. You can see the U-shaped curve, even for the fatal illness, starting around 9, coming down to 0, and again increasing to 15. So this is how we see that BMIs at both extremes are at increased risk of COVID-19 critical illness and fatal illness. And this is some data from children hospitals. We have seen on various hospitals in USA, UK, Italy, Germany, Spain, France. Children have lower mortality rates, and this has been well proven now compared due to COVID-19 compared to adults. It is because what is called the cytokine storm is much more lesser in this population. But you look at a major population, major problem in India is the iron deficiency. Almost 50% of children and adults and girls are anemic, and one of the major reasons is iron deficiency. And you can see that there is an association between iron deficiency and also COVID pandemic. So this is very important that it's iron, but definitely it's also with and not with child growth failure or vitamin A. So compared to vitamin A or growth failure, iron deficiency had a problem and its impact on COVID-19. So now we come back to the vicious cycle of malnutrition infection, how your malnutrition can affect infection. You take any time point, you can start with inappropriate feeding practices and food scarcity. What happens then is the child has diarrhea or prolonged or recurrent illness. This will again lead to loss of appetite, which again will lead to malnutrition. This is what is called the vicious cycle of malnutrition infection. So therefore, you curb one, you automatically curb others. In adults, the pathway is a little more complex. It's about chronic stress, the psychological stress you had during the pandemic, the sleep disturbances you had, the excess alcohol consumption, and of course, both lack of exercise and also prolonged excessive exercise is also dangerous. Pollution, cigarette smoking, and of course, the sedentary lifestyle all lead to the poor diet, suboptimal nutrition status, which can finally impact our immune function and therefore increased risk of infections. Now, let me talk about, I think I've so far spoke about the problem, and now I speak about the solution. A balanced diet includes wholesome and varied diet that includes all food groups that enable a good immune function. The key point is a good balanced diet combined with physical activities is a cornerstone of good health, and this is the definition of WHO. And if I have to talk about balanced diet for the general audience, it's about 3 major food groups. One is the energy-rich foods, which have cereals and millets, fats and oils, and sugars. 2, we have what is called the bodybuilding foods or protein-rich foods. These are pulses and legumes, eggs, flesh foods, milk and milk products. And the last is the protective foods, which are colored fruits and vegetables, and also includes nuts and oil seeds. Now, ICMR N9 has designed what is called the My Plate for the Day, which promotes health, prevents hidden hunger, and protects from disease. This is a plate developed by ICMR, which you can see on the right, has a milk of 300 ml, and also you can see pulse. And you can start with cereals and millets of here, I would say 240 grams. And then we have fats and oils, little less, 27 grams. And this nuts and oils is for 30 grams, pulses, eggs and flesh foods for 90 grams. And we have, of course, have fruits and vegetables for almost 500 grams, with 150 grams of fruits and 350 grams of vegetables. This is for a 2000 kilocalorie diet we have planned for the adults. And this is how we have categorized the energy from each of the food intake here. And this is equal to 2000 kilocalories and 60 grams of protein. So if you take food in these proportions, you're going to get a balanced diet. And this has been designed by ICMR N9 after a lot of deliberations by various committees. And we also have the Eat Lancet diet, which is also new. And this is a diet that is not only useful for the individual, but also useful for the environment. Similar to My Plate, it's not much different. But the key aspect is that this is a 2,500 kilocalorie diet. And this has been designed for children aged 2 years till elderly. So almost everyone, for the first 2 years of life, we recommend breastfeeding. Therefore, this has been, for children, the diet is a little different. We call infant and young child feeding practices, and we have a different module for that. But about 2 years, we have a single diet prescribed by Eat Lancet Commission, which has a 2,500 kilocalories. You look at the diet very carefully, you can see the whole grain consumption in terms of macronutrients. It includes rice, wheat, corn, and other. They recommend about 232 kilocalories, which is giving about 800 kilocalories of energy per 232 grams. Similarly, they also include tubers and starch, but not much. It's only 50 grams, which contribute about 40 kilocalories. And we have vegetables, all vegetables, like ICMR, so this is about 300 grams of vegetables, which gives 78 kilocalories. And we have also all fruits, about 200 grams of fruits, which gives 126 kilocalories. The whole milk is about 250 ml, or one serving is 1 cup is usually 250 ml. So it's almost 1 serving. And there's also a range which you need to also look into from some of these food groups. It's 0 to 500 and giving about 153 kilocalories. And of course, the protein sources, they recommend different protein sources, but not much. This is very small. You look at beef or lamb. We commonly consume lamb, and it's about 14 grams. Chicken and poultry is 30 grams per day. Eggs, it's just 1 egg is 50 grams, so it's only weekly twice eggs. Fish is good. It's a vegetarian diet. It's about 28 grams. Legumes is a little high, 75 grams, and nuts is 50 grams. You could see that these are the rich sources of protein. And you can look at the added fats, the unsaturated fat oils, it's only 40 grams. And the saturated oil is about 11.8 grams. And sugar about 30 grams. So it's a plate, again, I tell you, is recommended for children aged 2 years and above till the elderly. So 2+, all people can have this picture at your home. And for everyone, you say for every 2,500 kilocalories, depending on your calorie requirements, which again depends on your physical activity and body weight, you need this much rations prescribed. You can always do a proportion and get them equivalent. But now this is what is recommended, but what we actually consume, this is among adults in urban India. So we see that our data shows that we have a very high cereal consumption of almost 300 grams per day, and also 38 grams of pulses and legumes. And therefore, we have more energy coming, almost 1,000 compared to 800 kilocalories recommended by Eat Lancet. We have 1,000 kilocalories and only 120 from pulses and legumes. Of course, fats and oils are within the normal range. Compared to 40 grams, it is 30 grams, still providing 266 kilocalories. Meat, poultry, fish, all together we consume 30 grams. And milk and milk products, which is recommended, is 250 ml. Still, the average consumption is only 120. Nuts and oils, vegetables are also very low. Of course, we have more fruits and we consume more roots and tubers compared to Eat Lancet, which is only 40 grams, and low fruits, which is 90 and 50, together 140. Compared to 500 grams, the consumption of fruits and vegetables is really low. So yeah, and so our diet provides, this is for 2000 kilocalorie diets. This is what we consume on average. So so that is the difference between what is actually prescribed and what we actually consume. And this is for the that was for the urban India. You look at rural India, it is even more worse. Almost 400 grams of cereals and providing almost 1500, 1400, almost double than what is recommended. And look at the milk consumption is low. The roots and fruits and vegetables are also very low. So this is for 2080 kilocalories. This is the diet we actually consume with a lot of cereals. It's a cereal-based diet is what I would say. So the idea is, if you look at how this has to be consumed, when I talked about the energy-rich foods, this has to be consumed in moderation. And when you talk about cereals and millets specifically, you have to make half of your grains whole, which means whole grains are those like wheat. Wheat is a whole grain. All millets are whole grains, and maida, rice are refined grains. In South India, we usually consume a lot of rice and maida, but this has to be not more than half of your grain consumption. So therefore, you have to include whole grains, cereals and millets, especially wheat, parboiled rice, and bajra in your diet to make your food wholesome in terms of fiber and other phytochemicals and micronutrients. So this is one key message I would give, that in a South Indian population, even wheat, whole wheat, chapatis are really good. So you make it, if you're only eating rice a day, then that's a problem. So ensure that one meal comes from wheat in a day at least, so that half of your grains are whole. So they provide not only fiber and other micronutrients, they help in improving gut microbiota and immunity. And regarding oils, so the second group is oils. We always say to use variety of oils or blend of oils. For example, sunflower oil is rich in MUFA, groundnut oil is rich in sunflower oil is rich in PUFA, groundnut oil is rich in MUFA, olive oil is rich in other omega-3 fatty acids. So each oil, even soybean oil is rich in omega-3 fatty acids. So each oil has its unique fatty acid profile. Therefore, it is recommended to use multiple varieties of oil. So if you have bought, typically we require somewhere around per 30 grams, 1.2 kg, 1 kg of oil per person per day. So if you're bringing in oil in liters, so you can always purchase 4 different kinds of packets of different different compositions, be it sunflower, rice bran, and use them at home. The key difference between oil and fat is that oils are liquid at room temperature. That is how you differentiate an oil, which is healthy oil. Healthy oil, I mean, we recommend not more than 10% of calories coming from fats. This is very important because they have been known to increase the risk of various comorbidities such as cardiovascular disease. So clearly, fats should not have saturated fat, and saturated fat is a risk factor for CVD. So not more than 10% of calories should come from them. If you look at why it's so important to see the fiber coming, this is a dietary fiber. When I previously spoke about how the wheat flour is a rich source of fiber compared to rice here, which is only 2.8 grams. So and even maida. So both rice and maida have very low fiber content compared to wheat flour of 11.4. You look at other millets which are high. Example, bajra has 11.5, ragi has 11.2, jowar has 7.2. So all the millets are a rich source of fiber, and even pulses are also a rich source of fiber. So therefore, these are, compared to meat, pulses not only provide good quality protein, but also are a good source of fiber and other vitamins. So that's what we recommend to make your grains whole and more consumption of protein, vegetable protein, especially pulses. So that's what we come back to. So we always say that the bodybuilding foods such as pulses provide good source of protein as described previously, and have to be consumed adequately. And when you bridge cereals and pulses together, the cereals are deficient in lysine, pulses are deficient in methionine. It's an amino acid. And when you combine them in a ratio of 2:1 or 3:1 ratio, your energy, the amino acid score improves and the protein quality also improves. So cereal pulse combination is a good combination that has to be followed and typically practiced in Indian recipes, be it idli, be it various culinary practices, be it khichdi. We always try to have this practice of mixing rice and cereals, and this is a good practice to get good quality protein. So pulses are also not only rich source of fiber, but essentially B complex vitamins such as thiamine, riboflavin that are depleted very quickly in the body. So compared to fat-soluble vitamins, water-soluble vitamins do not stay a long time in the body. So if you are not eating, if you are fasting for 7 days, then all your B complex vitamins will be wiped out very quickly. So therefore, in emergency situations, all hospitals have prescribed B complex tablets for their patients so that they don't get depleted with B complex. So in situations like pandemic, where you are at home and you're not able to have good quality, the balanced diet, then the first vitamins that will be getting depleted is the B complex vitamins. And therefore, we always say to store adequate amounts of non-perishable dry rations, in this case pulses such as cereals and pulses, for at least 2 weeks during time of food shortages or lockdowns or whatever. We hope that there's no such thing happening in the near future. And compared to the next rich source of protein is we recommend is milk, and this has to be a low-fat milk, which are rich in protein and also provide calcium for strong bones. Especially the bone density of adults keeps increasing even from 20 to 30 years also. So there is some amount of bone density that happens, the bone remodeling happens, and therefore we should always have low-fat milk, which provides good quality protein and calcium. And when you say red meat, so the difference, how do we identify red meat compared to what is called a lean meat? It is all mammalian meats. All mammalian meats are red meats. So be it mutton coming from lamb, be it beef coming from cow, all mammalian meats, all mammals, they give red meat, which is harmful. And all meats which are not mammalian meat are relatively good, especially fish. And chicken is not a mammal, it is a bird. So that's why even it also has a lean meat. So that's how you have to differentiate between a mammalian meat and a lean meat. So this is a good way to remember for anyone asking what is bad for health. So all mammalian meats are bad for health. So in one study, they have clearly shown that vegetarian diets had 12% lower overall mortality risk compared to omnivores. So it is because of high fiber content, phytochemicals, and other nutrients that actually reduce cholesterol. So clearly, vegetarian diets are useful for long-term health. And the lowest risk was among the pescatarian diets, those who consume only fish. So fish is a good example where the omega-3 fatty acids you get it, and is a part of Mediterranean diet. So Mediterranean diets are one of the best diets that have shown to have long-term benefits. So if at all you have to consume some amount of animal source foods, the best source of animal source food is fish. And eggs also provide high quality protein, and especially are useful in programs such as ICDS, where it is easily stored for long compared to other things. Egg is stored for longer duration and provides 1 RD of any nutrients per 1 egg. So for example, it provides 1 RD of vitamin A if you take it per day, and also provides 1 RD of B12. So the only problem with vegetarian diets is they are B12 deficient, and therefore we recommend either fortified rice or more milk, or make milk has some B12 but not much, or 1 egg which actually provides 1 RD of B12. So there has been some amount of news saying that you eat fish, foods, eggs, or chicken, and they lead to increased risk of infection, thinking that COVID-19 was transmitted through the poultry. So there was some myth in Telangana where there was a lot of campaign by the government saying that it's not true, and of course it is not true. So more importantly, these foods help to improve immune system and recovery during illness. So protein-rich foods are especially important during illness, because during illness your protein breakdown is much more faster, and you require more protein to protect against illness. So that is one way, and therefore we do recommend some flesh foods, but it has to be cleaned and cooked properly. So now the third category is the productive foods, which has fruits and vegetables. And we say that the recommended nutrient is 5 servings per day by WHO, but Mediterranean diet recommends 7 to 8 servings. 1 serving is roughly about 80 grams. So they are not only, we have to, there's no upper limit for what you consume in terms of colored fruits and vegetables. The more you consume, the better. They are rich in many nutrients that provide fiber, antioxidants, minerals, and other vitamins that help in improving immunity. So especially the dark green leaf vegetables such as amaranth, spinach, fenugreek, these are rich source of vitamin A, iron, and calcium. There are yellow colored foods such as are also rich source of vitamin C. Each vitamin is for example, citrus fruits rich in vitamin C, papaya, carrot, mango are rich source of vitamin A, and both are antioxidants. Vitamin C is one nutrient which is water soluble antioxidant compared to vitamin A, D, E, K. They're all fat soluble. So this is what we recommend, that we recommend at least 5 servings of fruits and vegetables a day. Now, a serving is roughly about 80 to 100 grams. This is what is the definition. So, for example, if you take any medium-sized fruit, for one banana is 1 serving, 1 apple is 1 serving, 1 orange is 1 serving, or if you want to have green leaf vegetables, we say that it has to be chopped, and that would be 1 cup, because green leaf vegetables have, when you chop them, there's a lot of air space in between the leaves. We say 1 cup to be of 1 serving, and similarly half cup of other fruits and vegetables. So if you're not sure about other fruits and vegetables, what should be the size, you just cut them in. You cut them. Sorry. You cut them and half. Half cup of other fruits and vegetables. If you cut them and then put it in the cup. So if it brings to half cup, it is fruits and vegetables. So other colored vegetables are also rich in polyphenols.
Sorry for the disturbance. I'll just try to fix it.
Other colored vegetables are also rich in polyphenols. So okay, that reduce the risk of chronic disease. Nuts and oils such as groundnuts, mustard seeds, gingery seeds, flax seeds, almonds, walnuts, also rich source of polyphenols and minerals that improve immunity. And therefore, it is recommended to have some nuts. For nuts, it is very easy to remember. We say 1 fistful. So for fruits and vegetables, you just show your hand. It has 5 fingers. It is 5 servings a day. And for nuts and vegetables, for nuts and oil seeds, you say 1 fist. You take groundnuts in your hand in whatever amount you can, and then hold it in a fist. That fist is sufficient for a day. So be it groundnut, be it mustard seeds, gingery seeds, flax seeds, all of them, just 1 fistful of nuts is what we recommend. That comes roughly to 30 to 40 grams. So these are simple, easy to remember messages on how we actually give counseling in terms of serving sizes. Now the last is the water and electrolytes. Salt especially is, increased salt will lead to increased hypertension. So we recommend less than 5 grams. That is approximately 1 teaspoon. So when we say less than 5 grams, it means that whatever salt we put even in the curries are also included. So the simple way to remove salt from your diet is to remove the table salt once on your table. So if you remove the table salt from your table, then you'll be consuming less than 5 grams. And always use iodized salt and keep yourself hydrated. So it's very important that we use iodized salt and not any other salt, because we still if we still have iron deficiency problems. Our diet is relatively poor in iodine, so therefore always use iodized salt. So coming to glasses of water, we recommend about 8 to 10 glasses of water. It's about even fluids also we recommend, including lemon juice. Tea and coffees in moderation is okay, but not many. So not too much of caffeine has to be consumed. And also avoid sweetened fruit juices, which are rich in sugar and fructose, like syrups, fruit concentrates, fizzy and still drinks, because they have a lot of added sugar. It is recommended that we should not consuming more than 10% of calories from added sugar. That is the maximum we should be able to consume. So for example, for every 1 gram of sugar gives about 4 kilocalories. So for a 1,000 kilocalories, or for a 2,000 kilocalorie diet, this would be around 210 kilocalories should not come from sugar per day. So that is also very high. Nowadays, we are saying it should be less than 5% as well. So the less amount of added sugar, the better. Always check food labels to confirm what is the added sugar in the food product. And ensuring consumption of clean foods and practice safe handling foods for better health. Now we spoke about what food amount we have to be taken. Now we'll be talking about the meals and snack frequency. It is generally recommended to consume small and frequent meals, as this maintains normal blood sugar glucose levels. So that's what we recommend. And for example, 5 servings. So typically your morning breakfast should be heavy, and then you taper down, your lunch should be moderate, and your dinner should be early and light. And that is what we recommend, because a low carbohydrate meal is good for the night, because your body is resting and will not be able to metabolize the glucose that is ingested. So a low carbohydrate meal in the night will help you also reduce the risk of diabetes in the next few years or as you age. For snacks, we recommend choosing raw vegetables and fruits or home cooked foods, especially you're at office. That would be the best snack you take to your office is always a raw vegetable or a fresh fruit, because they give you, as we have said, it has to be 5 servings per day, and the best way to fill them is through snacks that you can be taking it an apple, taking an orange, or any other cut fruit and vegetable in your tiffins would actually help you increase the consumption of fruits and vegetables as snacks, which will help you improve your glucose metabolic load as well as improve your health. And also avoiding foods that are rich in what we call the HFSS food, that is foods rich in high in, H stands for high, FSS stands for fat, salt, and sugar. So these are the HFSS foods. So foods high in fat, salt, and sugar are detrimental to health, and these include all the outside foods and the fast foods. We call them the junk foods, be it chips, the ice creams, the sugar sweetened beverages. So this has to be, all of them are actually unhealthy, even though we consume. But as said, that this has to be avoided. And for a good health, coming to physical activity. So balanced diet is one aspect of your daily routine for health. The other aspect is physical activity. Regular physical activity is especially important for maintaining ideal body weight and in general for bone, muscle, heart, and lung health. So we do recommend that physical activity is especially important during the period of home stay, where you're not going outside, and this can lead to reduced energy expenditure and you easily put on weight, especially during the time of pandemics. So there could be, if you're at home, there are various indoor physical activities such as yoga, aerobics, dancing that you can all do. It is recommended to actually do 30 minutes of physical activity. So when we say 30 minutes of physical activity, it is just not a simple physical activity, but your heart rate should rise a bit. You should be, there should be slight, you should be able to see a slight amount of heartbeat. You'd be able to a light amount of heartbeat, or a small sweat has to come out, and then you know that you have done a physical activity. For example, a lot of people take their phone and walk and talk. That does not come under physical activity, because you have not raised your heart. If you raised your heart rate, which means that your BMR is raised and you will be able to burn your calories. So it is important to have, that is what we call brisk walking. A brisk walking is one where your both feet are 1 yard apart. While you walk, when you brisk walk, your front leg and the back leg, the distance between both is 1 yard, and you'll be able to feel it. And 1 yard, once you do brisk walk, and if you're doing normal walk, you just observe yourself, your foot are very close to each other. But in a brisk walk, your both foot are a little far, exactly 1 yard apart, and this is the right amount of space, and you'll be able to walk faster, and you'll be able to improve your heart rate and the metabolic rate. This is for adults. For children, we recommend not only 30, we recommend double the amount for adults, that is 60 minutes. And this is actually 5 days a week. So you can always have a 2-day rest break, but definitely 150 minutes of physical activity for adults. Similarly, almost 300 hours of physical activity for children to maintain ideal body weight and good optimal health. So when you talk about ideal body weight, we always say in terms of body mass index. So it is very simple to calculate. You have your weight, and then you have your height. So weight in kilos, and by height in meters square. So you have to whatever is your weight, you divide your height in meters square, and you get the BMI. So ranging from, there are a lot of apps and calculators. You can just go to Google and you can just check for your BMI, weight, and height in meters. And the range is always 18.5 to 25. This is what WHO recommends. For Asians, it is 23, so even lesser. So anything between 18.5 to 25 is a healthy, optimal body weight. So this is what we say. So it is already, so your weight, it is not the weight, it is the BMI. So your weight has to be related to your height. You're taller, you have more weight. Therefore, the BMI is adjusted for your height. So we also recommend physical activities. Another benefit is to exposure to sunlight for 20 minutes to 30 minutes, especially during the noon time. In the noon time, you should have slight burning sensation on your neck then you know that you have got enough sun exposure. Even 10 minutes of that will help you getting slight, not heavy burn, slight itch on your neck would be enough, so that you get enough vitamin D. And also the last important thing is to have a maintain a regular sleeping pattern. And this sleeping pattern varies from person to person. Some people require 8 hours, some people require 7 hours, but the most generally recommended guideline is 8 hours of good sleep. But it can vary depending on the individual. So you have to be comfortable, and you should be feeling afresh after your sleep. So in general, I conclude that the both undernutrition and overnutrition can increase the risk of severity of infection. So we should be, both sides of the weight BMIs are dangerous. Less than 18.5 is dangerous. More than 30 is obese. So 25 to 30 is overweight. So both are dangerous. And balanced diet along with physical activity, which I've explained in detail, is the cornerstone for good health. And especially in urban India, where where we don't have enough fresh foods, which are rich in micronutrients, and especially in lockdown periods, this is a message I used to give in lockdowns. What should I do when I don't have fresh foods? The next best available option is fortified foods that are already fortified with key public health micronutrient such as iron, zinc, vitamin A, D, or B12, folic acid. So nowadays the government is encouraging fortified foods to improve micronutrient deficiencies, and it's a good strategy. It's a good medium-term strategy to reduce micronutrient malnutrition. With this, I conclude my presentation. And finally, this is a slide. Just want to show that it's not just for us; it's also for the environment we eat. So, eat to live, but not live to eat, is the final message I would like to give. Thank you all. You have any questions? I'll take them now. Thank you.
Yeah, anybody have queries? Please feel free to put it in the chat box. Or if you want to ask directly, you can raise your hand. We'll call your name. Sir, you're not audible, sir.
Sorry. Okay.
Yeah.
Hasib sir has said that my parents say that if someone consumes 4 to 5 servings of raw vegetables and fruits every day, I will develop indigestion. Is it true, sir? So okay. Now all fruits are raw, so you have to consume them raw. Be it banana or no, be it apple, orange, pomegranate, they're all raw. Some vegetables, if for example, we have cucumber, we have tomato. They're not that they're easily digestible. Some vegetables are easily digestible, some are so not. So it depends on the vegetable you consume, but typically most fruits can be consumed raw, but some definitely not all vegetables could be consumed raw because some are very hard. Now next question is asked is, one expert on a social medium says that any type of fasting during morning promotes autophagy and ketosis. He says that ketosis is very beneficial for the brain. What is your opinion? So now fasting during morning. So again, so it depends on, for example, Ramadan is a little different. So they have different practices, and each of them, the general evidence show for, especially for working group population, is that you take your breakfast heavy. Once you take your breakfast heavy, you have enough blood and enough glucose to your brain that can actually even delay your lunchtime as well. So you'll be feeling good. So take moderate lunch and dinner. So especially night time, you should be taking low carbohydrate meal is what I recommend. So that's my opinion. Anyways, it's okay. Now can we replace sugar with jaggery? Is it a better option? Yes, partly it is. Among the two, jaggery is better, but still it is also a refined sugar, so you should take in moderation. Next, is RDA same for all ages? Someone has asked, is RDA for all? No. RDA is not same for all ages. I've only given you a diet which is for 2,500 kilocalories that could be used for all ages. But in general, RDA is the recommended dietary allowance. And we also have what is called the estimated average requirement. And these are different for different age groups. So we have the ICMR. You can go to our website and type in Google ICMR N9 RDA EAR report. You have the full report access. So they're different for different age groups. Is intermittent fasting really good for health? This is an area of debate. Some say there is some evidence for reduced weight loss. Definitely, when these do come when you have some problem. So you do that when you already have. So for a normal diet, this is for normal people. What I just discussed is for normal people at normal times. But depending on use cases, there are some benefits, but they're definitely not well proven. So there's more evidence needed, is what I would say. So in the generation of adulteration of food, how do we differentiate between non-adulterated food and the adulterated food? Yeah, so we have some mechanisms for we can there are food safety precautions. You can there are some colored foods are, we can identify some foods, not all, but this is, so the best way is to see whether it is being labeled by FSSAI as good, healthy or not. So FSSAI is taking care of the food safety issues. So see the logo of FSSAI, because every company that is registered to FSSAI has to go through some amount of mandatory checking of all the nutrients, and it is very difficult. So even they might FSSAI takes care of that part, but still it could be possible. Adulteration food, and there are various techniques which I can send you some links later on after the end of the session to madam, and you can forward them. And finally, I hope, is there any food we can have for better sleep? So foods which are melatonin, there are some foods which improve melatonin. So melatonin is good. There are some foods which improve melatonin. Yes, you can have, there's one good book on that. All foods that improve melatonin can improve better sleep, and just type melatonin rich foods and you'll get a list of foods and you can act accordingly. I have found raw foods to be costly monetarily. Yes, it is costly monetarily, and you're right, it is costly monetarily, but no, just I think it's a good exercise one can do. When you take a KFC burger, which costs about one chips, one burger, it costs 300 rupees for how many calories? So monetarily, we still buy KFC foods, even though it is costly. Even the fast foods, they're costly, but compared to that, it's quite cheap. So if you're talking about rice, compared to rice, it is costly, but compared to outside foods, it is quite cheap, is my opinion. Yeah. Anything else? I hope I have answered all the questions, the chat box, madam, and over to you.
Thank you for such insightful session, sir. So now I invite our scholar, Vanaja, to come forward and give oath of thanks.
Yes. Good afternoon, everyone. I am Vanaja, Research Scholar, Department of Psychology, Osmania University. It's my pleasure to acknowledge you, sir, Dr. Raja Sriswan, Scientist D, NIN, for sharing your precious time and knowledge on the given topic. Yes, sir, association between nutrition and physical well-being in new normal situations is very much noticeable in terms of malnutrition, lack of immunity, mortality, risk of infections all over the world across all ages, sir. And I hope your neat presentation with colorful pictorial statistical illustrations has really made the session mentally nutritional. Everyone, I think mostly many individuals wondered what to eat and what not to be healthy during and also after the pandemic. With the information that you have provided, I hope all of us will be able to manage the upcoming newer normal situations through healthy diet management, sir. Thank you so much for addressing our queries too, sir. Thank you for your nutrition session. Thank you, sir.
Thank you, Vanaja, for such sincere vote of thanks. Thank you, sir. Shortly, we'll be having a validatory session. I hope your presence will continue till then, and in between, we'll be sharing a feedback form.
So good afternoon to all. I think it's nice to listen to such good lectures. I think generally we don't meet any nutritionist personally in order to get the valuable information. But here, we are fortunate enough to have the session on nutrition also. So the last part of the program is the valedictory session. I know most of you are eagerly waiting to wind the session and then leave. But however, there is a slight change in the program. ICSSR Director, Professor B. Sudhakar Reddy sir, he is held up with some work. So by the time he joins, what we'll do is we have with us our guest of honor, Dr. Pingali Sri Lakshmi Garu, psychiatrist. Most of the people might be aware, whoever is in the city, like how famous she is, very known person. So we feel like we'll start the session. Once the directors joins us, then we can continue with the seminar report and other information that has to be imparted to him. So he gave us the permission to go ahead with whatever event that has to be happen now. So Sri Lakshmi, Samyukta, can you just start the program with regard to the introduction of the guest of honor?
Yes, ma'am. Yes, thank you. So welcome all, and it's time to conclude today's session with this valedictory session. And though this is a 2 days learning, I'm sure we'll all sincerely try and make an attempt to apply these learnings to ourselves and in our respective fields. So today I invite our guest of honor, Dr. P. Sri Lakshmi, Professor of Psychiatry. And I invite Ms. Rohini, second year MS Psychology student, to give introduction about ma'am. Rohini, over to you.
Samyukta, just a minute. It's not Rohini. Vanaja has to introduce Rohini for the chief guest. So that
okay, ma'am. Okay. Yeah, Vanaja, please. Over to you.
Okay, ma'am. Yes. Now, I take this opportunity to invite, ma'am, am I audible?
Yes, yes.
Okay. I take this opportunity to invite our next honorable speaker, who is a professor of psychiatry, Government Medical College, Sangareddy. She was a past editor of Telangana Journal of Psychiatry, ex-president of Hyderabad Psychiatric Association, member of AP Medical Board. Now, ma'am is working as consultant psychiatrist at Rohini Counseling Center, Begumpet, Hyderabad. In addition to the baggage of academic, professional, and experiential expertise, the qualities of being a good human being, being very empathetic with patients, being always approachable for all the departmental programs, add feathers to her hat. As a known psychiatrist, ma'am, it's our pleasure to have you with us today. I humbly invite you, ma'am, to address the session now.
Thank you so much. Thank you so much, Vanaja. Thank you, Swati Garu, and the rest of the organizers and the listeners, the audience also. As a special thanks to you for being patient and still attending the last session of the day. So I hope to make it very interesting for you. And so in the, before I start, I was having a look at all your topics, which were very interesting for the last 2 days. And what I've seen is most of them have been about resilience, about a fantastic presentation. I was in the last session about management. And just give me 1 second, please. Yes. So I hope I'm audible to all of you.
Yes.
Am I audible? Yes. Okay. So I've heard a fantastic session about your nutrition, resilience, empathy, and so on and so forth. And it's a very, very essential life skills that you have been talked about for the last 2 days. And I am going to, change the focus of presentation a little bit to tell you that what you have heard is how to hold on to your positive mental health or how to enhance your health further. Being a psychiatrist, I will bring you back a little to my subject and say that as long as you're physically and mentally healthy, it's a wonderful thing and all of us should work towards it. Sometimes, however, this health becomes sickness. So it is when the underlying sickness bursts into our daily life in the form of ill health, whether it be physical or mental ill health, it takes a big toll. Our adolescents, especially, or the young adults, are very, very vulnerable to many stressors the pandemic has brought about. And I have worked in Gandhi Hospital the entire 2 years
of the pandemic, wearing the PPEs and going from patient to bed to for mental health support. And I will, as I go through the next 10 slides, I promise you this presentation is going to be not more than 15 minutes. And as I go through the presentation, I will also share with you my experiences of what I have seen as we go along. And in my 2 years in Gandhi, during the terrible lockdown that we had, the first time when nobody else was on the road except for the dogs, cats, and the doctors who are working in the police personnel who were enforcing it. So it was that bad. And during that time, can you imagine the life of a young adult who may have recently passed out and looking for a job, or may have got an offer letter but now has been taken back, or about to give his exams, or people like my son who were in his 10th standard and could not even go to school. And we all know the 10th are the best years to make friends for a lifetime also. So all this has taken a lot of toll. Adolescents and young adults are a special focus of interest because the adolescent brain or the young adult brain is still developing. Now, when you compare it to an adult like myself, for instance, you will find that a young child's brain is fully developed by the age of 3 years. You have more number of nerves and more number of neurons than you would normally require. As you reach adolescence, your entire brain starts to get pruned. Pruned is the extra nerves are cut out, remaining nerves, useful nerves are kept behind. What are cut out, what are left behind, again depends upon both your genes as well as the environmental insults or any stress or trauma. And can there be any more traumatic than being cut out from your family, not being able to talk to people, locked up in a room for 15 days because you're infected with the virus, you don't know what your future is going to be. So that is how bad the impact on the developing brain has been. Now, it is also the time when children or young adults are, their cognitive functions, or the ability to control their emotions, that part of the brain is still developing. Therefore, teenage behavior, we normally talk, oh, this is teenage behavior. He's growing up, so therefore he's behaving like this. So when such behavior happens, normally also it will happen in adolescents, in a restricted environment, the possibility of impulsive behavior increases further, because that part of the brain which is telling you don't do this, don't do that, develops a little later, say in mid-20s. So therefore also the adolescent is more vulnerable. And adolescents or young adults is the time that you learn social skills. You go out of home, you meet friends, you go to school, you interact with your teachers, friends and family. And this is the time when you learn worldly wiseness. You learn your skills to talk to each other. And because of the lockdown, or because of the pandemic, and because of the isolation, many of our children have lost these skills. Some did not have it to begin with. Some who are just developing at this age also lost the opportunity to develop. There's also poor social support. See, some of us are lucky to have regular jobs. We could go back home to our parents or our family. Some adolescents or children have not been so lucky. Their parents have passed away, or they are the children or adolescents of migrant laborers who didn't even have a home to call their own. So the social support, and when social support reduces, it's a well-known fact that mental illnesses increase. And of course, there was an absolute lack of routine for every child, adult, and adolescent. You can wake up at whatever time you want. You can sleep at whatever time you want. You just heard the earlier speaker speaking of melatonin. Melatonin is very sensitive to sunlight, to light. And if your entire day and night cycle is reversed, you're waking up throughout the day and sleeping throughout the morning, there is no use of melatonin in the day. So this way, a lot of changes have happened to us because of circumstances around us that we cannot control, and circumstances inside our body which is happening because of the external factors. Added to this, I as a mother have told my son not too much screen time. Now I am the one encouraging him to screen use karo. Use more screen time because you need to study now. So people who already have a tendency to get addicted or use more screen time, we have actively pushed them into their addictions. People who use internet as a means of running away from their anxieties, we have actually pushed them towards that. So people have started either to get addicted to it or use this as a coping mechanism to reduce their own personal stresses. So, like I said, when you're locked up in a room, you're locked up in a house with family members, and your home environment is not very conducive, or you're not having a happy family situation. People are abusive, father is alcoholic, or there is continuous domestic strife in the family, the child or the adolescent has no means of escape from such a traumatic situation. The incidence of domestic violence, even according to our country reports, has increased manifold during the pandemic. Similarly, we as parents also are anxious about our health, about our children's health, which rubs off on the immature adolescent in the house. Other factors like uncertain financial situations, where is the next meal going to come from? When will my father get back his lost job? All these are stresses which they cannot solve, but cannot escape either. Added to that, multiple deaths in the family have also added a huge. Multiple deaths in the family has, for instance, even while working in Gandhi, I have seen people who have lost father, mother, or sometimes the entire family is wiped out because of COVID and only one child or one adolescent is left behind. Or there is death in one family members running around to look after patients infected with COVID. That father passes away. Next week, the son who was looking after also passes away. So highly traumatic incidents have happened during the pandemic. Now imagine a child or an adolescent, young adolescent, and I'm sure all of you as students of psychology know that adolescence or young adulthood is the time for onset of mental illnesses also. So when you are in a crucial phase where when you're vulnerable because of your genetic factors and other factors, you're vulnerable to mental illness and you're having to cope with so many things around you. Death in the family, abuse, drug use, unlimited internet use, strain, worry about future, so many things. Don't you think mental illness, which may or may not have come or may have come after 10 years, we have simply expedited the process and it has come earlier. Is it really true? Yes, it is. And especially think of those adolescents or young adults who have already had a mental illness, already suffering from anxiety, already suffering from depression, already suffering from psychosis, or developmental disorders like autism, like mental retardation. There is no going out for socializing. There are no, they can't go to special schools where they used to have some kind of routine. They have no access now to mental health services. Medicines are not found anywhere. This was a situation at one time, the early pandemic in 2020, where even access to basic healthcare was also such a big challenge. So all those who had mental illnesses to start with, even before the onset of the pandemic, relapsed tremendously after the start of the pandemic. So not only are people who had who are now vulnerable and therefore got an illness post-pandemic, there are people who were already having it and worsened during and after the pandemic. So this is what the pandemic has done to our mental illness. What has happened? Now, this is a UNICEF study in Latin America, that's South America. It has seen that 27% of women feel anxiety more than men and 15% feel more depression than boys. 1 in 2 of the young adults feels less motivated to do activities they normally enjoy. 43% of young women feel pessimistic about the future compared to 31% of men. Now, we already know that women are a little more vulnerable than men are. One, because of the biology. You have periods, you have childbirth, you have menopause. Body constantly changes and therefore more vulnerable. Our positions in society and the trauma of the pandemic, where in most households that I've seen, it is a mother who's holding the entire family together. Even when the father also falls apart because of illness, perhaps, or the loss of job, or the worry of finances, it is often seen it is a woman who puts up a brave face. So what is it? So I told you about South America. What about India? The same UNICEF did in India. It found that when they talk to people between the young people between 15 to 24, only about 40% of them have said it is good to get support for mental health problems. Unfortunately, friends, this is the problem in our country. We do not identify mental health problems. We do not accept that we also have a mind that can get ill. Our treatment gap is almost 90%. What is treatment gap? It is if suppose 100 people need treatment, only 10 are getting it. The remaining 90 are not getting any kind of treatment. Imagine then going to a pandemic situation where even the whatever available treatment also becomes limited. So this tremendous stigma about mental illness, this lack of access to mental health care, this kind of unawareness has also taken a lot of 14% of them, 14% of adolescents who have been reviewed have talked about feeling depressed or having little interest in doing things. Even before the pandemic, 50 million children in India were affected with mental health issues. 80 to 90% have not sought support. Please let the numbers remain with you when you're talking of mental illness. So, what do we do to then reduce this, or what can we do to help them? First is, of course, to look for the red flag. So awareness is the key in any kind of management of any kind of mental illness. So we have talked of positive mental health, we've talked of empathy, we've talked of resilience, we've talked of coping. Now let us look at this adolescent who comes to us at the age of say 18 or 19, who has been locked up at home for the last 2 years because of the pandemic, already a very shy, introverted person, has no social skills whatsoever, now has to go to a hostel to study further. How do you think this child or this young adult is going to live through his life? The minute you are away from the comforts of your home, or at least the relative comforts of your home, you go to a place where you have to adjust with new people, new food, new environment, all of them start acting as stresses. And if this child already had a vulnerability, some parent had depression, anxiety, definitely the signs of mental illness will start to come. If only an adjustment disorder. Now we know that mental illnesses can range all the way from adjustment disorders to severe depression to schizophrenia, right? So vulnerability to mental illness means any kind of illness may cope up in such people. Now, who are these people then who should be aware? I think it is you and me who should be aware. You means as a friend and a classmate, you are the first ones to see that something is not right with this person. How can I help them better? The teachers are the second ones who will say that, okay, this child seems to be a little different than the others. Let me see what it is. The counselors, the college counselors, the school counselors, the institute counselors are the next rung of support. And finally, it comes to the psychologists and the psychiatrists. So unless you're aware that something is going wrong, you can never catch it. Now, the problem with us is this is where these are the last 2 slides. I'm going to spend a little time on this because it is very essential. What you need, what is awareness of mental illness? Most times when somebody is talking to us about a problem or saying, I'm not feeling well, our immediate reaction is, oh, you are afraid of just this much? Do you know what I am going through? No, nobody asked you what you're going through. If you want to be a good friend, the best thing is to listen to them non-judgmentally. Right? And if you can offer advice, please do so. But most people talk not because they need advice, but it is because they're wanting to simply vent their feelings. Be a good buddy. Listen to them. Understand what they're going through. And if you think, look, this seems to be something that I cannot handle, or this seems to be something which is not quite normal, can we take support? So this is very, very essential to be a good friend. To be a good friend, you have to be a very good listener. Don't brush people's problems under the carpet saying, oh, my problems are bigger, or you're thinking too much, or, think less, think positive. If they could have done it, they would not have come to you in the first place, right? If I could think positive and I could think everything is right, I would not have approached you for help. If I'm talking to you, that means there is some kind of distress in me. Therefore, I need your help. So be a good listener, be a good friend. Then, what do you need to see? If somebody is not coming up to you, but you're making some changes, you're seeing some changes, what do you see? Some change in behavior. A person who would be very calm earlier would now become extremely irritable. A person who would be very social earlier would prefer to remain, indoors and not mingle too much. A person who never used drugs suddenly started to feel good when they used weed. I had this child about 18 years old who came recently and said, what is wrong in using weed, ma'am? I use it to calm myself. And such lovely descriptions he gave me. I nicely smoke a weed joint and then go and lie in the swimming pool. You know how calm it makes me feel. So many children come up with this kind of experience. Do you know what havoc it is causing in your brain? How many nerves are dying with even a single smoke of that weed? So the temporary calm is a huge price to pay. This you should know, and you should tell your friends also. You find that the person is not sleeping at all or sleeping excessively, suddenly. I'm not talking of these long sleepers like myself who like to sleep 10 hours when I'm fortunate enough to have the time. I'm talking of all such people who would be, just sleep 6-7 hours, quickly get up, rush about the day, doing all that work in no time. In these people, you see a sudden change where they're very lethargic, wanting to sleep all the time, not wanting to get up, not wanting to interact, not wanting to talk. And when you talk, they'll bite their head, bite your head off because they're so angry and irritable all the time. You are looking at signs of a mental illness. So since most of you, all of you are psychology students and you know the illness is better than me, this is a message possibly you could go to and give your other family members so that they understand that no, this is not adolescent behavior. No, this is not somebody who's deliberately acting out on it. Or no, this is not a person who's enjoying this behavior. This is a person who's actually. So look out for signs of mental illness. You know the other signs of psychosis, hallucinations, delusions. Let's not go there. But since you will be the first one, any friend, any young person who wants to talk will first talk to his roommate, will talk to his friend, will talk to his classmate. Nobody approaches the teacher first. So you can act as a gatekeeper. You can act as a guide for correct direction to take. Then, of course, the counseling and treatment. A little word about treatment. Do not fear a psychiatrist. See, there are lots of fears about psychiatric medications that you get addicted, there are lots of side effects, and that you put on weight and you sleep more. It is not true. More severe the illness, the more serious the tablet. The milder the illness, the milder the tablet. Therefore, less the side effects. So, who is a sensible person who comes for treatment, finishes off, and goes on with his life? Who is the person who is suffering? The person who tries to hide their illness for years together, comes when the nerves have become chronic, comes when the illness has become severe. You have to give a higher dose. Why blame the medicine? Isn't it? So, the same UNICEF had asked a lot of young people on how did you cope with the stress. So, some nice answers had come. So, some said, I read and write whenever I feel bad. And I have cried, but I also have tried to distract myself. Okay. And some other people have said, I've kept myself busy, I have exercised more. Some other person has said that I try not to stress too much and I try and avoid panic. So it is a fact that all of us have felt stress, more so in vulnerable age group where people don't understand what next, what happens to my career, what happens to my life, what happens to my studies. So the stress is certainly more in them. And some people have tried, and you have been given a lot of skills in the last 2 days workshop on how to deal with stress when you get it. I am talking of the next level, that when all of this you're doing but not reaching anywhere, this is the time that you take professional help. So how can you help? I've already told you about this. Let's start by breaking the chain of stigma. Start by yourself. Not feeling well, reach out and say, I'm not feeling well. I remember not feeling well, tell them, let's go to a psychiatrist and talk. Don't make the word psychiatry or psychiatrist or mental illness a word of abuse, a word which people will hear and say, oh my God, don't tell me about that. So I see a lot of hope. My youngest patients who come to me these days by themselves and getting their parents along are 15 and 16 and say, Doc, I think I have ADHD. I think I have depression. I think I have anxiety, and so on and so forth. Self-diagnosis is there, but I'm glad that at least you're making an effort and not feeling scared to come to the psychiatrist and say, look, doc, I think I have ADHD. I'm not able to concentrate these days. So whenever you have issues, reach out to a person you trust. Online resources are many. I come from Roshni Counseling Center, as I've been introduced. Roshni also runs a helpline, it's essentially started as a suicide helpline. And it is from 11 to 9 every day of the week, where you have volunteers volunteering their time. Nobody pays them. They just sit at the end of the phone. You call them, they will listen to your problems, they will understand what you're going through. They're not going to ask you questions if you don't want to answer. They're not even going to ask you your name. So they are going to act like a friend. If you want guidance and you ask them, maybe they'll guide you. Okay? Take professional help. There is no shame in having a mental illness. Your body and mind need equal attention. If you have diabetes, you will go to the doctor. If you have hypertension, you'll go to the doctor. If you have asthma, you go to the doctor. If you have typhoid, you'll go to the doctor. So if you have depression, if you have anxiety, if you have sleep disorders, you have to go to the doctor, because it is your body which is suffering. And as a last word of caution, all gloom and doom I know, but then just so that you remember, depression, anxiety, all do not occur in isolation. It has long-lasting effects on the body. So if you have a disease, arthritis, skin diseases, bladder problems, gut problems, all of them will worsen if there is an associated depression. So when you're treating the mind, you're treating the body and mind as well. Adolescence or young adulthood is a vulnerable stage. Body and mind both need help at that time. There are lots of confusions going on both in the body and the mind. Added to that, the pandemic is added a lot more confusions. So when you need clarity, reach out for help. There is no shame. Thank you for your attention, all of you.
Thank you, ma'am, for such wonderful session. Actually felt it's quite brief, and yeah. Now I invite audience, please participants come forward. Any queries, type it in the chat box, or you can raise your hand and you can ask ma'am any queries. Yes, Mary, any doubt, please? You can unmute yourself.
Hi, ma'am. Actually, you told now when somebody is telling the problem to a friend, don't be non-judgmental. That I always do that. So I felt that some have some quality. That
very nice.
I recognize that quality, ma'am, because I patiently listen to others. I never give advice so much because each life is different. We are not there to advise. So I just, if it's very close friend only, I give suggestions. So your talk is really mind-blowing for me.
Thank you so much.
So I'm from Bangalore, Mary Florence, ma'am, and very informative. I learned a lot of things, ma'am. God bless you. Take care.
Thank you. So can I address this one doubt? Somebody says,
yes,
how do we
yes,
address?
Please, ma'am.
Yeah. So how do we address children labeling themselves as depression or learning issues? Now, while children may not be able to possibly understand themselves as depression or learning issues, if they're actually raising a point like this, that means that some suffering is there somewhere. You need to address that. You cannot ignore it. So if what perhaps they're talking learning issues will turn out to be ADHD when you do an evaluation. What they're talking of depression may be some kind of stress they're going through. So when a child is pointing to a child, I'm including up to the age of 25, okay? So if any person who is pointing out to a mental health issue and saying, I'm not feeling well, please do not brush it under the carpet. See, you have to validate your children or your siblings' emotions. For example, there was this child who had severe OCD. Now, OCD, is not just about washing hands or checking logs. It's also about having repetitive thoughts. So this child used to have, he was 20, 21 maybe, and used to have lots of thoughts which were uncontrollable and vague thoughts, no particular direction. Parents come and tell me, do you think he's acting because he needs their attention? Now, when you need attention, why would you punish yourself for attention, isn't it? And this has been going on for almost 1-2 years by the time he came to me. So when he is asking for help, he's asking for a solution. Instead of solution, if you start blaming them, they have nowhere else to go. So they will completely clamor. And if it was actually doing it for attention, why is he needing your attention? Why is he doing it for attention? Are you not giving me adequate attention? And maybe we should focus on the parenting aspects also. So there is a cry for help, and you need to address that cry. Yes, there is this Manasa, I'm okay to take your name, I hope. You say it's pretty okay to listen classes for a long time, but unable to listen general conversations for a long time. So, which means that something that bores you, you're not able to pay attention. That's absolutely fine. That does not come under any kind of ease. As long as you're paying attention in class and your academics are not falling, it's not a matter of concern at all.
Okay, ma'am. Thank you, ma'am.
Yes, so we are.
Is he asking me, ma'am, what is successful aging according to you? Okay, successful aging, I think the psychologist will answer you better. From the medical point of view, successful aging is if you have been able to postpone your incoming diseases, which will definitely come. If you are able to postpone your diabetes, you're able to postpone your hypertension, physically active, you're able to move about without much arthritis, and you are able to naturally, therefore, enjoy your time with friends and family and also work. That to me is excellent.
One more question is there from Aarti.
Okay, Aarti says adult does not accept that everyone will be okay with mental health issues. How to manage? I suppose you're saying that if people do not accept that they have mental health issues, what to do with it? Continuously talking to them, convincing them, showing them other people who are successful in highlighting the mental health issues is a very good way to go about it. Deepika Padukone has done us a huge favor by telling about her depression and that she took counseling and medicines. That makes a huge difference. Show them if they can, we can. So they'll live high pressured lives. So if they can, why can't we? Yes. So a very relevant question. So Atika, you can stop me whenever you think you're running out of time.
You can answer.
As a psychiatrist, what do you think is the need for a clinical counseling psychologist? I think we are two arms of the same body. We cannot do without each other. So as a psychologist, I hope you feel the need for a psychiatrist. I think I should put the question back to you.
Right. How to stop having continuous thoughts? Radha is asking.
Radha, continuous thoughts can be of various types. One, you can have a personality which is constantly ruminating. That is genetic, not much can be done about it. Second, it could be having anxiety because of which you're having anxious ruminations. You could be obsessive, so you may be having obsessive ruminations. So you need to understand what are these thoughts, where they're coming from. And I think there will be better people than me to tell you how to stop. I think mindfulness practice every day also helps tremendously in helping your continuous thoughts. I think we're done.
Right. I think no more questions. Everyone is appreciating your lecture. As usual, like we know that how it is very effective and informative. We always pleased to call you, to invite you and to listen to you. It's always a very wonderful experience with you, being with you and listening to you. Thanks a lot for accepting our invitation.
Thank you. Thank you, sir.
Samyukta, continue with the session.
Thank you, ma'am. As rightly Swati ma'am said, always we look forward for your sessions. They are quite engaging. And today's session about, unique challenges faced by adolescents, it's quite thought-provoking. And I really, I felt like it's worth highlighting certain points which you said, like, including the community, I mean, them as a social agents or as a gatekeepers. And it's not that, psychology is a separate entity, we should include the whole community. And the second very important point is about stigma. How we know we need to help them to overcome that stigma so that, they consider, body illness is just like, mental illness. Thank you, ma'am. Thank you for the wonderful session.
So I request the participants, anyone would like to give the feedback? Two people have given the names. That is from Department of Psychology. Samyukta, probably you can initiate with them. If anyone is interested to give the feedback, they would join.
Okay. So now I invite final year student Sajal to come forward and give his feedback. Sajal? Okay, I think it's taking time for him to connect. Okay, I invite Rameshwari Chanu to come forward and give her feedback.
Good afternoon, everyone. My name is Oinam Rameshwari, and I'm a student of MS Psychology final year. And I would like to thank our Department of Psychology for giving us this opportunity by conducting this webinar. All the lectures were very amazing, and I learned a lot. I enjoy a lot when Dr. G. Padmazi talk about the importance of empathy and the importance of understanding and listening to other people and communicating those understanding. I really enjoyed that lecture, and it was very interesting and informative to me. Overall, I learned many things in this seminar. Thank you so much. Thank you, the department, for giving us this opportunity. Thank you.
Mary, she has raised her hand. Would you like to give your feedback?
Yeah, ma'am. Actually, I thank first for organizing this 2 days seminar, ma'am. I learned a lot of it's very different from other conferences. I attended a lot of conference, but in Bangalore, but it's very different and all is very informative. I jotted down a lot of points. It's my sincere gratitude to all of you. Thank you, ma'am, for giving me opportunity to express my gratitude to you.
Thank you, Mary.
Swapna, would you like to give the feedback?
Very good afternoon, ma'am. Thank you, ma'am. In the last 2 days, I think I've been listening to all the sessions, ma'am, and it is such a privilege for us to have great lectures coming up from different parts of our India, especially from the departments of psychology, from psychiatry, and it is a wonderful experience to know more things, what's happening around us, and sometimes we are not even aware of things that are happening with us itself. So I really loved the me time and we time, and many other positive areas of psychology, from where and how our generations have been coming up and how we are been developing ourselves. I think from here, the sessions from the psychiatry, I think those are really needed for all of us, only to emphasize on how and where youth is being suffering after post-COVID, because we tend to see that there's a lot of difficulties in students, especially children from schools and in the college also, we tend to see a lot of difficulties students have been facing. So I think these sessions really helped me to counsel my students better, to guide them in a better manner from what I was before. So thank you so much for providing these kind of sessions for us, to uplift us and to upgrade our skills as well. Thank you, Department of Psychology, Swati ma'am, Anupama ma'am, and other lecturers that who have extended their extra time providing us so much of informative sessions. Thanks a lot. Thank you so much, ma'am.
So anyone else, or should we proceed with the other proceedings? So one more person probably we can think of, if at all anyone wants to speak. Okay. Samyukta, I think you can announce.
So now I invite Dr. Swati, who been director for this 2 days seminar program, to come and give a presentation on a report of a first day seminar. Ma'am, over to you.
So once again, warm greetings to everyone, to all the esteemed speakers who were continuing to listen to the other resource persons' speech, and the participants from across the country. Actually, like there are 480 registrations, and yesterday there were about 140 people who have participated, and today almost approximately, I think from morning to now, it is 100 in number. But if we look across, like the different variations, like from which universities they were registered, most of them are from the South India, definitely, of course, and from Hyderabad, but they were also from Bangalore, Madurai, and some North states, and 1 or 2 international participants were also there. I would have been more happy if all 480 who have registered have been part of this seminar. Definitely, I think things would have been much more effective for the participants and also for organizers. But anyway, we know like what is happening in the online. People do register, but whatever may be the barriers that might be preventing them to attend the sessions. But since yesterday, I have been observing most of the people, whether it is 100 or 80, who have been the part of the seminar, they have been leaving the messages, very engaged, academically engaged in the session, very interactive. They were posing the questions. I think that is what, as organizers, we do expect. It is not just the resource persons giving you the inputs, but definitely like as participants, how we are interacting, how we are trying to get the information from the esteemed speakers, and that is also important. So I'm hereby submitting the 2 days report. So the first day report I'll be presenting, and the second day report will be presented by Dr. Anupama, HOD of the Department of Psychology, Osmania University. It's like you all know, you have been observing since yesterday, but as a matter of the valedictory session, like we need to present in a nutshell whatever has been covered. Probably it would be like a recap also for all the participants who are there here in the session. So the number of participants, as already I mentioned, registered were 480, and participants who attended yesterday were 140, and today it is approximately 100 in number. In 2 days sessions, almost like 11 resource persons have been taking the sessions from different corners of the country, like you have seen from Amity, Mumbai, then one counseling psychologist, and also the president of an organization from Assam, then one from Jammu, then some of the faculties from Gujarat and Delhi. And within the Hyderabad, definitely it's a bundle of resourceful persons. So we had resource persons from IIT Hyderabad, then Central University, then National Institute of Nutrition. And apart from the academic faculty, we also have the renowned psychiatrists. As a chief guest in the inaugural session, we had Dr. Purnima Nagaraj, and now we have heard the sessions of Dr. Sri Lakshmi from Roshni Counseling Center, and she is also a practicing psychiatrist in the government hospital. Earlier, she was at Gandhi Hospital, and now she is working at Karimnagar. So almost 11 sessions have been planned. So the inaugural session was started with welcoming the dignitaries and the participants. So I have expressed the significance of the program. As I have already mentioned to you, like many people were still thinking, why this particular program, are we not completely out of it? But definitely, when you heard from the resource persons, we have seen like how the families were impacted, how the individuals were impacted, and still they are experiencing the biological, psychological, and the social consequences of it, and in fact, even the economic impact of it. So we thought like how the people have to adjust to the new normal, how we can facilitate that a smooth adjustment in the new normal situations, and probably we have to be ready for the next normal also. That also we have discussed yesterday. What is new normal? What is next normal? And Professor C. Ganesh, Principal, University College of Arts and Social Sciences, and also the guest of honor for the inaugural session, he has shared his own experiences, his observations about how people got impacted during the COVID, and the impact on the sociological aspects, the economic consequences. All these things he has discussed in his remarks about the event that is taking place yesterday. So eventually how all those aspects, social, economical, and cultural aspects were also affecting the mental health of the individual has been addressed by him in his speech. Then followed by the keynote address given by Dr. Purnima Nagaraj. She spoke about like how the significance of the mental health is important in the current scenario, how we need to adapt to the new normal situations. She also shared her own experiences, like how people are still carrying that health paranoia that is still existing among the people even after the post-pandemic. And then issues like OCD, how rampant it has become because of the continuous washing the hands and other things. And the anxiety, not only anxiety, she also spoke about PTSD, which some of them were suffering as they have lost some of their family members, the near and dear ones. And the depression was already there in the society, but this pandemic has also resulted into the increase of the depressive cases. So in this context, like she also emphasized the need to develop skills like psychological flexibility, resilience, importance of self-care. Self-care has been insisted by most of the resource persons. We can understand the significance of it. Then here and now mindset, generally we try to reminisce whatever has happened decades back, but the importance of here and now, and all these things, how they facilitate to adjust to the new normal situations. Then the session 1 has been taken by Dr. Ritu Sharma. She worked as the Dean Faculty of Liberal Studies at Pandit Deen Dayal Energy University at Gujarat. So she also expressed the need to have like extensive discussions on themes like how to enhance the mental health, how we have to cope with the situations in order to facilitate a better mental well-being, especially in the new normal situations, and how these psychological issues are taking a silent impact on the youth post-pandemic. She also drew our attention towards the importance of going ahead with a proactive approach. Another important aspect that we have seen is everyone spoke about the positive psychology skills. So that is the need of the hour. So we need to focus on self-care using the positive psychology skills. She concluded stating what we consume mentally and also the need to pay more attention to listening and observations for a good body, mind and body framework. The second session was taken by Dr. A. Jagadish. He was from Apollo Hospital. I think you all remember, like he spoke about many physical aspects, the physical situations and the smartphone addictions, the excessive use of the earphones, how it is taking its toll on the physical well-being. And he shared a lot of case studies with regard to the physical health and also how that is eventually affecting the mental health. Especially like he has been mentioning, like there has been an increase in the usage of anti-anxiety and anti-depression, anti-insomnia drugs globally. And that is an indication like that the mental health of the individual has declined during the post-pandemic and also after the post-pandemic. He also listed several ways like how the parents and also the primary caregivers have to listen to the adolescents, encourage the adolescents to talk to them, so that like it is easier to deal with the negative effects that the younger children are experiencing. Then we have the next session by Dr. Sangeeta Goswami. She is a practicing counseling psychologist and also the president for the Mind India organization. She spoke about understanding self and emotional well-being during the post-COVID scenario. So she gave many tips as to how we can handle the situations, like examining our own belief systems, our own thought processes, and what sort of behavioral aspects which we are exhibiting, and trying to challenge our own negative beliefs and thoughts, and how we can develop the positive coping mechanisms, then indulging in self-care activities like giving me time. We also discussed about me time, we time. Most of the practitioners have focused on this. So how we can use the me time for the better self-care, then setting boundaries for majority of the aspects, like to what extent we can really think, to what extent we can ignore the situation, then practicing mindfulness, seeking help when needed. All these things can be taken care. Then yesterday we concluded the first day seminar with the last session by Dr. Chand Grahan. She was the founder of CareNorth Psychological Counseling and Training Center. She coped with the mental health during post-pandemic times. She gave a lot of information, like her own observations, her own case studies as to how like children and adolescents are facing the problems academically. And during the pandemic, because they were at home, how like after the pandemic, when they have to go to the schools or the colleges, that they have forgotten the skills which they have learned as students. And smartphone addiction has increased. They were indulging more into the pornography. So she gave the percentage, the statistics and the causes and the tips as to how we can overcome all such kind of the issues. She also stated that the pandemic has emphasized the need for learning basic survival skills. In fact, that is the most important thing, whether we are in the pandemic or whether we are not in the pandemic, and need to be self-empowered, self-acceptance, and then cultivating skills like kindness, forgiveness, and being patient. In fact, like most of the resource persons emphasized on this point, that during the pandemic, we lost many things. But at the same time, pandemic has also taught us number of things, especially traits like how to be patient, being kind to the others, whatever limited things you have, how you have to share it with the others, forgiveness, such kind of the traits. So with this, like the day one report has been completed. Now I request Dr. Anupama to share the day 2 report.
Thank you, Dr. Swati. I hope I am audible to all of you. Dr. Swati, may I request you to continue sharing the PPT so that, yeah, I can.
No problem. I'll share it.
Thank you. So, like I have been observing, and I have been part of the seminar for last 2 days. And Dr. Swati ma'am has just presented the report for the first day's sessions that we all had. I would like to just summarize on the day 2's sessions that we have. Am I visible? Oh, okay, ma'am is presenting. No, okay. Yeah.
You're able to see?
Yeah, I can see the PPT. Fine. So we had our morning session started with Dr. Rekha Vagani from IBAS Institute, and all of you had a overview that she has given about how the youngsters are affected and how the academics of have been affected, and there was a lot of increase in health complications. And yes, as we all are very being part of this seminar, we also understood what has happened to our own minds being in academics. So there is as being part of it, going through the all effects of pandemic, and also trying to understand it, and playing this dual role was something which we all went through. I think ma'am was able to accurately summarize and present her views and understanding about that. One emphasis that she has given, which would be helpful for all the students, is how to have these buddy programs, is what she has was the takeaway from her session. And following with that, we had a very experienced professional from the academics in psychology, Dr. G. Padmaja Madam, who is the head for Center for Health from Hyderabad Central University. And when experience speaks, it's really very helpful for anybody, because we are all connecting from theory to practice here during this 2-day seminar. And I think ma'am was able to help us travel across from theory to practice, while she was emphasizing on different types of empathy skills. She happened to also talk about different kinds of fears that predominantly people were experiencing, that is FOMO and FONO. And she emphasized about all different kinds of empathy skills, which are very, very important at personal level and also at professional level, which can build our interpersonal skills, with giving a lot of examples, quoting case studies. I think that was very helpful kind of a session for all the students, aspirants and practitioners here. So moving on, we also had the next session by Dr. Mahati Chittam from IIT Hyderabad. Like I think all youngsters were able to connect to her, where she talks about how life looks, what life looks like for young adults after or since pandemic. Yes, we've been talking about a lot about pandemic, and a lot of information has been there, but specifically how this has impacted on the emotional selectivity, and what kind of compassion should we have. And she emphasized on 3 keys in self-compassion. Again and again, these topics have been presented to us from different perspectives, like mindfulness, self-mindfulness, kindness, common humanity, and she also spoke about self-compassion versus self-esteem, and positive rumination, how these all help or make us understand about our own lives and look inside. I think it was also a very insightful session that was presented by Dr. Mahati. Followed by that, we also had a session by Dr. Sabiha Alam Chowdhury. Ma'am was from Mizoram University, and I think she also has presented a lot about the most pertinent experience that we all went through, that is the resilience that we all had to have after the kind of major stressful event in everybody's life. I think down the lane, if anybody has asked us about after 5 years or 10 years, which was a major stressful event in our lives, I think all of us would, without any doubt, point towards the pandemic. And Dr. Sabiha was able to make us understand about what kind of resilience skills we should have, so that we can cope up with the stress that we went through, and also cope up with the new normal that is that we are going through currently, and probably that will help us to have a better normal in future. And she talked about meaningfulness and being mindful, and also I think students of positive psychology would recall about the PERMA model, which is a very famous model of well-being. So I think that was a very enriching kind of a session for us. And towards the end, how we all understand psychologically we build ourselves through all this information, but it is also very important that our physical well-being is so builds us. So Dr. Raja Sriswan Mamidi from the NIN has presented a lot of information about what kind of nutritional diets we are supposed to have, particularly keeping in perspective these kind of situations which disturb our health conditions. All human beings invariably in today's time, as we are seeing, are, unless until they're really maintaining good diet, exercise, and peaceful existence, everybody is going through some kind of physical ailment or the other. But now there is a pandemic has left no choice. Even with all of that, if people who are supposed to be very healthy also have been affected with COVID virus. So now how can we how this diet helps us, what kind of nutritional diet supplements can help us, was rightly pointed with a lot of scientific evidence by doctor, and how it helps us to maintain our well-being. Overall well-being is what he presented, and also has very nicely given a lot of suggestions and clarified all the doubts raised by the participants. I think this is also extremely important component when we are talking about any well-being or any aspect of mental health. So the physical health, I think sir's session was also very, very informative in its own way. So I think with these today's 5 sessions and yesterday's 6 sessions, I think we were able to give a comprehensive picture about what all can we talk about under this big topic or area of mental health. And I know 2 days is not enough, but yes, there is always these platforms always help us to have these kind of conversations and dialogues, and I'm sure that we were able to get some insights, especially from like I already said, that theory to practice, what happens from theory to practice. I think all the resource persons, all the eminent persons that have spoken during these 2 days seminar were able to present that to us. So it's not only important that we learn a little bit as psychology, students of psychologists, or people, general public, that we know a little bit about it, but then what happens at a practice level. I think real-time experiences, bringing them and trying to give us that kind of building that kind of a perspective of what we are going through. I think there is a lot more discussions that have to come unfold in future also. And I really commend and appreciate my colleague Dr. Swati for weaving the whole seminar in such a way that all the important aspects have been covered under this particular topic that she has conceived for this seminar, and there were so many takeaways. Like I said, this is a conversation that begins, and I hope that it will continue to carry on in future also. And definitely from Department of Psychology, we will try to see what best we can do. But I think for us, for the department, and for the students and scholars of the department, at least we know that this is a great opportunity that so many people were brought on the same platform for us, that they were able to share so much of their experiences. Yes, a small 1 hour is the least amount of time that we can actually have, but at that 1 hour information was so profound that it really generates a lot of thoughts and on understanding about these topics. So I really appreciate all the participants who have been attending this today's seminar very, very patiently, and I, like so many have expressed positively that they have a lot of learning that has come from this. And I thank the seminar director, Dr. Swati ma'am, for giving me this opportunity to present this second day report. Thank you so much, Dr. Swati.
Thank you, Dr. Anupama and Dr. Swati. For
In fact, I want to thank all my team members. Of course, like Dr. Anupama is busy with the college as the vice principal. Today also she has to attend some cultural event. But still, wherever it is possible, she has always been there during the sessions. She has been listening to it, and even the back end support, always like we discuss in the nights, because morning everyone would be busy. And apart from her support, you have been seeing like Dr. Deepthi, Mr. Vittal, Dr. Cynthia and Ms. Samyukta, who have been behind this and trying to see that the program would proceed very effective way. Of course, there are sometimes like probably hardly one or two times there were some technical glitches, but all of you were also patient with it. Thanks a lot. And whenever we organize, what we request is like, I think it's not just the registration. If you are registering, if you can make an effort to attend, unless there is some serious emergency, but otherwise, like we also will have some kind of an understanding how many participants are there, what sort of programs can be planned. So it would be very encouraging even to us, the more the number. As some participants have expected some more programs, definitely we have that intention to think about such webinars or probably offline programs also, if it is with regard to the counseling. But your participation is also needed. If the participants are ready, we can also think about it. But once we plan and then if they register and if they don't attend, that is very demotivating even for us. So definitely we'll take that consideration. May not be similarly on such topics, but wherever it is needed, like programs on counseling or programs related to positive psychology, we'll definitely look into that. So now I request Samyukta to announce for the screenshot.
Yeah, I request everyone to put your video on for a while so that we can take a screenshot.
Don't worry about the surroundings and all
Yeah.
that. Okay. You can just open the videos just for a couple of minutes.
Good to see you all.
No one is opening the video. We're not bothered about how you are and all these things.
Yes.
Self-acceptance is needed, right? So just take it. Please open the videos. I think hardly.
There are few more still, I think, thinking whether to put your video on or not. Please, we would request you to put your video on. Because there are 2-3 pages, it's taking time to take a screenshot. So please have patience. I'll let you know so that then you can off your video. There are many still, their videos are off.
It's okay. Don't insist.
Okay.
Whoever has opened, it's fine.
Okay, thank you.
Thank you, Samyukta. I think people have been asking for the feedback link. Now you
Yes,
can.
I'll share it right away.
Yeah.
So here is the link. It won't take much of your time, so kindly take time and give your feedback.
Ma'am, should we fill the feedback form now itself?
Better try to fill it right now if possible. We would appreciate.
Okay, ma'am. Thank you.
Okay, I'll share it again.
Samyukta, once again you share it. Some of them got disconnected, it seems.
Yes, ma'am.
Ma'am, could you please share, ma'am? I got disconnected.
Yeah, I think
You already shared.
Yeah,
No,
keep
I got
sharing
disconnected.
2-3 times, Samyukta, so that you know, even if anybody missed out, they will.
Thank you, ma'am. Thank you.
Sure, ma'am. Okay, formally, we are concluding 2 days national seminar program on mental health of youth during pandemic, adapting and coping with new normal, sponsored by ICSSR SRC. I want to thank inaugural guest of honor, Professor C. Ganesh, Principal of University College of Arts and Social Sciences, OU, and Chief Guest and Keynote Speaker, Dr. Purnima Nagaraja, Practicing Psychiatrist. Also, I want to thank guest of today's valedictory session guest of honor, Dr. Pingali Srilakshmi, and Chief Guest Professor B. Sudhakar Reddy. He's a director of ICSSR SRC. Today, sir couldn't make out and attend on the time, but he sent wishes to us. Apart from that, I want to congratulate and thank you both the director of today's seminar program, Board of Studies, Dr. Swati ma'am, and Anupama ma'am, who is the HOD of Department of Psychology and Vice Principal of University of Arts College and Social Sciences, OU. And ma'am, we expect that in future, we get more such workshops, and we always will be there to support. And I also like to thank scholars. Whenever there is any event, they all come together and give their best to support the department and the students of MA Psychology, both first and second year. And the faculty who always been at the back end to ensure that the program goes very smooth. And we extend our gratitude to Shivali, final year student, who always been at the back end and gave information so that work goes smoothly, and the supporting staff. So Swati ma'am, over to you.
Thank you, Samyukta, for a brief vote of thanks, and you have included everyone. So once again, I also thank formally our ICSSR director. Though he is not here, he said definitely we can proceed with the proceedings of concluding the sessions. So in his absence, we have conducted and we are concluding it. So my heartfelt thanks to all my team members, to all the participants who have been part of this 2-day seminar from different parts of the country. And I wish you all the best. Thank you.
Yeah, thanks to everyone. Thanks to all the resource persons, all the participants, and ICSR as a team. Thanks one and all, and have a good future and happy life. Thank you, everyone.
Yes, thanks to the participants, and within few days, you will get your e-certificate.
Those who attended 2 days.
Yes. No. Conditions apply.
Right. Thank you, Samyukta. We'll sign off.
Thank you, Swati. Have a good day. Thank you. Thank you, Samyukta. Thanks,
Thank you,
everyone.
Thank you, ma'am. Thank you all.
Thank you all, ma'am.
Thank you, Swapna. Thank you.
Thank you, ma'am.